The school board meeting will begin in 2 minutes. 2 minutes until the start of the school board meeting. The school board meeting will begin in 1 minute. Please take your seats. Again, the school board meeting will begin in 1 minute.
Good morning, everyone, and thank you so much for being here with us today. The August 16th, 2021 emergency school board meeting of the Marion County School Board is called to order. I'd like to preface our meeting today by saying that we're here together to hear information, problem solve, and make decisions. As adults, we will be the role models our children need to see as we work together to solve our issues. For the courtesy of those listening to the meeting, I am requesting everyone in the audience to please turn off your electronic devices or put them on vibrate. We are the Marion County School District Leadership Team. When we come together to work, we are efficient, effective, and productive. Our three most important characteristics are dedicated, transparent, and individually responsible. To work well together, we must demonstrate respect, confront reality, and be accountable. We will always put students first, and we will all leave a legacy of success. Later in the meeting, up to 30 minutes will be provided for individuals to address the board on matters concerning the operation of the Marion County school system or the school board only. If you wish to address the board regarding an agenda item or matters on which the board customarily takes action, you must first complete a peach form located on the table in the hallway. The procedures applicable for each are on a separate sheet. Madam Secretary, please call the roll.
Mrs. Allison Campbell, District 1.
Here.
Mr. Eric Cummings, District 3.
Here.
Mrs. Nancy Thrower, District 4.
Here.
Mrs. Kelly King, District 5.
Here.
Dr. Diane Gullett, Superintendent.
Here.
Mr. Jeremy Powers, School Board Attorney.
Here.
Please stand for the pledge. I pledge allegiance
To the flag of the United States of America
one nation under God, indivisible, with liberty and justice for all.
I will now ask the school board's attorney to explain the rules governing persons who wish to address the school board this afternoon.
Thank you, Madam Chair. In compliance with Section 286.0114 of Florida statutes, the school board has adopted uniform procedures for public speakers who wish to speak at today's meeting, either regarding one of today's agenda items or a matter relating to the operations of the school district. These procedures will ensure the public has a reasonable opportunity to be heard on school board and school district matters. A written summary of these procedures is available from the table in the hallway. Public speaker forms are also located on the same table. The completed forms were due to the school board secretary no later than 11 a.m. This afternoon, speakers will be called prior to the business portion of the school board's meeting in the order of receipt by the school board secretary. Before you begin speaking, please state your full name and address for the record and spell your last name. Each speaker will have 5 minutes of time. However, if there are more than 5 persons who wish to speak, the board may seek consensus to limit each speaker's time to 3 minutes. When the speaker has 1 minute remaining, the speaker will receive a visual notice from me to complete his or her comments. Speakers may not yield their time to other people. Speakers and meeting attendees are expected to conduct themselves in a respectful manner. Therefore, verbal attacks and profanity are strictly prohibited. Pursuant to the procedures for public comments, speakers are not to identify specific individuals other than themselves or their child, unless that statement has been provided 24 hours in advance. Thank you for your attention to the board's requirements. Chairman Thrower, that concludes my explanatory remarks.
Thank you, Attorney Powers. Ms. Martinez-Lopez, how many speakers do we have?
We have 6, Chair.
So that makes 7. Okay. There are a lot of speakers that are here today that have jobs and need to get back to them. So even though there may be concerns that they have that will be answered throughout the course of the information sharing, I'd like to propose that we go ahead and let them speak first because they do have to get to work. Because we have 7, they are all regarding the mask, which I think we all pretty much know in the community where everyone stands. I'd like to suggest that we limit the statements to 3 minutes instead of 5 so we can move forward with this very weighty agenda. Moved by Board Member Cummings, seconded by Vice Chair King. All those in favor say aye. Aye. Okay, let's go.
Miss Lindsay Ardmore?
Ms. Ardmore?
Maybe in the hallway.
We'll have to get to.
Ms. Ardmore, just please state and spell your name for the record and your address, please.
Okay, my name's Lindsay Ardmore, Lindsey, Ardmore, Ardmore, and 5373 Northeast 2nd Avenue, Ocala, 34479. So I spoke a few months ago asking for masks to be made optional, and you guys listened, and I'm so grateful for that. And I just want you guys to know that I am incredibly grateful and do not envy the position that you guys are in today or any day. But I have watched and I have waited. I have been cautiously optimistic. I have spoken to healthcare workers from the ER at Advent and other hospitals that we attend church with. I've tried to do my research. I cannot ask you guys enough to please continue to let masks be optional. Please continue to allow parents to make the decisions. In an effort to protect families, you are going to be hurting children by mandating masks if you do not allow alternatives or opt-outs or something. Hillsborough County mandated masks last week, and they allowed for an opt-out form and an opt-out option. And I'm standing here going to beg you guys. My daughter is a gifted kindergartner at MSA. She is brilliant. She cannot handle a mask. She has sensory integration issues. She can't focus. She's reading at a 2nd grade level, but she can't focus if she's got a mask on her face. And it's just not fair to her. It's just not fair to her. And it's not fair to the other kids that have other issues like her that don't necessarily look like they have that. I had some things on here that I wanted to say. I just wanted to reiterate the point that last year she went to an unmasked preschool. We did not have one quarantine. She was never sent home. There was rhinovirus or rotavirus or whatever the heck virus at her school that had one sent home at that school. I understand that there are a lot of parents scared. I understand that there's a lot of things going on. But I'm scared that if you don't allow options, I'm going to have to remove her from MSA. I'm going to have to lose that spot. And I desperately prayed for that. We were zoned for evergreen. You can just imagine. I'm just begging that you allow us to continue to have the choice, allow us an opt-out, allow us something so that we can protect our children. Because while you guys are trying to protect all the children in the county, we know our children individually, and I think it's important that we're able to make that choice. And again, I'm just so grateful for you guys being able to do this. Grateful for your service. This is the hardest time to be in schools. I'm from a family of educators. My mom was the vice principal, my sister's kindergarten teacher, my brother's a high school football coach. Like, I get it, and I just am really grateful for your careful consideration. Thank you.
Thank you.
Brandy Sones.
I think she's outside.
Brandy Sones.
Good morning.
Good morning, Ms. Stones. Would you please state your name and spell it for the record, and then your address, please?
My name is Brandy Sones. It's Brandi. Last name is Sones, and my address is 1395 Southwest Obie Ridge Road, Denellen.
Okay, and we've got a timer that'll start right up there, and you've got 3 minutes for your comments.
I just want to thank everybody for their time and our opportunity to actually be able to, address the situation here. It's not more of a question, it's more of a statement. I've been asking in the last 4 days of school, and I know that has been a lot for everybody, including yourselves, down to the teachers and the kids. And I just feel like we are not going to the first protocols that we originally initiated. Why is sanitation not being addressed first before we discuss a mask? That is something that is major to me. A virus is a virus, period. It doesn't matter. Your opinion can be that a mask helps prevent it, but that's an opinion. There is no proof either which way. I can't prove it. You can't prove it. And the medical, field currently right now is in the process of trying to debate that. That is not something that we should even be discussing right now. First step should be, what are we doing to sanitize? What are we doing to actually protect them? What are we doing to actually keep the kids at home that are sick? I think that is the first step. But putting a mask on a child is actually going to cause more of an issue. I don't know how many of you that are parents in here, but I have children. I've raised an adult. I have 13-year-olds and I have 14-year-olds. I've also worked in daycares. I've also worked in other large areas of groups of people. And at the end of the day, people don't keep their hands off their face. I don't care what you put on their face, what you don't put on their face. They're going to touch their face. They're going to spread this. By putting a mask on a child, you're asking them to spread this. So you have a child that's asymptomatic who is now touching their face and has now exposed this other child with sensory issues because they have touched their mask, they have touched their mouth, they're putting their hands in their mouth. I know so many children that are chewing on their shirts. How many of you have gone through the schools and there's holes right here like little billy goats? Okay, what's stopping them from chewing on these masks? So now we have a wet mask with the virus being spread, and they're touching it, they're adjusting it, they're moving it, they're doing this, and now we're touching everything else. We're touching the walls. How about we do that first? How about we talk about what we're going to be doing with that? How about we put the funding and with the research and everything as far as that, how about we start there? If we don't see an improvement in the next week, maybe even 2 weeks, we still have major quarantines, kids are dropping out like flies, fine. Then we can come back to the table and ask about masks. So we need to be talking about how we're going to be addressing any of this for future. This should have been discussed back before COVID was an issue. The flu virus should not have ever gotten so out of control. Parents should not be under the impression that it is appropriate to send their child to school when they have the flu. That is unacceptable. Now we're talking about COVID. How about we just go back to basics? Just go back to basics. If your kid's sick, keep your kid at home.
Thank you, ma'am.
Thank you.
Miss Samantha Shipwash?
She's in the hallway.
Hello.
Morning.
Hi, Ms. Shipwash. If you wouldn't mind, please state your name and spell it for the record, and your address, please.
Yes, it's Samantha Shipwash, Samantha, and Shipwash is Shipwash. And my address is 4760 Southwest First Terrace, Ocala.
Okay, you've got a timer up there. You'll have 3 minutes. I'll count you the extra 10 seconds we're taking here. So
Thank you.
Go ahead.
Okay, I'm gonna read because I'm like super nervous. So, okay, so first I just want to say I appreciate you guys deciding to make masks optional to start school, and I plead with you to keep masks and vaccines optional. When children were dying from the flu, we did not make masks mandatory. The American Academy of Pediatrics quote, among states reporting children were 0.00 to 0.26 of all COVID-19 deaths, and 7 states reported 0 child deaths. I understand people are scared, but let each parent make the decision for their own child. I'm not trying to make no masks a mandatory thing because I believe each parent should decide what's best for their child. This is the United States of America where we have the right and freedom. If we keep taking rights away, where does that stop? Governor DeSantis has said to not mandate masks, so how is this even a question? Keep masks and vaccines a choice. Each of us should have the right to choose what is best for our family. People say, my body, my choice. Okay, fine. My body, my family, my choice to wear a mask or to get vaccinated or not, my choice. Children need to be able to recognize school social cues, facial expressions, and see lips move to form words. Kids get sick, it's going to happen. I got sick with life-threatening things as a kid. Most of us probably did, but my immune system kicked in and I didn't wear a mask and I didn't get a vaccine for it. I'm usually not a confrontational person, but these are my children and I have to speak up. I'm not going to be the only person. Parents are ready to be America again. All these kids going to school with no masks this last week, those parents don't want to them wearing masks. My 3rd grader has not one child wearing a mask in her class. They don't want to. Some people say I'm being selfish and it's a threat to their health. Well, cigarettes are a threat to anyone around and we still allow them. Using a car is a threat and we still get in the car every day. These are our freedoms. Don't take them away. God didn't make us with a mask on our face. He did give us an immune system. Let's focus on taking care of our bodies with healthy food, sun, washing our hands, go to sleep, turn off the screens. Also, if you're not wearing a mask 100% of the time, then don't tell me to wear it at school. Don't have your child wear a mask at school, wear a mask at school and then go to the grocery store or family get together at parties or church or restaurants without it. Just homeschool your kids, you probably say. This is growing our depression rate and suicides. We are created to need people, and I will probably lose my mind if I have to homeschool. The main takeaway here is to stop the roller coaster. It shouldn't be a question. Every single American has rights. Stop bringing this back to a vote. We have rights, period. That should never be a vote. We aren't laying down. A year of masks was enough, no more. And I guarantee you, if you make masks mandatory, a lot of people are going to start pulling their kids out of public school. So
Thank you.
Thank you very much.
Thank you.
Rebecca Busquilio? Rebecca Busquilio?
Hi, and I'm going to butcher this, but Basquilio?
Basiglio.
Okay. You have 3 minutes, and I need you to state your name and spell it and give me your address for the record, and then your timer will be right up there. Okay?
It's Rebecca Basiglio. My address is 14393 Southeast 144th Avenue, Weirsdale, Florida 32195.
Would you please spell your name?
Busciglio.
Thank you.
Good morning, and thank you for your time and consideration. Those of us against forced masking are being told we are acting selfishly and that we don't care about other people in the community. Some go so far as to call us murderers and to suggest our children should be denied medical care should they become sick. Us parents here today love our children, but we also love our schools and we love our community. It turns my stomach to think so many people in our own community feel this way about us. We all want the same things. We want our children to be able to attend public schools safely and to not burden our community with more illness in the process. In order to accomplish this goal, it is important that we identify what things we are able to determine and what things we have yet to figure out. Here are some things that we do know. Transmission rates of COVID-19 among children, particularly elementary school age children, is still very low. The risk of children becoming deathly ill or dying of COVID-19 is still very rare. It's less than that of the flu. And most importantly, schools that mandated masks in Florida last year did not lessen the rate of transmission any more than schools that did mandate masks. If you did not already, please look at the study I sent all of you via email yesterday. We know mandatory masking did not prevent COVID transmission in schools last year. The numbers are there, they are public, and they are accessible to anyone who would like to see them. But what we do not know is what psychological and physical effects mask wearing has on our children when they are required to wear them for 6+ hours a day. The only study I found on this subject looked at the effects on children after only 30 minutes of use. So now I ask you, why should we force our children to do something that has been shown to be ineffective and has not been proven to be safe? How about we focus on things we can do to help stop the spread of COVID-19 in our schools and in our community? Have we thought about asking parents if they have the ability to stay home with their children when they are sick? Could we work on finding ways to help these parents who might be fired from their jobs if they miss work so they will not feel that they are backed into a corner when their young child has a fever? I'll finish with this. If you offered me a pair of scissors, but the scissors couldn't cut paper, I would decline the scissors. Not because I'm anti-scissors, but because I'm not interested in things that do not work. Source unknown. Thank you all very much for your time.
Thank you.
Thank you.
Saguana Stenser? Stenser.
Could we Stennerson?
Hi, my name is Shayna Stenerson. Shainastenersen. I'm just here to ask you guys to please not mandate masks. If you do, I would feel like I have to withdraw my children from school, as I don't feel, as elementary students, one, it would be effective, and I don't feel that the psychological benefits would outweigh the health concerns. Thank you.
Thank you.
Kirsten Angel?
Kirsten Angel, Kearstenangel, address 2055 Southeast 50th Terrace, Ocala. There is a saying, if you ask 4 attorneys for their opinion, you're liable to get 5 opinions. I think the saying can be said of COVID and masks. If you ask 4 people their opinion on COVID and masks, you're liable to get 14,000 opinions. What I know is, despite this, there are some things that I think we can agree on. I think we can agree that we want schools to remain open. I think we can agree that we want the best and safest practices for everyone, children and adults. I think we can agree that we're not going to agree on this topic. Therefore, let me continue to say that there is another thing that I think should guide your decision today, which is a very difficult one. I think we all recognize that. Freedom and choice should be at the heart of the decision. Because we do not all agree on this, and there are good people on both sides that have strong opinions, and you're never going to convince anybody what they should or shouldn't do. But if you base your decision on freedom and choice, people then can make their best decision with whatever information they have from whatever source. If they wish to wear a mask, they can. If they do not have to. If they want to wear 2 masks, 3 masks, 12 masks, let them. But when we all dictate things and mandate things, we get into a whole lot of trouble from a whole lot of sources. Therefore, let me again reiterate, freedom and choice should be the watchwords for this decision.
Thank you.
Dr. David Kuhn.
Good morning, thank you. Dr. David Kuhn, KUHN, 321 Southeast 29th Place, Ocala, 34471. Just a brief statement to go to the email that everybody received. A message of unity this morning. I'm sick of COVID. I know we're all sick of COVID, but here's what I know, is that there's a lot of misinformation out there. We all know it. You know, the mainstream media makes everything seem worse than it is. We have a huge government that likes to stick its nose into everything. There are people who believe that our greatest gift is that we are free. Amazing. There are people who will fight to the death for our Constitution. Amazing. Here's what else I know. Delta's spreading in our schools. That spread is going to get worse. Students, staff, teachers will quarantine frequently. It's already started. Classrooms will close. Entire schools will have to close. This is not the educational experience that we want for our students. They don't deserve it. We're at a point that we have to make a decision. We have to make a decision. Now, hospitals are full. ICUs are full. Right now, this morning, 12-hour waits in the emergency room today, this morning, locally. In order to protect as many lives as we can and protect our rights and freedoms, here's what I think. A temporary mask requirement in schools with an opt-out option as appropriate, as determined by the school board. If there are parents who think that masks don't work or there's an oxygen issue or various reasons that a mask ought not be worn by that student, then that's something that we can think about. It may be able to be in place. I think that we have to agree on something. We have to compromise on something. We can't just fight and fight and fight. We won't get anywhere. And to add to this, I don't want the taxpayers to have to spend another penny on anything about this. I don't want a teacher to have to spend a penny of his or her own money out of her pocket in order to be sure that masks are in place. The doctors of Ocala will be here to support the school board to buy masks for every student that needs one. Thank you.
Thank you. Thank you, sir.
Rose Jenkins.
Good, I think morning still. Rose Jenkins, ROSEJENKINS, address 2319 Southwest 6th Street, Ocala, Florida, 34471. Well, as a nurse in this community for the past 11 years, I'm over COVID. Having a disabled daughter who was homeschooled all last year, but I allowed her because she was going to high school. She's now back to anxiety because the kids aren't wearing masks. I work in it. If your loved one has COVID right now, you can't be there to hold their hand as they're taking their last breath. I'm dealing with it. It's mentally and emotionally exhausting. A mask is not going to hurt a child. Just like we teach our children when they're young, right from wrong. Hey, right now, look, we got COVID out here. We're trying to get this under control. A mask is not going to hurt them. I have to wear them 12 to 16 hours a day. And this is a good one. And the other one, I'm like this right here. How you doing today? It's frustrating. But a simple mask and telling them to wash their hands, and the teachers need to allow them to go to the bathrooms to wash their hands as many times as they need to, especially if they're touching their face, they're touching their mask. But we have to get this under control, and a mask and washing our hands is the only thing that's going to do it right now. Yes, I do think vaccinations are important. Yes, people are succumbing. I'm with my friend right now as her husband, who was a bus driver here in the Marion County school system, has succumbed to COVID. So it's a lot. It's something we can do. I am in agreement with the doctor here for a temporary time until we can get this under control. A mask is not going to hurt our kids. It's not going to hurt them. If they can go outside and play football and be in that heat for 4 or 5 hours for football practice, putting a mask on your face just to protect yourself is not going to hurt them. It's not going to hurt them. Yes, I understand some kids have medical conditions. We'll address that. That's a special circumstance. But for the regular kids, it's not going to hurt them. And it's just going to protect them because they go home, they're asymptomatic. They go home, they go to grandma and granddaddy. Grandma and granddaddy, 9 times out of 10, has health conditions. And what happens? Grandma and granddaddy end up in the hospital. They can't fight it off. So I, as a nurse, as a parent, I'm just asking, yes, a temporary until we can get this under control because we are out of control.
Thank you.
Mr. Gary White.
My name is Gary White. I live at 9280 Southwest 96th Court Road, Ocala, Florida 34481. You know, freedom and choice, those are the backbone of our country. I've heard Dr. Lytle. I've heard Dr. Zelenke. I've heard Dr. Tenpenny. I've studied this since the night that a gentleman came on April 15th and said there was a cure for COVID. The cure, ivermectin, hydroxychloroquine. My greatest fear is the jab, not the COVID. I have the cure. They couldn't allow the cure to be a cure because they couldn't bring the pharma vaccine out early under experimental conditions if there was a cure. And that's exactly the reason that all of these medicines have been put down. In Israel, they have banned ivermectin and hydroxychloroquine. Dr. Lytle, who spoke here and told you that the mask was a ridiculous issue, has treated over 750 people and not lost a one to COVID. The gentleman, the rabbi I listened to this morning, had treated in excess of 6,000 people on COVID and had never lost a one. Early treatment with ivermectin and hydroxychloroquine will heal you. It will definitely keep you out of the hospital. The best thing that can happen to your child is to get COVID. Oh, how could he say that? The best thing that could happen to your child is to get COVID because he'll be 1 billion times more resistant to future variants than he ever would be with a shot. And if you give your child, that's what I'm afraid of with this. If they mandate this, when are they going to mandate the stab? When will that happen? And the the characteristics of the stab are incredible. Little kids 3 months out having, it's just, it can't be done. It's like child sacrifice. So please, let our parents have freedom of choice. Go out and find what ivermectin and hydroxychloroquine are and how to get them and how to use them. You can be cured of this terrible thing. You got hospitals locally that have shut down the use of these medicines. You know where you get, I'm going to tell you a great story. You know where you get ivermectin? At Rural King, at the Tractor Supply. It kills ticks and tapeworms in the body of animals. If your body's not fighting those ticks and tapeworms, it's got lots of...
Your time has expired.
Lots of characteristics for killing the antibodies for killing the COVID. Thank you. Thank you all very much.
Thank you, Mr. White. That's it. Okay. May I have a motion to discuss COVID-19 updates?
So move.
Moved by Board Member Cummings.
Second.
Seconded by Board Member Campbell. Dr. Gullett.
Good morning, Madam Chair, members of the board. Thank you. I believe that we'll start. We have a number of presentations to provide to all of you with our current protocols, strategies, procedures, and we would like to start with our external partners. I believe that Mark Lander is supposed to be on the call. Is he on the call? So we would like to begin with Mark Lander.
Great.
Department
Good morning, Mr. Lander.
Good morning. Can you hear me?
Yes. Keep
All
speaking
right.
up.
Okay, I will put the phone a little closer to me so you guys can hear. Let me know if it starts to get difficult. I'm going to give a brief overview of the last week of cases, vaccinations, and then move into real quick general protocols that were explained in Emergency Rule 64 DER 2112, the protocols for controlling COVID-19 in school settings. And then I apologize to the group. I had an 11:30, but I pushed it to 11:45, so I'll try to get through this as quick as possible.
Mr. Lander, you're fading a little in and out, so if you would, just please try to speak up as clearly and succinctly as possible, sir. Thank you.
Absolutely. Last week's cases, 2,650 in Marion County. The week before, we were at 2,400, so we had a 200 case increase. Our positivity rate was 27.4%, and our average per 100,000 per week was 712 cases per 100,000 per week. The previous week, we were at 27%, so you can see we held pretty consistent with our positivity rate. I can tell you with vaccinations, we have now vaccinated over 184,900 individuals in Marion County. Of that age group, 12 to 18, 8,210 have been vaccinated. 12 and up, 57% of our community. 65 and up, 81% of our community. And we did provide 4,740 new vaccines last week to individuals, which was up from 4,500. So you can see we've gone up in vaccines, but the concerning piece is our cases continue to grow and positivity rate remains high. I would like to go over real quick the emergency rule, Division of Disease Control, that was signed August 6th of 21 by the State Surgeon General. I'm just going to cover one section for the board for understanding. It's the general protocols and definition section, and it reads, the following procedures should be instituted to govern control of COVID-19 in public schools. A, schools should encourage routine cleaning of classrooms and high traffic areas. B, students should be encouraged to practice routine hand washing throughout the day. C, students should stay home if they are sick. D, students may wear masks or facial coverings as a mitigation measure. However, the school must allow for a parent or legal guardian of the student to opt out the student from wearing a face mask or covering. And then finally, E, for purposes of rule, direct contact means cumulative exposure for at least 15 minutes within 6 feet. That is just one of 6 sections that are in that rule, and I believe the board has seen the rule, but that was signed on August 6th by our state surgeon general to offer some guidance on mitigation measures in school. Do I have any questions from the board?
Mr. Lander, this is Board Member Campbell. I know you've given a positivity rate. Can you also give us a number of tests that have been administered on a weekly basis to get to that positivity rate?
I can look. Let me give you an example over. Hold on one second. I'm pulling that up.
Thank you.
Mr. Lander, this is Nancy Thrower. I'm hearing in the community that there is increasing difficulty for getting tested. Would you please reiterate the livestock pavilions plan in partnership with the Department of Health?
Yes, for general population, we had started the livestock pavilion on Wednesdays. It is now open Mondays and Wednesdays from 8 a.m. to 2 p.m., which should alleviate some of the traffic off of our other partners that we're testing, our CVS and Walgreens. There's also a plan in place if the numbers continue to be high to look at 5-day-a-week testing through another vendor. But right now it's livestock pavilion Mondays and Wednesdays from 8 a.m. to 2 p.m. And we also offer the additional school testing for teachers and students Fridays at 9 a.m. at the health department.
Thank you. And last year, school board employees, I believe, and school-age children, I think, were being prioritized. Is that happening?
We have those tests being run and sent to our state labs for prioritization to be able to get the children back in school quicker.
Great. Thank you very much. We need the same for our employees as well, please.
No, absolutely. It's done with the school. All the school testing is sent to our state lab. And to answer School Board Member Campbell's question, it's around 1,500 tests a day we're looking at to get to that positivity rate.
Thank you.
Mr. Lander, this is Eric Cummings. You said that they're doing priority testing for school board students? For students?
We have run our, as we did last year and this year, we run all of our school board tests, and for the school staff and students, we run to our state lab.
Is it just on Fridays? Because what I just heard is that they only test them on Fridays.
No, we run them through the livestock pavilion as well, and their paperwork is, when they bring in the paperwork, it is separated out.
So there's no priority, there's no special line for those students. They have to either wait for a Monday, Wednesday, or Friday at the health department, correct?
No, they can go Monday, Wednesday to the livestock pavilion, and we take the paperwork that they turn in, they're given at the school, and those samples are pulled aside.
Okay. Mr. Lander, I'm sorry, I have another question.
Yes, go ahead.
So can you give me the process for how this works as far as with the contact tracing? Because I'm really having some issues with that as far as if a kid tests positive. Can you tell me how the process for that contact tracing?
If a student tests positive, we have our contact tracers working with the school liaisons. Every school should have a COVID liaison to help identify individuals who may meet the definition of close contact. So and at that point is when, and then we have to verify at the same time before making those calls if the student has been vaccinated or not.
So my question on top of this is, if a kid tests positive at a hospital, how does the health department get notified? Does the hospital notify them, or is it the responsibility of the parents to notify?
No, we don't. We get notified of the positive result. It drops into what, and we call it dropping into our system, and we would make that phone call. And at that point, the parent would identify. When we speak to the parents, they identify the school. If we ask, does the child attend school? Once we find out the child attends school, then that's where our contact tracers work with the school liaisons to determine who may be a close contact.
So how many days is that? What's the time frame of turnaround for notifying that school?
It's based on once we get the identification that the child is in school, we immediately notify. But to be honest with you, Board Member Cummings, it's really dependent upon the time it takes to get that positive result into the system, and that could vary.
Could that vary? Could that be 4 or 5 days?
No, it should not be 4. It should not be 4 or 5 days.
Okay, I'm glad you said should not, because it has.
Yeah, it should. I'm not saying it couldn't, but it should not. If the system's working properly, it should not take 4 to 5 days to get that notification.
So then, if a parent has a child that tests positive, and it has not been notified to the school, to the health department, that means that parent can still bring that, or we've had this last week where parents still brought those kids to school positive, and the school had not been notified.
And that may happen at a physician's office where they may get tested separately. That physician gets the results back, and if it's not notified immediately to the health department, then yes, you could get a situation where you may have several days out. But the understanding, and this is what I think we've tried to do even through messaging with the school board last week, that if your child tests positive, they need to be out of school. Don't bring your child to school.
Right.
If they've tested positive, regardless of whether they're symptomatic or not.
Right. Thank you.
Mr. Lander, this is Nancy. What about students that have been tested and have not gotten their results yet? Should they also be staying home until they get results?
Absolutely. If your student has been tested and they were symptomatic and they've been tested, even if their symptoms resolve, they do not need to be back in school until they've received their results showing that it's a negative result.
Okay, so if they've been tested and they're asymptomatic, am I hearing you say that it's okay for them to come to school?
No. If they've been tested for a reason. If there is a pending test, they should not be at school until they receive that test result.
Thank you, sir.
Yes, ma'am.
Anything else, Board? Anything else, Mr. Lander, for the good of the cause?
No, ma'am. Again, everyone can do and needs to do their part and work together on keeping our schools safe. So we appreciate the efforts of the school district.
Mr. Lander, this is Aaron Cummings again. Question. Because you guys are watching the trends of this virus, is there, and I know you watch it daily, are you seeing any time frame where you're going to see a peak or anticipating some type of peak to this virus for this round?
For this round?
Yes.
Looking at the numbers, you're starting to see, we're already seeing, I'll just use the term like this, I'm starting to see the curve, while the cases are increasing, the curve is starting to flatten out. I would hate to give an estimation. In other words, we were having if you look at the spike of cases per week and the positivity, it had jumped up tremendously in the past 6 weeks. We're starting to see that curve flatten and still remain high, which is a problem. But I would hate to give an answer on a peak, other than to say we are seeing the trend start to flatten.
And normally when it peaks, it does plateau for a while, meaning it could still possibly be high for several weeks.
It could still be high for several weeks before we start to see those decreases.
Thank you. Thank you.
Right, I thank you for that question, Board Member Cummings, because what I'm hearing is that we may be reaching a plateau, which means not going any higher, which is encouraging, but that we may remain at that plateau for a period of time yet to be determined. Thank you.
All right, hey, everyone, I have to jump off to another meeting. I will have a wonderful day, and I believe we will maybe speaking again this afternoon.
Thank you.
Thank you, sir.
Yes, ma'am.
Dr. Gullett.
Thank you, Madam Chair. So we requested some information as well from Advent Health and Ocala Health for the data at the hospitals, and the representatives were not able to attend. However, it asked for Lauren Debick, our community Engagement Director, to provide an update on the information we received from Advent and from Ocala Health. Thank you.
Good morning. Understanding that I'm not a representative of either healthcare facility, I did reach out asking what their current trends were in the hospitals. Advent Health Ocala did send a written statement, which I have if you would like to take a look at it. We are waiting for Ocala Health's statement.
Okay, would you be willing to just read that into the record, please?
Absolutely. To whom it may concern, Advent Health Ocala continues to see a surge in COVID-19 hospitalizations, and the number of COVID-19 patients hospitalized at the facility has doubled since January 2021. The average age of our hospitalized COVID-19 patients is approximately 59 years old. More than 90% of our hospitalized COVID-19 patients are unvaccinated. While we have sufficient capacity and supplies to care for patients, the increased patient volume has been emotionally, physically, and mentally taxing on our dedicated and impassioned team members who have been working for the past 18 months to provide the best care to this community. As schools across the state reopen, we continue to urge adults and children 12 and over to get vaccinated. Many children returning to school aren't able to be vaccinated, and one of the best defenses for parents to help their child in the event their child contracts the virus is to be vaccinated. In addition to strongly encouraging vaccinations, Advent Health Ocala has urged the community to consider monoclonal antibody treatment if they are COVID positive and meet criteria. We have completed more than 400 monoclonal antibody infusion treatments since January, and we have successfully been able to keep those patients from requiring hospitalization. We continue to encourage the community to get vaccinated if they can and wear a mask to help us limit the spread of COVID-19. With gratitude, Michael Torres, Vice President, Chief Medical Officer, Advent Health Ocala.
Thank you very much, Ms. Devick, and it's not a surprise, even though they were invited, it was short notice, and obviously they have a lot going on in both hospitals, so it's wonderful that we were able to get that information via your position. Thank you so much.
Thank you. So I would like now for our team to move into our current data. We have Andrea Simmons here and Jonathan McGowan who will provide updates on that. Thank you.
Morning.
Morning, Chair Thrower, board members, Superintendent Gullett, Attorney Powers, and Mrs. Martinez Lopez. Thank you for allowing us to speak with you this morning. As Dr. Gullett just mentioned, we've just heard from our community representatives and our COVID-related data from our community. We want to now turn our attention to our internal student and staff related COVID data as we began the 21-22 school year last week. So with that, I'll turn it over to Ms. Simmons, who will review that data with you.
Thank you. Good morning.
So everybody probably saw this already this morning. It did go out by email. So for Marion County Public Schools, the COVID-19 related data that was reported for August 10th through 13th is also on the screen. We had 139 positive cases reported within our schools, 93 students and 46 employees, with 531 direct contacts reported as being quarantined, which included 456 students and 75 employees. Just to further break that out a little bit for the direct contacts, because that number does include those who are direct contacts to a community case, which could be a parent, a family member, after school program, whatnot. There was 394 direct contacts to the positives that were in our schools. So 394 people were excluded from school or work as a direct contact to a positive case that was within our walls on the 10th through the 13th.
Wait. Say it again.
394 direct contacts to positive cases that were identified at school. So they were tested Wednesday, Thursday, Friday. They look at the 48 hours before that. And if they were around that person for 15 minutes or more at less than 6 feet for the cumulative 24-hour period, they were excluded as a direct contact.
Would you tell us a little bit about the breakdown of the 93 students, elementary, middle, high?
Yes. So students, elementary, 48 positive cases reported, middle schools, 22, high schools, 23.
Thank you. And is it drilled down as far as grade level?
I did not.
Okay.
Because that data doesn't get entered. I'd have to look up each individual student ID to find their grade level.
I understand.
said those were positive cases?
Correct.
48 elementary,
Yes.
22
Middle.
middle?
And 23 high.
Gotcha,
And that's how you come to the total of 93 positives.
gotcha.
Do you happen to know how many of those positive cases were actually at school sent home because of COVID-like symptoms and then tested?
I don't have a way to correlate the two. I do know that we did send home over this last week 154 students from our clinics with COVID-like symptoms, which ranged from sore throat, abdominal pain, vomiting, diarrhea, fever, body aches, headache, and cough. But 154 kids were sent home through the clinics with symptoms.
Do you know, Ms. Simmons, how many kids showed up at school last week that had already tested positive?
I don't know an exact number. I know of 5 that I was made aware of, but I don't know an exact
But
number.
they were
no.
sent to school knowingly
Correct.
with COVID, correct?
Correct.
Talk to us a little bit about the comparison from this time last year, because the numbers are certainly different.
And I think that reflects what's going on in our community as well. I can't 100% speak to what our positivity rate was last year, but I want to say when we started school, it was somewhere around 10%. So with a difference of community spread of 10 to 27, we obviously have a lot more cases in our community right now. So we do have a lot more cases in our schools.
I think I read and understand that last year there were about 16% less students on campus compared to the start of school this year.
The area directors probably have a better idea, but I know that we do have a lot more students on campus now than we did last year at this time.
Chair Thur, I also actually looked up this data this morning because I was curious. As we know, summer vacations and summer students going to theme parks and all of those things that were happening also at August 10th through the 14th last year. And so our community numbers were actually higher during that week last year. But I also looked at community numbers from August 24th to 27th of 2020. And our community numbers were actually in the 500 range. So where our community numbers today are in the 2,700 range, we were only in the 500 range as our community was on that 2 weeks difference. I mean, I remember that the decision was made to have our employees have an extra couple of weeks of professional development. Those extra couple of weeks actually also were whenever we had a stronger spread in our community, and that has actually changed looking year-to-year data. If we're looking year-to-year data from the school district, looking year-to-year data community-wide as well. And then the community last year, during August 24th through the 27th, when we started school, we were only having about 500 positive cases a day in the community.
More now.
Madam Chair, if I may, Kevin Christian has joined the table. He has additional information to share, and then we'll also talk about communication protocols and how we're enhancing those.
Thank you. Vice Chair King, did you have something?
Well, I was just, while we were talking about the community spread and stuff, I know we have Dr. Kuhn in here, and I don't know if he...
Those are his numbers. I pulled them off of his reports.
Yeah, but I wasn't sure if he was planning on staying or not. But I spent, on Saturday evening, maybe about an hour, so we had very good dialogue. And as a citizen that doesn't understand COVID, he did an excellent job explaining how contagious this isn't. Dr. Kuhn, if you don't mind, could you maybe share how this year is different than last year with the spread and how quick and peaks? Because that helped me understand, and I think that could help others too.
Sure, it's a great question. Important to note the difference between, the germ that we're dealing with right now. We're about halfway vaccinated. So why in the world would our numbers be spiking so high, right? It almost doesn't make sense. You'd think that we wouldn't be spiking as high because we're, halfway vaccinated. Well, it's because Delta is significantly more infectious than the previous version that we were dealing with, in June of last year. That initial spike that we had, and it kind of trailed off into August. And, those numbers were actually on the decline in August at that point, and it kind of hit a low around October. So if you look at Delta, it spreads about as easily as measles does. Now imagine if none of the children were vaccinated with their MMR and measles got into a school. It would run through the school. It would absolutely run through the school. It's more infectious than smallpox is. Incredibly, it's more infectious than smallpox. And so because the number of targets available, still available, and so that's a person that does not have strong immunity or any immunity at all. About 100,000 people, plus minus, there's no way to know the exact number, but that's an approximate number. That was available in Marion at the beginning of this spike. And we've had about 12,000 cases or so, I think, approximately here over this big spike that we're in now. So there's still plenty of people that have yet to be infected. And so I think we have to keep that in mind as we're planning this as well. If you look at the behavior of this virus, we watched it spike in India at the beginning of this year. Spiked really high, really fast, really bad. It was in the news everywhere, but then it dropped off really quick. It happened again in the UK. This is the same thing. It spiked up high, but then it dropped off quick. But what's a little different for us is that schools are starting right at our peak. And so then it gets into the schools. It's going to spread among the students. It already is. Of course it's going to, especially if we're not masked. Of course it's going to spread. But then the students are going to bring it home. The home is the most likely place you're going to catch COVID. It's not the grocery store or not these other places, even though it can happen there. But in your home and in your work is where you're going to is the most likely exposure. I hope that answers the question.
It did. I just think it's good to give that backdrop of why, because, when we're comparing last year to this year, you just did an excellent job helping me understand, and we don't know to ask those questions as you would. So thank you.
So before you go, so for the record, this variant of COVID-19 is what, 9 times more infectious than the prior variant?
I don't know if it would be quite that high. It's determined by the R0 is what it's called, and so that's how easily a virus spreads. And so if you look at the initial R0, the R0 is a number that one person would spread to how many other people, right? And so the R0 of the Delta version is around 8 to 9, roughly. It depends on the behavior of the population also, of course. But yes, that's a good bit more infectious than the previous version, at least by a 3x, maybe a little bit more than that.
So among unvaccinated people, even vaccinated, because vaccinated people are still getting it as well.
Absolutely, they are.
So it's a greater probability that more people are going to get this variant.
Yes, that's right. It's a part of the hope that we had, with the vaccine originally, and when it came out, that was pre-Delta. And so we were hoping that the vaccine would work to stop the spread. So if you got exposed, but if you were vaccinated, you wouldn't be able to generate enough, virus to spread it around. That's not the case with Delta. If you get infected and you're vaccinated, and you don't have strong enough immunity, it replicates in your nose. It's a mucus virus, a mucus membrane virus, so it'll do its work in its nose. For a day or 2 or 3 on average, there's a potential to spread even if you're vaccinated, obviously for sure if you're not.
Thank you.
Anything else?
Thank you.
Thank you, Sarah.
Good morning to each of you, and I will try to talk loudly through this mask. Since all eyes are on the screen, I want to share one other difference about these two reports. Of course, this is from last year. You will see here the schools or the departments that were impacted, okay? About 2 weeks after this report came out, we reformatted to include a second page where all of the affected schools and departments were shown. And I will show you that if my eyesight will allow me to click the right things. There we go. Okay, so since we're still on the weekly COVID-19 report that Andrea shared, this is on our home page. I don't know if you just saw that, but one of the banners here at the top, right here, I can't drag it over, but it will rotate to the center of the screen between the 3 of them. You can click that. This is where those reports will be posted in addition to emailed and shared in other methods. You've seen this first page. This second page is the generalized location list, if you will, of schools that are impacted by positive cases. Only positive cases. These are not quarantined locations.
Is there any way to enlarge that?
Yes, ma'am, but not from there.
Thank you. There we go.
I should just bring that keyboard with me. That might make it easier. So really, we are continuing the report from last year. We had stopped it at the end of the school year. We have started it up again. The biggest difference is that it will come on Mondays instead of Fridays. And the reasoning behind that, if you recall, last year's reports ran Friday through Thursday. We're trying to make it more logical and run it, what do we say, Saturday through Friday. So you have a full school week included. You don't have one day on this report and 4 days on the next report.
Right.
So.
And people were looking at that because they were asking on Friday,
Sure.
you know, where's the report?
Sure.
So that's great information for
So
them.
it's already posted. It will be posted to the website by noon of each Monday. That's the goal. Sometimes the numbers and the behind-the-scenes processes tie it up a little bit, but that's the goal. Mondays by noon, to have it shared publicly and sent out. It was sent out district-wide this morning, obviously to media contacts as well who had requested it. And we're going to make it available through Skylert messaging to parents.
Oh, good.
So parents and families, the strongest need we have right now is for accurate contact information. And we're encouraging families to go through Family Access. That's the portal that they can use to access their students' grades, attendance, all those kinds of things. But it's also the portal where their contact information for us comes from as a district. So they need to make sure that their contact information, telephone numbers, email addresses, texting numbers are all accurate and up to date. That way they'll be sure to get this information each Monday. Okay? Any questions on that weekly report that you see there?
Will the weekly report also be on each individual school's website?
We can put it there if that's the desire. Yes.
I do think a lot of parents go to their individual school's website,
Sure.
so
Okay.
just a suggestion.
Yes? You just write that down.
Is it also possible to include on this report the number of students and employees working on those days? I'm just giving an example. So we had 139 total positive cases last week. 93 of those were students. And our 4-day count for students was 40,852. So I'm just curious to know, for community transparency, if it would be possible for us to show the number of students that we had in school and the number of positive cases we had. Same thing with employees, perhaps 5,000 to 7,000 employees with 46 of them testing positive. I think that helps from a transparency standpoint, because when we're saying we have 531 people out or 456 out on quarantine, to understand what 456 looks like in comparison to the almost 41,000 students that we had, I mean, that's 1%. So I mean, that's a
It
number
does,
to know.
yes, that does help, I agree. And if they were widgets and not children and employees, I would be a lot less concerned. But you raise a great point. Thank you.
I'm hearing that. It does sound like you're trying to play numbers games with this. Why people come to work, people come to school. We know that. The numbers are right there in front of our face. We know we expect that we have 43,000 or whatever it is, 30-some thousand students in the school this year, and we have 7,000 employees. Whether you had all of them there that day or not, that's irrelevant to me.
The relevance to me, Reverend Cummings, is the fact that we've been talking numbers all morning long. We've been talking community spread numbers. We've been talking, I mean, this is numbers. This is
Are we
what we're
trying to-
talking about. No, sir. No, sir.
Are we trying to pencil whip this thing?
Let's take turns talking, please.
I'm trying to just say that the community at large, we know 7,000 employees, we know 41 to 43,000 students, but the community at large gets this report out every week, gets it in the newspaper, gets it on Facebook. They don't know what the numbers are in context. I'm just trying to put them in context. That's all. We've talked about the number of hospitalizations and the number of hospital beds that are available. While numbers are being presented, I would just prefer all the numbers.
When we asked about the number of hospitalizations, did we ask about how many people were in the hospital? No. We're trying to pencil whip numbers to say something. The numbers are what they are, point blank. But whatever y'all want, if that's what you feel that's going to be so transparent, we didn't ask how many people were in the hospital. We want to know how many people were in there for that specific disease or that specific sickness. So if you're going to ask for those numbers, ask for it across the board. Be consistent. Don't be inconsistent with this.
I believe it will show consistency if we show the number of people that were in our schools.
And let's keep in mind, too, what these numbers represent. Once again, these numbers represent children and people, adults. Bashir King?
I would like to see us get back on track and focus on what's at hand here, and that is that we have a pandemic inside of our schools and most certainly in our hospitals, and we have a community issue that we need to help navigate through. So if we could just focus back on what our ultimate goal is and what we're trying to achieve, I'd like to see that.
And I believe we are here to bring the case to the community that we have tremendous concerns in our school system after the first 4 days. We have a very large number of quarantines. That means that kids are missing their education. I believe we have way more routes than we have bus drivers to cover them, which is an ongoing issue, but is exacerbated greatly with this situation. So yes, let's keep our mind on our matter.
All right, I'm going to go back to the website. We have posted some information that the area superintendents will be more detailed with in a moment, but I want to show you where that is at on our homepage. It's hard to see, but this says COVID protocol, the orange tab on the homepage. When you click it, it takes you to checklists for both elementary and secondary. These already appear on school websites. If you go to any school website, I'll just pick Anthony since they're first. You'll see it right here as well. This page is trying to load. You'll see the same documents there. So it's for every school and at the district level. I'd like to, at this time, may I go into some additional communication efforts that we are undertaking? Yes. Obviously, our Skylert messaging system, as I mentioned earlier, is our primary communication tool. That's how we're sharing COVID-19 protocols, the precautions, the latest concerns that we have. Good example of how effective it can be was last Thursday night's joint call between Chair Thrower and the Florida Department of Health in Marion County. You've already referenced that this morning. I've received a lot of positive feedback on that call. We also, as I mentioned, are going to share the weekly COVID reports via email through that Skylert messaging system and other information as it's needed as the situation warrants. I've shared with you our homepage, the orange tab there. Just some other information. We do have a page within our website. It's marionschools.net/coronavirus that has basic information about the coronavirus, additional resources, including the CDC, Florida Department of Health, and several other web links that they could go directly to. It outlines some of the precautions that we're taking as well as a district. Finally, I would share that we will continue to use our social media, which is Twitter. We will share information on there on a regular basis. You have seen the COVID-19 signage that is posted throughout the district and at schools. We are using up the little supply that is left in the warehouse, and we are already on track to reorder new signage with the updated logo. Obviously, those signs are paper and they do wear out. Even the floor labels that you see and the directional arrows, they wear out too when the little kids walk all over them, and that's what they're designed to do. So we're reordering more of those so that we'll have ample supply for each school. There is a signage order form that each principal has already received. They fill it out electronically. It goes to my office, and then it goes to the warehouse. They put that order together, put it on the courier, and it's delivered to the school. and that's based on the individual need of that school. Obviously, Westport and Forest typically request the largest amounts because geographically they have more space than most of the other schools. But that is kind of a bird's eye view of what we're doing to communicate, not just with our community, with our employees as well. I shared that the COVID-19 report does go out to the MCPS global address, so I encourage our employees to check their email regularly as well.
Thank you. Board? Okay, we'll move forward, please.
Okay, thank you. We would like to, at this time, bring the area superintendents forward. They will begin to review all of the protocols, processes that are being discussed and have been reviewed with principals, and some other district staff will join, and then you will also have a chance to hear from some principals directly.
Ms. Simmons, before you go.
You almost got away.
Almost.
Step to the podium there.
Almost. I had to go back to this. What's the turnaround on you guys getting information that kids have been positive before the contact tracing starts?
It's a lot of variables involved. So schools get the information a couple of different ways, one being parent report, the second being a daily fax at the end of the day from the Department of Health. Sometimes a call from the Department of Health if something else goes awry, but generally those are the two methods that they receive. The school then starts looking at seating charts, busing, all of that to do the contact tracing part. When they're done with that, that's when they're reporting it into the portal. They're asked to do that by 5 p.m., but they work tirelessly through the night and over the weekend to get that information and reported to us, because first and foremost is the identification of the contacts.
And so then if they're testing, because I think you said they're testing Monday, Wednesdays, Fridays?
Fridays at the DOH.
So if
or
they
the
test
livestock.
Monday, they should get the results back normally within what?
24 to 48 hours.
24, so possibly by Wednesday
Correct.
at the latest. So,
And the parent will know before we know
correct.
that their student is positive, or that you as an adult are positive.
But those kids aren't supposed to be coming to school.
Correct. And nobody should be at school with the pending test result.
I don't think that message has been cleared. I don't think that message has been stated clearly.
Went out in a Skylert. Maybe it needs to go out again.
Prior to that, and it went out in the Skylert, but I know a lot of people, when they see it's coming from Marion County Schools, some people don't even listen to it, just being honest. And that's irresponsible as the person that's getting that phone call. But I think that messaging has to be clear that if you're even pending a test, you should not be at school.
Right, and that needs to be communicated out multiple ways. Agreed. Board Member Campbell?
And that, you make a wonderful point, Reverend Cummings. I wonder if there is a possibility with our partners who are doing testing, whether that's CVS, Walgreens, or Health Department, if they can actually have something that they physically hand to the family and or tell them verbally, and you're not going back to school pending this test result. That somehow having that level of communication when the test is actually being administered, I think that would be helpful.
Something that Mr. Lander might be able to help with, because we communicate a lot with the Department of Health.
Right.
But the outside testing sources, we don't have a direct link of communication to them, but I know they all report to the Department of Health.
So if if somehow if the person actually administering the test was able to communicate that, that would break down that line of communication that's currently missing.
And the reason I'm stuck on this is because of something that happened to my family over the weekend, that they got a test on Friday, and I specifically asked, when is this information going to get to the school or to the health department? And the health department reported it. And I was specifically told that it may be 5 or 6 days before it actually got to the school.
And I know sometimes we had issues last year, depending on how or where the person is tested. The way that the Department of Health receives the information is in 2 different computer systems, depending on how the test was performed. One takes longer than the other.
Right.
And they don't come with some big red alert that says Marion County student or staff. They have to look at the age of the student and go from there. So I know that there is some lag time. They also are short-staffed there with the amount of cases we have.
Correct.
To look up all of this information. But even the school health staff at the Department of Health, is helping the epidemiology part to look up students to find out what school they're at, and that happened all summer as well.
And that's where I'm really concerned because if I've been an irresponsible family member and let this family member came, they would have came back to school today because they're not showing symptoms. However, what would that have done to everybody they rode the bus with, everybody that they sat in class with all day long? And we know for a fact these things have happened within the first 4 days of this school term. Am I correct?
You are correct.
Okay.
And I think the information does need to be shared and shared and shared so that everybody knows and understands.
Right, through multiple sources. That was a great suggestion.
I want to bring you back there.
All right, good morning.
Good morning, Chair Thrower, Vice Chair King, school board members, Dr. Gullett, Attorney Powers, and Ms. Martinez-Lopez. At the last work session during COVID-19 updates, there was discussion and very good questions about the COVID-19 protocols being implemented at schools. And we understand and appreciate these discussions and questions. Since that meeting, we, the area superintendents, and the chief academic officer have been working on providing a framework of COVID-19 protocols for elementary and secondary schools. The principals will work within this framework to meet the needs of their school. These protocols are strategies that we have been discussing with principals during our visits and conversations. Today, this morning, area superintendents held a meeting with all principals together. And at this meeting, the three of us again reiterated the protocols, provided them in writing, and allowed for breakout room discussion as well. This allowed all principals to hear the same one consistent message. Today, we plan to review these protocols with you as well, and then allow you to also hear from school leaders. So after we share our update, Mr. Carlisle, Ms. Manresa, Mr. Rembert, and Mrs. Sandy will have the opportunity to share from a school leader how they're implementing the COVID-19 protocols.
Great, and Ms. Hembrook, Dr. Hembrook, just for everyone's information, after you share and before the principals come in, we will take a 10-minute break. Thank you.
Thank you. Thank you, Dr. Hembrook. Today, we have provided you with a copy of the COVID-19 protocols checklist for elementary and secondary. And again, as Kevin Christian indicated, all of these checklists have been posted on the district as well as the school web pages. In all Marion County public school classrooms, the same protocols are in place, meaning that at least 3 feet distance, seating charts are being utilized, encouraging use of hand sanitizer, or as in elementary we say gel in, gel out, and washing the hands regularly. The at least 3 feet distance is the current CDC recommendation. Schools are doing their best in this area. It is important, however, to point out that we know that every school has a different size classrooms, and every school has different enrollment. Certainly that does impact the implementation of the 3 feet distance. As was mentioned last week, as well as earlier today, our Marion County Public School enrollment has increased. It's increased by 5,000 students, and we're certainly happy to have them in our schools. Additionally, again, as was mentioned earlier, last year we had a yearly average of 17.41% of our students in the innovative learning model. Since the innovative learning model is no longer permitted and supported by the state, these students are now back in our brick and mortar classrooms.
Ms. Kleiner, the innovative learning model was known as what?
In our district, MCPS Online.
Thank you.
You're welcome. This means that, of course, many of our classrooms have full enrollment, which is wonderful for Marion County Public Schools. We're certainly excited to have each and every one of our students back. However, this means that we are continuing to troubleshoot in any areas where distancing of 3 feet is challenging. At this time, Mr. Frazier is going to...
Good morning. The next part of the protocols that you have will discuss communal spaces, which includes cafeterias, breezeways, and locker rooms at the secondary level. The protocols outline using all available seating for lunches, including outside areas such as courtyards. The same spacing requirements are in place for both levels. At the middle school level, locker rooms have been closed for the first 30 days, and this will be reassessed for the next 30 days. The protocol for moving about the campus is the same for all school levels, but is more easily implemented at the elementary level because there are fewer transitions. Elementary school can outline a clear path and direction for transitions that provide for social distancing. The secondary level is more of a challenge because of the number of transitions that occur during a school day and the different classrooms and buildings that are spread apart on a secondary campus. However, all transitions fall under the 15-minute rule for contact tracing.
Cohorting is being strongly encouraged at both school levels, elementary and secondary. Certainly more easily implemented at the elementary level. Elementary schools, students are being placed into small groups for instruction or MTSS interventions. However, these groups have the same students as much as possible. Additionally, within the seating areas of the classrooms, teachers are trying to keep the same students together, which would be the cohorting concept, just like we did last year. Seating charts are being taken of the students as they're in these small groups as well as their regular classrooms. And the secondary level certainly presents a little bit more of a challenge, still cohorting, but we know that students in secondary levels certainly go to different classes that they're enrolled in and certainly their electives.
So the next section on the protocols addresses visitors, volunteers, and events and field trips. And so these are going to be different by school level. So if you'll look at the two checklists that you have, elementary is obviously different than secondary. At the elementary level at this time, there are no volunteers or field trips permitted. However, at the secondary level, school volunteers and field trips are being permitted when the volunteer or the field trips is part of a course requirement for students. So it's part of their curriculum process or certification. And that might be or the other option is when a volunteer or a field trip might be necessary to help guide the students or provide them critical information that they need to have to make decisions in the next steps of their of after graduation. So that might allow for various recruiters from colleges, military recruiters, athletics, to come and provide information to our secondary students so they're well informed to make post-graduation decisions. These visitors or any visitors that come on either elementary or secondary campuses are required to complete the COVID-19 questionnaire. These protocols are in alignment with what was recommended last year by the Health and Safety Committee in January and February of this past school year. At this time, open houses are being planned at both elementary and secondary schools because we know that engagement with families and schools is critical to the student success. So they are being planned at this time. We are planning for face-to-face. However, principals are ready to flip to virtual if that's the decision that is made and recommended by the school board at a later date. But in the meantime, they are planning for those.
Remind us again of when open house is planned for, the dates?
Open houses are after September.
Okay.
So the open house is after it, like towards the end of September, mid to end of September. But the next school board session that we were going to talk about this was September the 9th, when we were going to revisit the idea of visitors.
Okay. Thank you.
So we're planning for both. At this time, as I mentioned, we're planning for face-to-face. Face coverings at this time are still optional to all schools. We do have masks on hand for students who request one. And schools are being directed to ensure that the student choice of whether or not they wear a mask is respected by all at all times by all students and staff. Students should not be treated any differently for their choice of wearing masks.
So the next part of the protocols addresses the custodial, cleaning, and disinfecting protocols, which are the same for all schools regardless of area. So wall dispensers for hand sanitizing were installed last year, and every classroom, cafeteria, and office area has been provided with a red HDocs bottle for cleaning and disinfecting. More bottles are available upon request, and additionally, schools may order masks or shields or gloves or gowns or wipes by submitting a warehouse work order or warehouse order.
The Instructional Continuity Plan, or ICP, will assist students who are on a stay-at-home quarantine directive from the Department of Health. We've mentioned the Instructional Continuity Plan before. that is in our checklist. The ICP will provide daily learning for these students which may include online videos through their ELA textbook, SAVIS, that's our new ELA textbook resource, or other pre-recorded videos, teacher-created lessons, STEM scopes, science, or studies weekly. The homeschool liaison is the designee that's been enlisted to contact the families of students who are on a stay-at-home directive to ensure that they are actively engaged in this learning. Students who are actively engaged in the learning and there's evidence of work, either through submitted assignments, could be minutes in iReady, especially in elementary or middle school, will be marked as attendance as present at school. Lastly, the COVID reporting, as we know, has already begun for this school year. The data will be reported each Monday afternoon of every week, and the data is from the week prior.
And then finally, we wanted to review one remaining recommendation from the Health and Safety Committee that was made last year that we haven't quite yet touched on. And then we're going to give Mr. Jody Phillips the opportunity to share athletics and the direction of that. So last year, the Health and Safety Committee made a recommendation towards regarding the rental of facilities. And so currently, we are renting our facilities as we would in a non-pandemic year. And to date, we have not heard of any issues or concerns regarding this. And then meetings were held last year with school principals to hear from them about how that was working for them at their school. If you remember, we rolled that out in a phased rollout approach. In all of those follow-up meetings that I had with principals, I did not hear of any major concerns with the renting of facilities. So the current recommendation is that we continue in that process.
Dr. Hembrook?
Yes.
What do we rent the facilities for?
So that would be for various, let's say a church wanted to rent their facility, or an organization would come in. It's very typical that we rent those facilities, but they could want to have an event or a meeting at a particular school, and they go through that rental facility process.
Are these people that we rented, are they still following COVID or CDC procedures? Or, I mean, what do they have?
So as part of the rollout last year, there was a rental facility agreement addendum with COVID-19 procedures. There was, I believe, I'd have to go back and get for certain some extra cleaning fees, extra security.
Is there limits on the number of people in attendance?
Yes, sir. And it mirrored what we do in our school systems as well.
So it's what, 50%? What is it that we're doing? And I'm not being funny. I'm not trying to put anybody on the spot. I'm just curious because we kind of came back a few weeks ago and kind of said everything's out there. So Jody's at the door. Can you help with that, Jody?
I'll do my best. Good morning.
Morning.
And I didn't hear everything.
We were talking about facility usage.
The rentals, and I did hear that part of it. I will say, I'm going to pull out a couple of specific situations. One being at Dunellen with the Pop Warner situation over there. There were not any. There weren't any holdbacks per se to their situation. They operated completely under the guise of their organization, other than what Ms. Hembrook referred to in the sense of our COVID addendum.
So but that's the outside. I'm talking about, are we like renting inside facilities? Such as gyms and auditoriums, are we renting anything like that?
I mean, I don't know the answer to the question directly, but if we are, it'd be very minimal at the time. I'm pretty aware of most of it. I don't know every single one of them necessarily because that goes through Ms. Rowland, but I'm not aware of anything that you guys.
No, when she said that, something just clicked. I'm like, are we renting out MTI for
Kingdom of the Sun concert band, things like that.
Right, right, and right now.
that is way out of my realm, so I'll
You're the athletic director, not the orchestra person.
And I'm sorry, I wasn't trying to
No.
blindside you with that,
No,
but it just hit me that fast.
It's a good question. So last year, I want to say it was about September, I brought a phased rollout approach to the school board. And what we had agreed at that time was any existing organizations that were already renting our facilities, we were going to let them rent our facilities if they wanted, right? Like,
Right.
and then we added on new organizations. So that's what's currently in place. It doesn't necessarily mean that all facilities are being rented, but yes, the Kingdom of the Sun could be a potential based on our current understanding that we're working towards. But again, that's up to you.
I think that was very well said.
Thank you.
All right, so now we'll go ahead and let Mr. Phillips talk about athletics for this coming school year.
Good morning. At this time, what we have been working off of since we came back, the fall season started August 2nd, as far as practices and such. And this week, we will begin to see our preseason rollout begin, meaning some competitions will start as of this week. So at this point, we were operating under the guise of what we had shared previous, in the sense that we've scheduled contests under the normal thought process with other schools outside of Marion County and through our district scheduling and so on for all of the teams. So we were planning on opening up the venues and allowing the standard amount of spectators that we would have in previous years, just according to whatever attendance guidelines there are for the facility. We of course would follow that. But we were opening back concession stand use was something else that was we were planning for. And then I think the other thing would be, or the other couple of things would be the use of volunteers to conduct our events. As examples, I would tell you chain crews, scorekeepers, clock operators, things of that nature through the function of our programs. And that would be consistent across the schools. As far as, and I don't know if we want to, is that okay? Or do you want me to talk a little about the protocols that were just mitigation? Okay. So from a mitigation standpoint, we certainly learned from last year that being clean and sanitary and doing the things that we did because of the circumstances led to a greater good, and it helped us with a lot of different areas, and it kept kids participating and kept them. And so we have continued to clean regularly. We use A-stocks to clean equipment. We certainly encourage mask use when kids aren't participating and they're in close quarters, and we encourage students to distance when possible. Using the hand cleaning, as I mentioned, is something day in and day out that they're doing. We're not sharing, we're trying to really hammer home, I know, not sharing towels, not sharing water bottles, not sharing anything that could potentially contaminate or be contaminated. So, and I think that's pretty much, that's it. In a nutshell, that's how we're operating day to day. And to this point in time, I will share with you, I spoke with our schools in the last few days, and there's been a lot of positive feedback from the school communities, and they've certainly had parent meetings over the last few days, the last week, with all of this starting and such, and the parents have wanted to continue that move forward.
Thank you. Board? Any questions for Mr. Phillips? Okay. Thank you.
Thank you.
We appreciate the opportunity to review the protocols with you. At this time, we were going to allow those school leaders to come in, but if it's the pleasure of the board to take that 10-minute break now, then we'll hold off on them.
Okay, we will take a break at 12:38 and come back about 12:50. Thank you. go ahead and resume our school board meeting at 12:52 p.m. Continue our COVID-19 updates. I would like to thank everyone for their patience and kindness and passion, running a very productive meeting so far, and it's appreciated by everyone. All right, Dr. Gullett.
Thank you, Madam Chair. Members of the board, I'm pleased to present 4 outstanding school leaders that are wonderful representatives of the great school principals we have in our district to share some updates and the great work that they're doing. Thank you. I'll let them introduce themselves as well.
Yes, I was going to say. So we're going to turn it over to Mr. Carlisle to share, and then he'll be followed by Ms. Manresa, Mr. Rembert, and then Ms. Sandy will close this section.
Hi, Chris Carlisle. I'm the principal at Vanguard High School. I just want to say we had a great first week of school. Teachers, students are excited to be back. I want to share some of the things that we have in place. A lot of these are, they come over from last year that we had in place, and we were very successful with them. One big thing that we have, and our campus allows for it very well, is that we have designated entrances and exits to our buildings, and we have one-way hallways. So we're able to keep our students moving in the same direction, and actually that has been very helpful with reducing congestion during class changes and stuff like that. We are, in our classrooms, we're social distancing as much as possible, at least 3 foot. 6 foot is a little harder, but most of our classrooms are still set up in rows. So again, our students are facing the same way. When our students are in groups, it is for a shorter period of time. We do have, as Mr. Christian was saying, we have signage everywhere, reminding our students about social distancing and not using the water fountains. And with the water fountains, we're distributing water bottles that we got as a donation from Advent Health last year. That we have plenty of them left, so anybody that doesn't have a water bottle can get one of those. During lunches, we are fortunate we have a large outdoor space, so many of our students are eating lunch outside. We have a pavilion area with picnic tables and outdoor seating, so we have a lot of our students outside, but also in our cafeteria we have spread out the tables as much as we possibly can, and we try to limit the number of students at each table to 4, which allows for some social distancing. We have added 5 minutes to our lunches. They're now 30-minute lunches. Last year they were 25-minute lunches, so we're hopeful that this will allow our students, they don't have to rush into the lunch lines. They can kind of take their time to go to the lunches. One big thing our teachers are doing, all of their seating charts are in Skyward, so if we need to, we can pull our seating charts pretty quickly. And we've seen, last year we had that as well, and it helped us with tracing. And then the biggest thing for us right now is communication, and we were very, very careful to communicate clearly with our faculty and staff during preschool week, and even last week we had a faculty meeting as well, just on updates and reminders, and I'm trying to do that as much as possible with our families. I actually sent out Skylard after Mrs. Thrower Skylard on Thursday. I did one on Friday as well, but making sure that our parents know exactly what we're doing.
Thank you, Principal Carlisle. I have a couple of just quick clarifications. Are the water fountains actually shut off?
No.
Okay.
No, the water fountains are still on, and we were lucky. We got some water, bottle filling machines or attachments. So we have those in many of our buildings, not all of them yet, but those have been really, really helpful.
Like the ones in airports, sort of?
I think so, yeah. You just walk up and put the bottle underneath.
Right. That was my second question. Do you have the water bottle filling stations? I know elementary does. I was hoping you did too. And hearing that you added 5 minutes to lunches to just spread things out, and the seating charts in Skyward is genius and important, and the increased communication. So thank you. Go Knights.
Yes.
Hard to say.
I think I'm up next. So when this all started, we created a safety task force at Hillcrest, which includes our lead ITD, our work study coordinator, our behavioral specialist, my guidance counselor, my AP, and myself. And we still meet on a regular basis. It was kind of comforting to hear the principals meeting this morning. Everything they were going off their checklist are still things that we are still currently doing. So it was like, yep, got that, yep, got that. It was comforting. Some of the things that we still have in place is we're still making, of course, shields and masks available for anybody that would want one. This year, our welcome back to school for our teachers were actually mitigation baskets that included wipes and gloves and Lysol and soap and all sorts of things that they could use in a classroom so that teachers didn't have to make the purchases themselves. We have community-based instruction that is currently on hold right now until we see where the numbers are. We really aren't looking to put kids on buses and take them into the community to learn the skills that have to occur in the community. Breakfast is currently being served in classrooms because we have so many buses coming in at one time. While we're one of the smallest schools, we have 27 school buses that roll into Hillcrest. So as a result, we're doing breakfast in the classrooms, which paraprofessionals are actually picking those up and having them ready once students arrive. When it comes to lunch, there is assigned seating, but teachers also have choice. So they can sit outside, they can eat in their classrooms, or they can sit in the cafeteria. If they choose to sit in the cafeteria, they are spread out and everyone is facing in the same direction. So there are no students sitting directly across from each other. We too have the water bottle refills. We are not using the water fountains at the time. Hillcrest has the option to look at things at an elementary level or a secondary level. When we're looking at things at the elementary level, we are currently not allowing visitors or volunteers on our campus. We have some incredibly medically frail students, so for right now, that's on hold. With communal areas that we have available, we are requesting our staff to spray areas before use. For instance, our pre-vocational kitchen, spray the area before you're going to go use it. Our playground, the same thing. When it comes to our sensory room, also spray it before use. Our workshop, which is a sheltered workshop environment, is currently closed right now because there are so many manipulatives in that facility, in that area, that we're just going to keep it closed until the numbers become more stable. All of our faculty meetings are also going to remain virtual this year, at least for now. Articulation meetings at other schools, we're also asking them to provide a virtual option so that we're not bringing all staff members into one room. Our IEP meetings are actually combined with a virtual option as well as a face-to-face, so if parents would like to join us, that isn't a problem. Our therapists join us online, so it's a combination. Field trips are also on hold at Hillcrest for right now. However, our community-based vocational training is on a go. So we are taking students out into the community, into the workforce. Bus loading procedures, we are not waiting. Students are being escorted directly to the buses to avoid any congestions in the hallways. And we are really quick to respond to any students that require some exclusionary procedures, contacting families immediately and having those students picked up and sharing the information that has to happen.
Thank you. Board, do you have any questions? Okay, and I'll get back to you, Mr. Carlisle, with the same question. Ms. Manresa, is there anything that you need from us?
Honestly, I think that you allow us to make decisions that is best meets the needs of our community and our schools. And I think allowing us to do that is meeting our students' needs the best that we possibly can. So I appreciate that. Let us lead our schools. We know our communities and we know what we need to do, so we appreciate that. Thank you.
Thank you. Mr. Carlisle, same question.
I think we're in a good place right now. I think the biggest thing, and you guys have already hit on it, is as long as if our students are ill, they're not feeling well, we ask them to stay at home. We'll make sure that they are good, that they're caught up. Our teachers are great at that. So at this point in time, I think we're in a good place, and we're ready for a great year.
Great. And to reiterate, this is a great time to do that with attendance, there is a special code for COVID-related absence, so it doesn't count against students. And I know we mentioned this before, that we will have their backs if that somehow gets confused, because attendance is very important, and it's something that we emphasize. We want you at school when you're healthy and able to participate. Same with our employees. Okay, thank you. All right.
Good morning. Lamar Rembert, I'm the principal at Howard Middle School. Hopefully you can hear me okay through the mask. To really mirror what Mr. Carlisle and Ms. Manresa said, have stated already, we have a lot of the same procedures and protocols in place as last year. To name a few, outdoor seating for lunches, and we've put in a request for additional tables to be sent from Ms. Susan Johnson in food services, and she's definitely does a great job working with Amelia Bray to get those to us when we need them, so she's looking into that. But we are currently using the outside seating that we have. encouraging social distance as much as possible in the communal areas. We have one-way traffic on campus. Most of our traffic is outside, and we do have one-way traffic in our interior buildings with enter and exit clearly marked so students know how to enter and exit the buildings when they have to go into an interior hallway. Social distancing is happening in the classrooms as much as possible. Again, we are good at least 3 feet in almost all situations, and in some classes we are able to do 6 feet, so that's even better. But that has been strongly encouraged and kind of mandated to the teachers in pre-planning week, and they've set up their classrooms accordingly. We are still requiring our teachers to clean in between classes. The high-touch areas with the H-Docs, the red spray bottles that they're using, that is still happening on a routine basis in between all classes. Our students do a really good job of helping out with that, and teachers set up protocols at the beginning of the year as far as handing out paper towels, getting this desk sprayed down, and the wiping and cleaning of the desk, and that's become a seamless process. We do allow for the last minute of class for the classes to empty so that the students can kind of spread out before going to some different places and make sure that the room kind of airs out in between. So that gives about 5 to 6 minutes of the classrooms being clear before the next students come into the classrooms. Again, like Mr. Carlisle, we're trying to remind our students, through our morning shows as well as doing communication out to families about staying home if you're ill, to err on the side of caution, and that we will make sure that everything is taken care of as far as making sure that a student can access what they need to do while they're at home, or if they're too ill at the time, we'll make sure that they can make that up at a later date. And again, we keep trying to drive that point home, and we hope that families receive that well. Our seating charts are housed in a common area on our Howard Middle School portal for our teachers to upload so that we have access to those over the weekend. Usually with contact tracing, I have a team of 3 to 4 people that we work with to do that when necessary. And a lot of times we go to the actual classroom so that we can kind of see the setup in the classroom and help make decisions on who needs to be called down for exclusions based on their exposure to the positive case in the classroom. And again, we've supplied our teachers with masks to give out upon student request only. Wipes, sanitizers that we've purchased with the ESSER funding that has come to us, and as well as generous donations from our community who have sent all types of wipes and sanitizers that we can issue to our teachers so that they can help mitigate in their classrooms. Thank you.
Thank you. Ward? Anything you need from us, sir?
No, not at the time. Again, the consistent communication about protocols and what needs to happen. If families believe their student is ill while they're waiting for a test to come, to just remain home, like I said, erring on the side of caution for right now.
Thank you, sir.
Thank you.
At the elementary perspective, all the above, same. But what I do see is probably the difference is that we receive our families. We get to see the mamas, the grandmas, the dads that drop their kids off in the morning or call and want to know what is the school doing to protect my child. And so consequently, we spend a lot of time having conversations with the families to say, when you drop them off, what do you see? You see us with our masks. You see us wiping our hands. You hear the kids talk about socially distant. And so we spend time reassuring our families that we are following all of the district protocols to enable their child to be safe. For example, I was in the VPK classroom last week and I had to be careful because it was nap time and she had them so socially distant, I swear I was afraid I was going to step on a student. So I had to be gingerly walk across the room so that I could make that happen. That is the extent to which we are trying to provide for the safety of all of our students, because it is important that the students are in class, and so we've got to do everything we can do. We walk out in the morning when the students come out of the cars. You mentioned masks. We have masks in our hands. If the students want the masks, they take them. When you come in, we eat outside for breakfast, like you heard. Our little kindergartners are eating outside at picnic tables, so that, again, we're trying to provide for social distancing. During lunchtime, if you've ever had the pleasure on being at the Oakcrest campus, we are able to spread our students out. They're in assigned seating. Now, don't talk to a fifth grader about that. They think that they should have a little more freedom. But no, they are sitting in their assigned seats. They're all facing the front, and they are thoroughly enjoying that lunch. You know, we're not going to give them that opportunity. When you come to the end of the day, we all walk on a path one direction, and so we are doing everything humanly possible to help mitigate the situation that we have on campus and keep our kids safe. So I believe that we are following the protocol, and to the best of our knowledge, we'd like to think it's working, though we do have some breakthrough numbers, but at least we are doing the best we can to help keep it as safe as we can for all students.
Thank you very much, Ms. Sandy. Board? Just wanted to thank you again for everything that you're doing. Most everyone knows that Oakcrest Elementary has out from under the external operator situation now, and everything that you're doing will increase attendance, increase engagement, increase school grade. It's all connected.
There you go. That's the goal, and we're going to make it happen. How about that?
I have no doubt.
There you go.
Let me ask a question. And I'm going kind of to elementary, Ms. Sandy, and you can only speak for your school, but I guess the other area directors area superintendents can kind of help. With this seating for elementary schools, are they still, I saw where they had like 4 desks, 4 little small groups. Is that still being done in the class?
May I be honest with you? Yes, that's the way we started about a week and a half ago, but as we saw numbers, we all wanted to believe that it was going to be a different story. But it didn't take but a day or so, and they are separating. A year ago you saw tape on the floor, so when we had to clean the classrooms, we were cleaning tape off the floor, and of course I wasn't going to have tape on floors. Well, I've now about given up, and now we're back to some tape on some floors because we want to make sure that the students are safe, and that helps enable the fact that students are separated from each other.
So to the area superintendents, is that the consistent message across the district, that they're not to be in those little because the way I saw it was 4 desks in a square and they're facing each other. Mm-hmm. I mean, did we leave that up to the principals or there's individual schools?
So we did see groups of 4 at the beginning of the school year, and during our walks and rounds, we reminded principals that we really need to be 3 feet. And so what they've been asked to do is to pull the desks back just a little bit. It gives some space in between all 4 desks. And then as needed, if they need to do some group work, then we can push them together. But again, monitoring the time frame and monitoring those seating charts as well.
Okay. Thank you.
And I appreciate you bringing that point up, because I think almost all of us felt like we had a reprieve this summer. Things seem to be back to a lot more normal. We were seeing family members for the first time in a long time, and traveling and enjoying life. And we've had to shift very quickly back to a new reality, another new reality, that it's not the COVID of before. This is now Delta, COVID 2.0, whatever you want to call it, that's requiring the same approaches in many ways, but some new ones as well. So thank you for bringing that up, Ms. Sandy. I think it's just important to acknowledge that, we're all people trying to do the right things and trying to respond and trying to put things in place. And when you have a ship as big as ours, it can be difficult to pivot very quickly. But I believe that by the end of the week last week and over the weekend, we've all, sadly had to wrap our heads around the fact that we're back to having to do things a lot different when it turns to mitigation and prevention protocols and procedures. So thank you very much. It's really a pleasure always to hear from the folks in the trenches. It's always a pleasure to hear from everyone, but you guys are the unsung heroes. You know, you're in your schools. Can't wait to get back to your schools, I'm sure. So thanks again for taking your time to come to be with us today.
Thank you.
Appreciate it.
All right, thank you to the principals for sharing their leadership and expertise, and get back to your schools where you are amazing at. Thank you.
And if I may, while they're leaving, I tell them this all the time, but I too want to echo my thanks. They're bold leadership, they're being agile, and they're the face on the front lines. And so I'm so incredibly grateful to all of them and their courage and their leadership. So thank you.
A lot of problems can be solved if you just contact your principal.
Yes. All right, I do want to take a moment to address a question that Reverend Cummings had asked of us earlier about the rental contracts. Currently, the only one that we have one right now that's currently asked and has a rental agreement with us, and that's Kingdom of the Sun. That's filled out their rental agreement for this year. And at this time, we want to have Stephen Ayers, as Chair Thrower had alluded to. He's going to come and discuss the attendance with student exclusions.
Good morning, Madam Chair, Madam Co-Chair, board members.
Good afternoon.
Good afternoon.
Surprise.
Elena Martinez-Lopez, Attorney Powers, Dr. Gullett. I'm here just to clarify or to expand on the attendance aspect with this COVID exclusion. As you well know from the executive order, the emergency order that came out, that students that are receiving instruction at home are not to be marked as absent. So what we did is we have developed our own attendance policies and procedures that mirror what we did last year, but we included this year in a daily attendance code that will recognize students that have been excluded due to COVID situations but are receiving work at home. And therefore that will be treated as like a, it's not an absence. It's a school activity like a field trip. So if students are off campus on a field trip, they receive a certain code. This is a code. The principals were talked about that this morning. They were given instructions on how to make sure that coding happens. There's also a code for a student that is COVID excluded but unable to receive instructions because they're sick. That's still an absence. It's an excused absence because they've been a COVID excluded, but they're unable due to illness to work. But if they've been excluded and are able to work and receiving work, they are coded a different attendance code that DOE has instructed us how to code, because that will be tracked.
Thank you.
Right.
At this time, support services will come to the table to present their update.
So we're going to begin with Mr. Vianello, and we're going to hear from the custodial team with Ms. Dobbins and Carrie Cook, and then we'll proceed with the rest of the support service.
Thank you, Dr. Gullett. Good afternoon, Chair Thrower, Vice Chair King, board members, Attorney Powers, and Ms. Martinez-Lopez. As Dr. Gullett said, we're going to transition into support services, and you'll hear from our team how we are trying to help problem solve and mitigate and reduce the impact on the virus. You're going to hear from 3 of our departments. First, we'll hear from custodial services, then we'll move into transportation with Ms. Rora, and then finally our new Director of Talent Development, Mr. Green, will come up and start talking about some of our recruiting plans. So, Barb, I turn it over to you.
Thank you very much. Good afternoon, everyone. So as we come back to the table, I again want to start off by thanking our custodial department and all those team members for the work they've done last year and continue to do this year. As you heard Mr. Rimbert say, it also is a team approach, and our teachers and our paras are also picking up the bottle, the red bottle, and are also taking those mitigation steps in between classes, in between groups, and so forth. And as that team continues to stand together and move forward, we'll continue to address the disinfecting and sanitization of our classrooms and facilities. So just a reiteration, we still use the Peroxy HDox, that is known as the red bottle. So that solution is an approved solution that will clean and disinfect our classrooms specifically for COVID-19. All of those bottles are in every classroom, and in larger rooms there's more than one. As we stated before, those bottles have a label on it with an expiration date. The solution lasts 21 days, and that solution is emptied and refilled, and then the date is put back on that sticker. We continue to ask our team, teachers, paras, administrators, that if the bottle is needing more fluid, that we know these things. It's all about that communication, so we can always have enough of the peroxy H-Docs for our teachers and our staff to continue to disinfect and sanitize. We also use the Omni Shield, which lasts 90 days. Those are applied in all of the gyms, weight rooms, locker rooms. All of our cafeteria tables have been treated. The high-touch areas in this room also are treated. And we continue to monitor those 90 days, and when we get close, Mr. Cook here sends those reminders to reapply those things as well. We also treat our buses with the Omni Shield. So as we continue to combat COVID-19 with this team approach, and we continue to use the effective mitigations we did last year, we will continue to respond to concerns and the communication that we receive. Mr. Cook is now part of our communication loop, so when you get the text that says this classroom has been excluded, he now sees those texts, and those head custodians at those sites then communicate with the principal so that we can deep clean those rooms that have a high population of possible spread. With that, is there anything you'd like to add, Mr. Cook?
I'd just like to thank the board, thank the teachers, thank the administrators. Pretty much this year is just a continuation of last year. I just want to remind everybody to work together, calm down a little bit. Let's work as a team. It takes everybody in the school to make this work.
Yes.
So.
Thank you. You're so right.
It's a team effort.
You bet.
Thank you, Ms. Dobbins and Mr. Cook. We'll transition into Mrs. Rohr and Transportation and ask Mr. Green to come up here as well. As Becky is coming up, I'd like to talk about some of the challenges that we had last week in transportation. And Ms. Thrower, you mentioned earlier in the meeting some of the national shortage that we have in bus drivers, and it is an impact. And when you add to that the virus that we're facing and the quarantines and the close contacts, you add to that the tripling of students riding the bus at the beginning of this year versus what we had last year. And then when you add to that, we armband students last year. It did cause last week, for the first week of school, it did cause some significant delays getting our students to school and from school. So Transportation Department and myself and others have been moving into uber problem solving and action planning mode. And what you'll hear from Mrs. Rohr are 10 to 11 different strategies that we are currently working on to try to problem solve so that our buses can get to our campuses, pick our students up on time, get to our campuses on time, and return them on time at their home as well. So Ms. Rohr, I'll turn it over to you.
Good morning. So as we continue to move forward and onboard drivers as quickly as possible, here are some of the considerations, things we've explored and to try to help improve the situation. First, we're identifying and working to see if we can find a company to provide temporary bus drivers to fill open routes. Please understand this does not replace any of the existing current bus drivers. And this bullet and the next two that I share, I've already discussed with the union, Diane Weingart. The next thing we're doing is contacting activity bus drivers, and so far we have 8 potentials that are already certified with the CDLPNS, and they are instructional personnel, but we're soliciting their help to see if they're interested in running a route to and from school for their campus, children that are on their campus. And so we're waiting on a response there. We're also exploring the idea of lead drivers that can assist in mentoring and guiding new drivers that we on board, showing them the ropes, giving them an opportunity to do ride-alongs, help them with that massive load of paperwork and such so that we can maintain bus drivers. Other strategies to improve the delivery time include working with the Department of Health to identify close contact and essential force work folks. So they've, in the CDC guidelines, have outlined that bus drivers and attendants are essential workers. So we've had a couple of phone conferences with DOH to help us understand exactly what that means and how that can be of help to us in getting individuals who are not sick back to work sooner. We're working with HR to fast track and streamline some of the onboarding process of bus drivers. And we're looking right now strictly at the bus drivers. I had a phone conference with Ms. J.C. Oliver this morning, and we went through the entire process of that new hire packet and identified some areas that we would like to discuss with the departments to see if they will still be required, but originally they're required up front. We've identified some that she will discuss with those departments or with the people that put them there that they greatly affect to see if we can move them to Canvas after onboarding those folks, but still require that completion within 30 days. So we're waiting on a response from that. That would help us onboard them faster. They still will have to complete those tasks within that 30-day period. So, and looking at routing to see where we can improve and make that more efficient to what we're doing. We've worked countless hours looking at the routing. We worked this weekend reviewing some things, returning calls. We will continue to do that. We're also looking at different routing software to see if we have the best to fit our district. We're very unique. I know a lot of districts like to say that about themselves, but we are in the essence that we try to accommodate all of our students. Yes, the state give us guidelines of what they will fund us for, those that are 2 miles or more, but we like to try and accommodate those children for safety reasons, getting them to and back, whether they're less than the 2 miles or more than the 2 miles. But we also try to accommodate those children that opt out to go to magnet programs and other programs throughout our community. So oftentimes it's difficult to find a software company that can accommodate us and allow us to route outside of that generic type routing, what's typical of a router from point A to point B. We like to be different. Different helps our children. So we've also partnered with CareerSource, and I know you may have been wondering, are we still doing job fairs? Yes, we are. We have one coming up this Wednesday. We're doing very good with recruiting as far as getting applicants. We have a pool of applicants that are still in the processing line from entering the application, from being interviewed, going to do their drug screening background and such. So that pool is there, it's continuing, but just getting them through those processes quickly. And that sometime it gets delayed. It's not just on the district, on HR, on employment services. Oftentimes it's on that individual, that candidate that wants to come aboard and join our team. So we call them, sometimes we're pests, because we want to help them and see if is it a computer issue? Do you need access to a computer? Do you need help walking through some of those Moodle? It's on Moodle now, but it's going to Canvas. Some of those things that they're required to do. We can't move forward until they complete those. So we reach out to them to make sure that we can help them through some of the obstacles. We've reached out to retired bus drivers. I know many of them are listening, and I will continue to call you to see if they may not be able to come back full time, but we have temporary positions. So we reach out to them and see if they can come and help and give them an opportunity not to be bored. And we will also reach out to other districts, see what they're doing this time of the year in this pandemic. See if they're utilizing something that we're not utilizing and if it would be beneficial to us. And then communication with stakeholders. One of the areas that we're looking to increase communication with our parents and guardians of the children we transport is looking at the purchasing the feature called Here Comes the Bus. Here Comes the Bus is an app that parents and students alike can download either to their cell phone, to their home computer, laptop, any type of device of that such. And they can track their own bus. They can find out how far that bus is out, when it's 2 blocks in for that child who wants to watch a little more cartoon, or when it's 13 blocks out. When it hits in that parameter that they draw, it will alert them so they'll know when that bus gets there. Mom who's at work will know that bus is approaching and maybe say, hey, you need to get out there. Are you already out there? So we're looking at that. That feature we already have is Synovia that carries is what we already work with. So it'd be an add-on feature. It's not a different company. We already have products from them. And then utilizing that, it acts in real time. It's a real time thing. So when they pull it up on their phone, it'll show it exactly where that bus is.
It's like an Uber app.
I know.
I was going to say just that.
And last but not least, Mr. V will share another area where we're trying to increase that communication with stakeholders.
So we have received, in addition to and many of the suggestions that we've received over the past week are embedded in the items Ms. Rohrer just discussed. Certainly want to appreciate the board for passing along ideas. I know we've talked to parents, we've talked to employees, and from that come good ideas. A community problem requires a community solution, and so to continue that trend, we are going to set up a thought exchange later on this week, and that will allow all of our employees in transportation, all of our parents, and interested community members to help us problem solve. We have some good ideas we have to work through, but we may not have all of the best ideas. So we're going to cast a broad net and have a thought exchange. And so through Mr. Christian, we'll be communicating this to our employees and to our parents and to our community members that would like to help problem solve this. What that will look like is an opportunity for parents to log on, or participants to log on through a web link and contribute up to 300 characters, an idea that they have to help problem solve the prompt that we provide. And so there is no limit on the number of individuals that can participate in this. And as more and more ideas are set into the software package, each individual will have the opportunity to rate up to 25 different items, and these items will continually rotate on a scale of 1 to 5. So it's real time, and this allows the best ideas that are coming from our employees, the best ideas that may be coming from our parents, the best ideas that may be coming from our community to surface to the top. And we'll get all of the analytics based upon the results. Been working with Ms. Debick on that as our Director of Community Engagement. This is a tool that we will use, that she will use in a variety of different situations. But we want to start with the problem of transportation, and are we generating the best ideas other than the things you've heard from Ms. Rohrer? So this is an opportunity for us to go back and cast that broad net and make sure all of the best ideas are surfacing to the top. We'll be able to prioritize them, and then with transportation leadership we'll go through which are possible, which ones can we do, how quickly can we get these done. So you'll hear more information on that coming up soon, and that will be a thought exchange opportunity with our community. And that wraps up our transportation report, unless there are questions.
I just wanted to know, Ms. Rohrer, I'm going to borrow off of Chair Thrower. What do you need from us to ensure that Here Comes the Bus app gets moving right now? Like, I'm serious. Like, do you need consensus? What do you to start the negotiations? Like, do we need money from Ms. Boston Ellis, who also is in the room? Like, what is it that we need to make that happen?
Absolutely. I do need your consensus. We're already exploring. We're already talking with the company to see what we need to do to our buses, because they currently support us in the GPS. So it's an add-on feature from that company that currently supports us. So as soon as we get that information, we will of course share it with Ms. Boston Ellis and then move forward from there, bring it back to you for a vote.
We hope to bring it back to you quickly. quickly. If we can bring it back to you Thursday, we will do so. We are working through that contract right now, and what you'll see is a renewal of the contract of Synovia. The existing contract, and there will be an add-on of Here Comes the Bus. And so as soon as we can get that to a place, we don't have a board meeting, it will take some time to get on the agenda, but if we can get that to you Thursday to get consensus to purchase that, we would like to do so.
Absolutely, absolutely. And I know Attorney Powers, your office will be integral in facilitating the contract. And since we're already doing business with this company, hopefully it'll be relatively quick and affordable. Right, Ms. Boston-Ellis? But we can't afford not to. We can't afford not to. Transportation, it's over 21,000 kids that are impacted. You know, we get this running more smoothly, more reliably. It's going to take care of a lot of our issues. I have a quick question on the temporary drivers. Okay, two questions. What's the current pay of our regular drivers, and what's the current pay of the temporary drivers?
So if you remember, you guys were so gracious enough to let that temporary driver enter at the same wages. So the wages are still the same. Their entrance pay is the $15.65, I believe it moved up to. So that's the same entry level for a full-time driver.
Okay. All right. And as far as paras on the buses, how are we doing with paras? And is there a shortage of them as well as drivers?
Absolutely. We are in need of the bus aides on the buses as well. We are pushing some through, same as drivers. They don't require as much training. Once they get through all the preliminary stuff and they get clear from their fingerprint background, we can onboard them within 3 days. We just got to get through the slower process. And so, yes, we're in need. So if you'll help us with that, it's getting the word out. We've been also reaching out to those who have left us in the past to try to pull from that pool.
Because this is something we've talked about off and on, and in terms of onboarding folks quickly. And I know it's two different unions, but if there are any paras or employees that would be able and willing to get on the bus, even if it's just for an afternoon run, you know, any little bit helps, you know. And it makes such a difference to have a para interacting on an aide interacting on the bus with kids, so the driver can focus on driving. As our community grows, we have so much more traffic. It becomes even more important from a safety perspective for our drivers to be able to do that.
So, and I don't want to get too far into this conversation, but we are looking at that as well. The same concept of having an activity bus driver, a teacher who is teaching at the school, having a route coming in to serve the students that day and then driving home. The same concept we're looking at with paras as well. If a para that is in the school day, if they're interested, what is the possibilities of having that individual for compensation be on a bus, riding into school and also riding home. So those are things that we're starting to have discussion on.
Great. Thank you so much. This was great information, and it sounds like help is on the way.
Thank you. And so last but certainly not least is our new Director of Talent Development, Brian Green. And Brian's going to share with you here. I'll pass them out, Brian. If the board would like to see our true vacancy report for last week, and then how that compares to the following week, and then the previous week, and then what our preliminary plans are, some short-term plans to meet our immediate needs, such as filling these vacancies, the para vacancies, our bus driver vacancies, and then also some long-term plans as we progress throughout the school year. What are those systems that we're going to put in place so that next year at this time we are at a better place with our vacancies?
Thank you, Mr. Vianello. And what you have coming around, and I'll wait till you all have received a copy, and I think it'll help frame the conversation as we talk about some of the recruiting efforts we have once we talk about where we currently stand. And so what you'll have in front of you, and I'll kind of orient you to this as we review it, but you'll have both the classroom vacancies It's important that I note that when we're talking about classroom vacancies, I'm not talking about positions outside the classroom. I'm specifically talking about in the classroom positions. So this has nothing to do with our school counselors, our student discipline officers, nor our coaching, instructional coaches, content area specialists. It's specifically our classroom vacancies. So on the left-hand side of the form, this is as of every Friday and throughout the weekend. This is updated, so this is as of current today. Though I will point out, when I looked about 10 o'clock this morning, there's a teacher that's been pushed through, and that 78 is now 77. So that's a move in the right direction. But nonetheless, on the left-hand side with classroom vacancies, it is delineated by area and then a couple of special areas that you see there. I do want to point out we do employ approximately, once we're including deans and things of that nature, a little over 2,500 teachers in the district, to give this some perspective. And our classroom teacher vacancies, we're currently staffed for around 1,600 in the classroom units. And so of those vacancies, you see there's 104 total as of today, but then there are some caveats there to be aware of. We have about 15 that are pending new hiring. We have 6 that the principal at that particular school is hiring their sub, but they're waiting for their sub to take and pass their certification exam, which that sub will then become the full-time teacher in that room, even though they're currently serving that room. And then we have some schools who determined not to perhaps fill their kindergarten unit because their projections, they didn't think they would perhaps meet the number needed. So there are a few of those there as well. So ultimately what that leaves us with, it's 78 true vacancies. We are starting to gather trends that you see below that, and that is heading in a positive direction. We were at 88 this last week. We are at 78, well, 77 now. That should say negative 11. So that's heading in the right direction. I want to add real quick as well with our vacancies that by the end of today, this will have changed. I promise you. It will have changed because we'll have had another principal or two recommend to hire, or any number of different circumstances, hence the trend that we're starting to gather. On the right-hand side, you see the paraprofessional vacancies. That is delineated by both level as well as classification. And there are 3 different levels of classification there for our paraprofessional staff. So it's by role and by level. You see that there's also an area built in here, leave of absences. It is important to kind of know and frame that of these positions that we have, classroom teachers and paraprofessionals, there are some that are on some type of extended leave. That's our non-EPSLA leave, 28 and 10 respectively. And then every week next to it, who's under the EPSLA leave, that will change day by day. But that is our current trend right now. And so you see the total amount of classroom teachers and paraprofessionals and their leave status. And at the bottom, very similar to the classroom vacancies, we're starting to gather those trends. Yes, that did move up by 7, but as a couple of important points I want to point out, that's, I think, positive in this case. As of this morning, 11 of these 44 vacancies are pending the new hiring process. And there is one paraprofessional who's being hired into an instructional position. And so that 44 really would be around 33, 34, heading in the right direction. So I just wanted to point that out for the board. Any questions before I move on to some recruitment? Okay, awesome. And so we are gathering a recruitment team, a district recruitment team. We have sought stakeholders. We actually have a couple of our principal stakeholders at the high school and elementary level who are going to be part of this team. We also, this prior week in the Learning Line, have put together for anybody who's part of the Learning Line and receives that to join the recruitment team. That is due by this Thursday or Friday, so we'll have a broader interest of what the principals and APs and et cetera who have expressed an interest in being part of our district recruiting team. And so we are actively building a team of stakeholders to both plan for short and long-term goals, and I'll talk a little bit about that here shortly. We're also working to strengthen, currently as we speak, we are building out our strategic plan around our recruiting efforts. This plan is not limited to recruiting, certainly. It also discusses human capital management, retention efforts, and the like. But specifically with recruitment, these things fall under the talent development pillar of our strategic plan. and we're working closely with the superintendent, with Ms. Oliver, Mr. Vianello, and other stakeholders as we complete that plan. Part of that plan will incorporate a framework. And so when I'm talking about a framework, I'm specifically talking about things related to a broad range of areas. Some of these will be more short-term, and some of these will be more long-term, a living document that we're continuing to work towards. So some of these areas that I'm referencing is, for example, our online recruiting, vendor agency and university partnerships, campus recruiting, job fairs, internships, recruiting events, employee referral programs, as well as targeting our recruitment efforts in a couple of key areas such as closing our diversity gaps and those hard to fill positions, our ESC self-contained positions, math, science positions. And so this plan incorporates a number of those different things. Also, if I can remind you of your conversation last week, you talked about the use of creativity. And so we have built as part of our recruitment framework as well, starting to gather ideas, and I'm interested in the stakeholder ideas, what we have around creativity. What is the what, the creative part, and what is and how are we going to achieve that creativity? So developing a marketplace of ideas among the stakeholders that will ultimately be on our recruitment team. We've also started to develop our committee, as I mentioned earlier, but our leads. And so when I'm talking about leads, I'm discussing different vendor agencies, university partnerships, and even not only focusing on Marion County, but exactly what Ms. Rohrer discussed earlier. What are other districts doing who also have recruiting efforts, and how can we maybe in the Tri-County area unite those recruiting efforts for when we're bringing people outside the district and outside the state to Central Florida? And so those are some of the framework ideas that there's a lot of work to do. It's exciting, and I'm looking forward to it.
It is very exciting just to be wrapping all this together and taking it forward. Thank you so much for all your hard work and collaboration, and I have no doubts we're going to get this.
Yeah.
Board, anything else? Okay.
Thank you very much.
Thank you.
Madam Chair, members of the board, those conclude our presentations for today. I just want to say, as we have discussion, that as we navigate this pandemic, hope you hear our commitment to collaboration, both within and among our staff and our team, but also with our external leaders in our community. The communication and the commitment to increase and enhance communication with this rapidly changing pandemic, that we are committed to doing that. Increase the communication externally and among our team as well, but even with Here Comes the Bus, which I'd shared with Ms. Rohrer previously, I've had experience with, and that enhances communication, how we're doing with our transportation. So I've had great experience with that, but being flexible. We said this quite a year and a half ago, that we would be flexible and we would be fluid, and we continue to maintain that that's important. We don't know what it looks like a month from now, but we will continue to do that. So thank you.
Thank you very much, Dr. Gullett, to you and your team. And at this point, it's important for the board to have discussion on what we saw as our takeaways from today's conversation. And I know that everyone in the district and our families are awaiting our direction on some pretty important decisions. So I'm happy to have any one of you lead us off, please.
You want to lead it since you're the chair?
Well, I'd like to hear everybody's, I feel like I've talked a lot. So what is on the table for me is that what I took away is that we definitely had a reprieve this summer that was appreciated. Our numbers were a lot lower. Our community spread was a lot lower. We're not at that right now. And reality is important. We started school this year coinciding with a new peak, which poor timing, but that's when we started school, and that's what we're facing. I'm hearing that we are having a very difficult time because of our quarantines, maintaining educational momentum, maintaining the ability for transportation to get our kids to school back and forth on time. I know buses are overloaded. I know that transportation worked over the weekend to try to alleviate some of these issues, but they're going to be ongoing as long as we continue to have these quarantines. So there's been a lot of, I posted a lot of information on Facebook this weekend for a reason, and that is because that's where a lot of people go for information, and it can be accurate information and it can be inaccurate information. In this case, I would like to say that it was accurate information, and everyone is entitled to their own opinion, but not to their own facts. So I felt it was very important to get as many facts as I knew out there so that the community would have a chance to digest those, over the weekend and think it over and talk it over. And I want to believe that that was helpful because we managed to have a meeting all morning and into the afternoon of very important discussion without a bunch of drama and disruptions. I believe that every board member sitting here has received most of the same emails and outreach that I've received over the weekend, as well as a lot of our staff. We're well aware of everyone's feelings and concerns about what to do next. And it was another reminder to me to hear from Mr. Lander this morning that it is not, when it comes to the masks, face coverings, face shields, whatever you want to call them, it is not an all or nothing choice for us to be weighing right now. I heard very clearly several things. First of all, that we have the medical community's support. They have come out in force for us in terms of acknowledging that the cloth masks have not been as effective as other masks. And I concern myself with the school setting, the real environment, the real world of the day-to-day school system. And we have kids and we have families that, those cloth masks may have been the same one that they got from the beginning of the school year. And who knows if it was washed or not, falling on the floor, getting put back on. Within all of that, we managed to have a school year that was pretty darn successful. We got 2 schools out of external operation, which, we will get that formal notification soon from the state of school grades. That is a big savings to our taxpayers and a huge win for this district. So within all of the challenges, we managed to have a pretty darn good year last year. We had great graduations that seemed to go off with very little difficulty. We all attended them, They were great. And we were so hopeful that this would all be behind us and that we would be starting school focusing on what now? Education. But the medical piece is back. We have to acknowledge that. But I want to be smarter. I will not support a mask or face covering mandate that looks the same as it did last year, because that would not be honoring the knowledge that we have gained. And what I have taken in from this is that we have almost a 50-50 split in the community in terms of people that think that face coverings of any kind are absolutely useless, and others that think that they are going to be our savior. I think we've heard today that there is no one magic bullet. There is multiple magic bullets that everyone has to do their best to help contribute to the cause. Over and over again, we heard the importance of staying home if you're sick, staying home if you're asymptomatic and are waiting test results. If there's COVID in your family, please don't send your kids to school. The community is going to have to come together to try to help support each other. We have working parents that are worried about losing their jobs. That's why they Tylenol them and dose them up and send them to school. It's not because they really want to a lot of the time, and it's not because they're blatantly, going against what is the right thing to be doing, but they're in an untenable position. So the Marion County School Board cannot solve this community's problem. This community, together with the support of the Marion County School Board, can solve this problem. So what I would like to bring forward is the reminder from Mr. Lander that there is an opt-out on face covering requirements for any reason. Originally, I thought it was just for a documented medical reason, and I'll say again, I have distanced myself today because I'm probably going to be looking at having sinus surgery. I tried the face shield, even that has clouded me, and I needed to do my best thinking today. So I made the choice as a vaccinated person and someone that works hard to boost her immune system to just kind of stay away from others and do what I felt was the best thing to do to be able to lead this conversation today. So I just wanted to make that clear. The second thing is that we have the medical community's support to provide the types of masks that are, and face coverings that are known to be a tool in the arsenal, and there is research out there that I have read that is everything from inconclusive to, if, I'll say, paper masks are worn properly, if they are changed every 2.5 to 5 hours, if they are changed just like a kindergarten teacher or a kid sneezes, the tissues are right there. Well, hopefully the bin marked in red where the dirty masks go can be right there, and they can change it out. What I do know is that we cannot continue like this. We are only 4 days into school. We have over 500 quarantines. We don't quarantine for flu, so we get through it. We have teachers that aren't at school, principals that would have liked to have been before us today that are quarantined. We have bus drivers. We're only running at about 70% efficiency in our transportation. That means 30% of our routes need to be covered. I would rather look at a more evidence-based protocol for masking with an opt-out than tell families, no, you're going to have to figure out a way to get your kids to school because we can't do it in a way that is efficient and reliable and safe. So I think my point is that we're all going to have to give a little. And I think what I'm hearing from the community is they still want people that want their kids and believe in the efficiency and helpfulness as a tool in the arsenal of masking, for that to be available and just be something that is done. I think I'm also hearing from folks in the community that they really, really don't want to do that and that there's no way you're going to convince them to do that. And if that's the case, then let's do the opt-out with the understanding that I want to see a fade-out procedure. I want to see criteria and parameters. We get the numbers down to this. What do we do? So that we need a win for this community. We need a win that we can all get behind and be happy about to say, we pulled together. We did this. We all did a little something extra. And now we're better. That's my challenge. You wanted to know what I had to say? I said it. You're welcome.
So I guess I'll go next. When I look at numbers, and I know we don't want to talk about numbers as much because they are all represented by a person. Persons are much more important than numbers. The numbers that we have seen are not what August 2020 numbers look like, but they are pretty similar to what our January numbers look like.
You mean during the spike time?
I'm talking January 8th through the 14th. We had 120 positives and 592 quarantines, and our community had more than 2,000 positives. So that was another spike. What was happening was those students were coming to us and those employees were coming to us with COVID, which is exactly how we've started this school year. They're for the most part, that we've been able to document, for the most part, in the first 3 to 4 days of school, because of timing on testing and all of those kinds of things, for the most part of these 139 positives, probably did not get their positive test results in time for us to know if that had happened in a school setting, for the most part. So we've started school with folks coming to us with COVID. And that's pretty much what I think happened in January as well, based on the numbers that I was pulling of all of our reports from earlier and the county community-wide results as well. A couple of things I would like to mention about this meeting. I appreciate all of the team, because this has been a very lengthy process, and I know they were all prepared to present this on Thursday, and they've expedited and brought it all to us today. So I'm grateful for that. Thank you to the team for all the information they've put forth. But frankly, the last time this board had an emergency meeting was in March of 2020. And calling an emergency meeting has sent our community into panic, because they didn't know what we had seen from a numbers standpoint. And like I just told you, the numbers are the same as what we saw in January, and we didn't call an emergency meeting. So it sent our community kind of into a panic. And then this weekend, when we did receive results a little bit earlier than I thought we would, because we were all told that we were going to have our results out on Monday, that the team, whenever we read our statement, we're our team, and Dr. Gullett's a part of our team, and these folks are a part of her team. So we're all a team in this together. And whenever we receive the results, and we've been told that the team is going to release them by noon on Monday, and then we saw results go out publicly ahead of that, it was a little shocking, frankly, because again, that sends more panic and more confusion. And I believe that our team of principals that was here talking to us are doing a great job. And we had wonderful leaders here, and we have 40 plus more of them that were not here today that are doing amazing work in their schools. And they're adjusting as the plans need to be adjusted, and they are the leaders we've put in place to make these changes. Whatever needs to be done, they're going to do it. And I'm just grateful for all that they've already done and how they're continuing to adapt and adjust. But I believe that this board, my hope is that whenever we consider working together as a team, that we will communicate as a team, and that we will push forward for the betterment of every student and every employee as a team. That's all I have to say.
Thank you.
August 5th, Thursday, August 5th, I came before this board in a work session and asked that we do a temporary mandatory mask mandate with the opt-out policy, with the opt-out clause. I again came back the following week on Tuesday and asked that we do something as far as addressing the mask policy. I again came back last Thursday, asked the same thing, because the numbers did not go down from August 5th till today. The numbers kept increasing. We have a responsibility to this community, to the whole community, of which our students make up this community, of which our staff members make up this community, of which the parents make up this community. We have an obligation to do what's right, again, and make things as safe as possible. Did not ask for a year-long mandate, set temporary. We have had the ability to have made this decision prior to the start of school. We still have had it once school started, and we have failed to make a decision on it. My stance has not changed. I still believe that we need some type of mask policy, mask mandate, whatever you want to call it, how you want to do it. And I think that parents, and I agree, some parents want to have that right to make a decision about whether their kid wears a mask or not. I'm in total agreement. Let them opt out. We said that it was too much work to put that in place. Well, it's too much work for our drivers to have to drive multiple routes. It's too much work to have our teachers not be in school and paras are running the classroom. It's too much work. That's what we're here for, to work, to do what's necessary, to keep our people safe, to keep these kids in the classroom. Work is required to keep the kids in the classroom. And it's the duty of this board to do the work, to make sure that kids are staying in the classroom, that our people are as safe as possible, that our buses are on the road and getting to where they need to be on time and in a safe manner. We're killing our staff members because they're overworked trying to get kids to school, and with short staff, we're killing our teachers. We're killing them because we're trying to do this, and we have not put those things or done those things that we need to do to help them be safe. How do we help them be safe? Again, the science on the mask, that's all over the place. That's all over the place. But we do know that they can help mitigate. They can help bring the numbers down. That's what we're asked. That's what I've been asking for. Let's get the numbers down. We've heard from medical professionals. We've heard from medical professionals. We've heard from parents on both sides of the issues. We've heard from medical professionals on both sides of the issue. We've heard from students. They're out there right now probably waving signs and things. But, and I want to go back and ask the attorney this, because when I understand something, when those kids come to us, whether they're on the bus or in our classroom, there's a word in loco parentis, meaning that they're in our custody. Am I right, attorney?
You're correct.
And that we're supposed to make the best decisions to take care of those kids while they're in our custody. So I feel that when those kids are in our custody, that every one of those kids, our responsibility. And we should do what's best for them while they're here. I also thought about this. We saw it, and I'm gonna tell you, it really bothered me to find out that people were sending their kids to school last week that they knew was positive, because that to me was a blatant disregard of other folk, of other people. I can't control other people, what they do. And we said, this is what we said as a board. We're praying that everybody's going to be responsible, they're going to do the right thing. Well, listen, we live in a society where we know everybody does not do the right thing 100% of the time. And if that's the case, we as this board have to recognize that and say, hey, there are some things that we need to do to even the playing field. And that's what I'm asking for. I'm going to ask you all again. Let's put something in place. I agree. There should be some phase out here. I'm not saying it needs to be a whole year. I'm not even saying 6 months. But there needs to be some way that you gauge this. The CDC or whatever said that 5% was good. I'm not even saying we got to get back down to 5%, but let's at least get down to 10%. We're at 27.4 or 0.5. Let's get back down to some reasonable number where it makes sense that we say masks are optional. It doesn't make sense for masks to be optional to me at this point. And I'm going to keep saying it until we do something about it or until the numbers go down. I meant that. I said that. I'm going to stick to that. I keep hearing when we're talking, having these discussions, we keep talking about the percentages and all of those type of things. I'm looking at lives. One life is too many. One sickness, one hospital. I'm personal with some things. 3 family members with COVID since Friday. 1 since I've been sitting here. I just got the text since I've been sitting here. Another one. So that's 4 family members with COVID. That's not the school district's fault. That's because people in society are not taking this thing as serious as it needs to be. We as a school board have an obligation to make the tough decisions. It's not about anything else but just doing what's right. So my stance has not changed.
Thank you, Board Member Cummings, and it is important for all of you to know that it's not just here in Marion County Public Schools. St. John Lutheran School is closed today due to COVID issues. So that's exactly what we're sitting here for. We are trying to avoid widespread school closures. We're trying to avoid rolling disruptions. I have another job that's not on the school board. I do rental properties, and I will tell you that there was a huge lull in inquiries from travel nurses to rent our properties. Well, now I'm getting messages 3 and 4 a day. So anyone that says that the hospitals aren't suffering maybe isn't getting the same kind of information that I'm getting, because as a business person, I see both sides. And the fact that neither person from Advent or Ocala Health was able to come personally today and send a letter goes to show you, what they're going through. I wanted to wait until the first 4 days of school just to see the reality of what's happening in our community schools. And that was enough to convince me that what we're doing now is not sustainable. As board members, we cannot have conversations outside of a board meeting because that's a violation of sunshine. Right. The reaction that I received in the community by the information that I shared is information that anyone could call. It was released on school email, which is a public email. We all have great relationships with our school staff. We can call them anytime, and I know that we do. But for me, in advance of a meeting of this level of importance, and no one's going to convince me that this isn't an emergency because we are 4 days into school. It's not January. We're 4 days into school and we're already at January levels. I don't know what other definition of an emergency anyone might need. So let's just put the cards on the table. And again, everyone is going to have to do something differently. If you want your schools to be open, if you want your kids to get the education that they need and deserve, and to have the number of employees with us that can do the job.
Chair Thor, before Ms. King say anything, just real quickly, and I just want to echo something. We keep trying to minimize this thing, and I don't know if anybody is paying attention to the news or whatever, but I'm talking about locally. 2 Saturdays ago, the Walmart in Summerfield had to be shut down because it had to be cleaned because of COVID. This past Saturday, the Walmart on 40 had to be shut. When you have businesses that are shutting down because of this variant, that ought to send a signal to that somebody's antenna ought to perk up. The hair on somebody's neck ought to move because it's just that serious. And we can't keep kicking the can down the road.
Thank you. Vice Chair King.
Okay. I'm just going to begin. I don't think that we should be, waving fingers at each other and saying what we should have and could have, because we were making the best decisions that we knew at the time. I will say that in the past week, how this has been different from last year is we have, and I'm sure the rest of you guys have seen these, we've received a gentle nudge from our medical community on some decisions that have been made in our schools. It spoke to me. I am not the expert in the medical field, but when the experts start talking to me, I listen. And it's not just 1 or 2, it's been several that we've heard from. I am in favor of making the mask mandatory in the schools, but with the opt-out option for the parents. We do know more than what we knew last year. Last year, it was everybody had to wear them. Well, now we know, students have different reasons why they cannot. So I would like to see us less firm on that. I would like us to revisit it. I don't know if you guys want to do weekly or by the quarter, because when the numbers do go down, because if it's my understanding, they are going to go down. They're rising quick, and they seem to think that it'll probably drop quick. And when it does, I think we should revisit that and not do like last year where it was to the last day of school. We could go on. If I've heard anything today is from our principals, they talked about flexibility and a team effort. And when I heard Miss Sandy say, at first she's like, there's going to be no tape on the floors, no. Well, she's a week into it, and guess what? There's tape on the floors. And they're all experiencing different things. And our goal is to keep our schools open. And right now, if we keep doing what we're doing right now, our schools will not be open, and our students will not be getting an education. And that's our ultimate goal. And that's pretty much what I have to say. And I will say this, I know, and the medical professions will even tell you the masks are not 100%. They know that they're going to share a mask, or they're on the floor, or they're doing things. But it might mitigate some to stop the blunt of what's happening in our hospitals, because we have very, very sick people in there right now. And our doctors and our nurses are exhausted. And, when you hear the stories about things that are happening in our hospitals, even if it's just one or a few, and I don't know with those numbers, I think it comes to us all being part of the community and doing what's right. So that's where I stand today.
So Chair, can I ask, can we do it for, again, we said temporary, and I'm cool with that, but let's put a time frame on it. I don't think it has to be I don't think it has to be an entire quarter. But I think we need to come back and look at it in 30 days, at least 30 days, and revisit where we are. As I said, I've talked to medical personnel, as you guys have as well, and they're telling me this thing is going to peak. And when it does peak, it's going to flatten out for a while. That doesn't mean it's going to instantly drop. I know some will say they're hoping it'll be a drastic drop. I hope it does too. But if it doesn't, we don't need to move we need to be flexible, as you're stating, but we need to use common sense in how we approach this thing.
Right, and I agree, and that's why I'm suggesting that we revisit it, because last year we were like to the end of the school year,
Right.
and we held firm on it because we had that information and we thought that's what was best. Now that we understand COVID a little better, I think it's good just to revisit.
And I think, as Ms. King was saying, we didn't know, last year we didn't have a vaccine. So that decision was made without a vaccine. We didn't know if or when we would get a vaccine. So we had to make that decision. So I'm in total agreement. Let's move forward. Let's do something.
And again, what makes this different is that the quarantines are killing us,
Madam Chair.
Yes, ma'am.
So I want the community to understand that if there is a mask mandate of any kind, if that child or staff member is within 6 feet for longer than 15 minutes, mask or not, they're quarantined. If there's a positive case, mask or not, both of them can be fully masked the whole time. And if they're within 15 minutes, 6 feet or less, quarantine or not. So I want to stress that because you were just mentioning quarantines. So I want the community to be aware, mask or not, quarantines are going to be quarantines if we have positive cases in schools.
And isn't our goal to reduce the quarantines, and isn't our goal to reduce the number of students that are getting infected? I'll answer my own rhetorical question. Yes.
And if I may, if we're going in, and if the board is looking to a mandatory mask with an opt-out clause, a couple of things that happens. First of all, and I guess Dr. Gullett can speak to this a little bit more, but it does put all of the onus back on the teacher for sure, because the teacher's going to now become the mask police, because there certainly are a number of emails that we've received on both sides of this, as we've discussed, but now the teacher has to make sure that the teacher is helping that student with that mask, depending on the age, and ensuring that if the parent hasn't opted out, then who those students are. And I can just see that in a secondary scenario, that's a large volume to keep up with. So I mean, we are talking about if we're having this opt-out clause, that is going to be significant work on a teacher to do. And I'm just laying the thoughts out. Additionally, if we go in that direction And the intention is that a parent can sign it without anybody else's approval, authority, no doctor, no anything. And a parent can just sign that form and send it right back in. I have a pretty good feeling, at least the numbers of people that we've seen today and those that have been emailing that they don't want their kids in masks are going to be turning them right back in. So if that's the direction we're wanting to go, and we're saying mandatory instead of optional, we're putting the responsibility on our teachers to police it, and then the parents will send the forms back as soon as they possibly can. And I just for information's sake, I want to make sure that that's the direction that I'm understanding that this board is interested in going.
And as far as everything that you shared, Board Member Campbell, you know, I'm convinced that there's going to be people that aren't going to be convinced. They already have their minds made up. Public school is available to everyone. We don't have the luxury of picking and choosing who we allow in or anything else. So we have to work with what we have. And maybe there'll be a few that decide, because of the way we're going to roll this out, which again, the devil's always in the details, and we're getting tired now. This is getting towards the end of the day, but we're really getting to some of the meat of this conversation, because it's one thing to say it, but how are we going to do it? For example, just a little history lesson. Last year, before school started, we had unanimous agreement among all 5 school board members. And I will say their names. It was Nancy Thrower, Kelly King, Nancy Stacy, Beth McCall, and Eric Cummings. We were united that we knew we had to do whatever we knew that we could try, because education's that important. And we were unanimous in that. And we were largely successful. Towards the end of the year, it became clear that learning had continued about this whole disease, and that it really didn't make any sense to have kids running around in recess and in open areas, you know, with their masks on. And our employees tend to want to really do the right thing, and they didn't want to not have the kids have their masks on and risk being, you know, chastised for doing the wrong thing and not following procedure. So see, these are the details that we have to work out. I do not want cloth masks. If we're going to do this, I think they need to be disposable. I think that those have the most evidence of possibly being helpful in a school setting. We have teachers that give kids tissue, you know, all the time, or tell them to go get a tissue. I don't see a whole lot of difference. And, you know, kid sneezes into their mask. Hey, Junior, take it off, put it where you know it goes, and get a new one on. If I don't want to look good and just make policy to try to look good and act like we're doing something. I want to be good. I want it to work. And it's the details that make the difference. Are we going to convince everybody? No, we're not.
Yeah, and what we're talking about, I don't want to see students outside with masks on either. We know now that when you're outside, it doesn't spread as easy. So students that are outside should not be wearing masks unless they choose. If their parents want them to, then they do. But if not, they shouldn't be outside when they're.
So if we're doing this, we could say those things that we need. I agree. I think it should be disposable, but I also think there needs to be a proper way of disposing it. There ought to be those bins at the school for these kids to get rid of these masks, and they ought to be frequent. From what we're hearing, they need to change it frequently. I'm in agreement with those things. But I'm also in agreement, as we're talking about this, there has to be something stated, said, put into place that when folk bring their kids to school knowingly with COVID, there has to be something done about that, because you're jeopardizing many people's lives. You're jeopardizing many people on that bus, in the cafeteria. You're jeopardizing many people's health for them to do that. I just think that is so, and I heard what you said, Ms. Thor, when you said, well, maybe it's because they have to work or whatever. I can't go. I heard it. I tried to make it fit, but once it was found out that they were positive, they had to come get them. They had to take them home. So they should have did that from the beginning. And I'm not. And I'm not in the mode of trying to chastise parents. Parents are parents. They need to do what they need to do. But when you intentionally bring, to me, that's almost like bringing a loaded gun to school. When you bring someone that has something, illness on campus of that caliber, that's how I see it.
Well, and again, with flu, it was different. You send your kid to school, it didn't create the risk that 39 other people were going to be quarantined.
Right.
That's the difference in a school setting. And we don't have control over the quarantine piece. That is a given. And if we want our kids in school, and the most important thing to us is to make sure they get their education, let's shift to, because I am very concerned about the details. We are going to be getting millions of phone calls and questions about how is this going to look in reality, and we need to have a plan for that, to roll it out. Again, it's late. Monday's already gone, just about. There's elementary schools have dismissed by now, some of them. But we need to be ready for tomorrow.
Dr. Gullett, can the homeschool liaison, with the paperwork and stuff like that, to alleviate some of that work? I mean, we did hire them to, maybe contact the families. I'm not sure, what they actually do, but when I think of, trying to unload some work on some teachers and we hired for these new positions, maybe they could somehow help with that.
Certainly, thank you, Vice Chair King. I too jotted some notes. I think we'll have to have some specifics, and certainly the liaisons can help with that, because I do think, as was shared by the board, we have a lot of staff that already have a lot of work to do to focus on, and so they are additional staff members, and certainly they can help facilitate that. The question would be, what's the process for that? Is there a simple form? And so I think you all are getting to that, but certainly they can play a role, yes.
Because we definitely don't want to continue to overburden people, and that is another point, is that when I look at these checklists, when I look at the work that went in over the weekend to try to pull all of this together, everyone's been working their tails off. So if we're going to work our tails off, let's do it in a way that's going to make it better as quickly as possible, so we can get back to the essence of why we're all here in the first place. So what would be the framework? We need to vote soon. We need to wrap this up. I feel like what I'm hearing is that there needs to be a motion on the table. And I look to you, Attorney Powers. Is that something that comes from the board?
It would be a motion on a consensus to draft a resolution. And the resolution could be for whatever period the board intended it to be, 30, 60, 90 days. It can be automatically expiring, or it can be expiring upon further action of the board. The motion would need to state with particularity a few things. One would be that if we're going to utilize an opt-out provision, overall the structure of that would have to be in keeping with 21-175 with the governor's order, which it would be if we had a true opt-out in which we were not requiring proof of a religious exemption or a proof of a medical condition or something like that. In addition, the State Surgeon General's recommendations that Mr. Lander referenced in 64 DER 21-172, I would incorporate that within the resolution as well. So the motion that would need to go into effect is a motion to draft resolution. What I would suggest is we would vote, if it's this board's desire to do so, that we would vote to approve that resolution effective immediately for drafting and signature at a later date. And so at that point, then I would draft it based on what the discussions are here today of what we want to be in there, which we know a good portion of that language would be the governor's order, the State Surgeon General's guidelines, and then a number of things that we've been discussing here, which I will be having to have this board meeting on rewind and fast forward a bunch of times to get to where we need to be. Some things that I'm hearing, the opt-out provision would be one thing that I'd have to put in there. We don't have to have a motion that is, 150 words long. in order for us to, for you to give me guidance on what to be in there, the motion would have to be that I would draft and prepare a resolution that is effective immediately to be signed and drafted, to be drafted and signed at a later date. And then, of course, I would make that a priority and get it to us as soon as we can. Some questions that I would need to have answered would be whether this applies to, the opt-out applies to staff and to students, because that's going to be part of the process in there, or whether some districts are doing mandating for staff, yet having an opt-out provision for students. Because under the Governor's Order 21-175, staff or not, that doesn't fall under the staff. Certainly the board would have the ability to require staff to wear masks, or to alter the means by which they're permitted to opt out. So that's item for discussion. We would also have to have superintendent staff, and I can draft it within the resolution, procedures for providing easy access to opting out, whether it's a checkbox on Skyward, whether it's sending home forms. I would need input from Mr. Ayers, most likely, about who it is that we are permitting to opt out a student. Is it the primary family? Is it the secondary family? Is it anyone on the list? This is not an issue that we've dealt with before. Now, for certain things, we may run into situations where we have a family that disagrees. One side wants one thing, mom wants one thing, dad wants another. I don't know. And I can only try to piecemeal together what that looks like, but that's up to you as a board to determine. Or we can remain silent on it, and if an issue arises, we're going to need to deal with it. We would need to state, probably with particularity, that no waiver is required with an opt-out provision. It would simply be that we are choosing to allow for opt-out. Again, duration I just mentioned, and I'd need to include the language. You answered one of the questions, inside versus outside, and I would need to know whether that applied equally to high concentration outdoor areas, such as we mentioned before in one of our resolutions regarding car line, where students are a little compressed, but it's an outdoor area. So those are a few sort of, I was just making notes as we went, things that I would probably need to know from you in order to either put it in the resolution or have the board tell me that they choose to remain silent on those particular issues. So.
Chair Thor, can I make a recommendation?
Sorry, I didn't mean to throw so much out there. I'm trying to
well,
make sure that when I draft it, I don't have an easy way to go back and ask you these questions.
Even something that's brought forward with the best of intentions, it is the implementation piece that where we will find success or failure. So thank you.
Can I make a recommendation that we need to try to get this, we're not going to get it perfect. It won't be perfect at all. But we need to try to get something in place so that we have communication with the public. I'm going to ask that we take a 10, 15-minute recess, and then we come back and try to work those things out. I'm willing to be here as long as we need to get it out so that we send out the right message. That's the thing. We can't put cloudy stuff out there today and then expect tomorrow to be clear and sunny, because it's going to be cloudy, and we create that cloud. So I suggest that we stay and get it done today.
Do we need to vote on it before we recess?
Since the motion,
There's no motion has been made.
there's not been a motion put on yet, so
So no, we don't have to vote on it yet.
we would need to.
Fine with either. Let's take a break. Or
One moment.
we're okay? Okay. All right. We will recess then until 2:45. Thank you. we'll go ahead and resume our school board meeting at 2:57 p.m. I'm beginning to discuss the details of a mask resolution with an opt-out. Attorney Powers, would you just brief us again on this process in terms of the order of making a motion, talking about the details of how we're going to implement this and roll this out, or talking about the details of implementing and rolling it out, and then making the motion?
Yes, ma'am. We would need to, since a policy change would have to go through rule making and development, which would take way too long for us to be able to have any effective date that would start immediately. Thus, it's something that we would do by resolution. In doing it by resolution, we would need to have such resolution incorporate the Governor's Order 21-175 and the mandates there, and the State Surgeon General's guidance under 64 DER 2112 from August 6. Those things that would authorize and indicate that we are, maintaining compliance with the law, yet at the same time providing for the opt-out provision as has been outlined. What we would need to do then is to have a motion and that I would draft a resolution in keeping with what the board has pronounced orally today. Much as a judge has an oral pronouncement in court and says what he or she wishes to do, and then a final order may be drafted at a later date. That's essentially what I'm calling on us to do today. We would make a motion and vote. If the motion passed, the motion would be to approve, effective immediately, for the drafting and signature at a later date of a policy mandating masks with an opt-out provision. And then we would specify in discussion what that would look like so that I could incorporate those items into the mandate.
Okay.
And I would also welcome if Ms. Martinez Lopez along the way has anything that's going to make it easier for her as the clerk in order to make sure that things happen appropriately, please, feel free to let me know and I'll make sure that happens.
Thank you, sir. We're good.
Okay, thank you. Okay, so looking at making a motion to create a policy mandating masks with an opt-out provision for any reason.
So, Chair, would it be a motion for a policy or for a resolution?
Resolution.
Resolution.
A resolution, okay.
Sorry, I was thinking resolution and wrote policy.
So it can just be a general motion, correct?
Correct.
Because we're going to put the details in it.
Right. The motion would need to outline that it would be a resolution to mandate masks with an opt-out provision in keeping with current Florida law and in keeping with the discussion that we're going to have regarding that today.
And I don't have to put any time frame on this right now. That needs to be in the details.
That needs to be in the details, because I need to, if I'm drafting a resolution, the resolution can be for a period of time, 30 days, 60 days, 90 days.
The time frame does have to be in the motion though, right?
No, it does not have to be in the motion.
Gotcha. So I move, Madam Chair, I move that this board draft a resolution for a temporary mask mandate with an opt-out policy. Details to be further forthcoming.
Okay, moved by Board Member Cummings, seconded by Vice Chair King. Is there any more discussion? Okay, all those in favor say aye.
Aye.
Aye. Campbell?
I'm opposed.
Okay, thank you. Just for the record.
No, I know. You didn't say all opposed. I was waiting.
All right, motion carries 3-1. All right.
Okay.
Now, we need to move forward into the discussion of this, and I'm already getting details on the fact that it's going to take at least a day to get masks from the warehouse and out to schools, so that is the first start. I want to make sure that it gets into this resolution that the masks that we will be providing will be paper masks, not cloth.
They are.
And that they will be changed. I believe it's every 2.5 to 5 hours. And this is something we need to think about depending on our schools, but it would make sense to me that whenever a student is, sneezes into it, I mean, that would be an example of a logical time to change it. After eating would be another logical time as far as I'm concerned. Also, when it comes to outdoor activities, I think it would be important for teachers to know that they can remind students that they don't have to have, the mask on then. Ventilation has proven to be a really effective disperser of this virus, so we want to try to be as least restrictive as possible. And, my frustration here is that we're going to spend a lot of time working on, rules and procedures when I don't know how we could make it more clear to the community that if everybody would just do their part for 30 days, then we'd probably be out of this mess. But it just seems like some people want to continue to argue about everything instead of taking action. So I feel a little pushed into this in some ways because, again, we just can't sustain what's happening in our school district. Our kids aren't getting an education. It's happening in the private schools too. So, you can run, but you can't hide. We have to deal with this.
Do we have enough masks? We can sit up here, and this is where sometimes it's easy when we're 40,000 feet level and we're not down to know. Do we have the mask or no?
We do not have that amount of masks if we're changing 4 times a day. We do have about 2,200 boxes times 50 in a box. That's 110 for the smaller children. And then we have probably in total about 410,000 for the larger ones. So the middle school, high school kids, and maybe some 5th graders. So if we're changing 4 times a day, then we do not have enough.
Okay.
And I'm going to ask, when it comes to the resolution itself, some of these items are items which need to be in the text of the resolution, and others are items that are going to need to be directives to the superintendent for staff procedures.
Right.
So I'll try to draw attention if it's something that needs to be in the resolution form.
Yeah, so we won't. Yeah. So that doesn't need to be in the resolution about the mask. That's the details.
Right.
So we're going to stay above that, right?
Right.
Okay, that makes sense.
That.
It does.
Because it would be really hard to enforce if a mask was not changed immediately, so I think that's.
Those are those common sense things.
Right.
And I would put in the resolution something indicating that, the superintendent shall develop procedures regarding,
yes,
the provision of masks to students and staff, something like that, more broad.
Yes.
With your permission.
Yes.
May I ask if the intention is for us to not allow cloth masks? Based off of the conversation that we're hearing today?
I'm saying that the school district, my preference would be for them to provide the paper ones because those are disposable. And we can't count on cloth masks that we provide being washed and.
Certainly. So I think what I hear you're saying, if we are giving the mask, they're going to be paper. We're not going to be handing out the paper, the cloth. If a student brings their own, it can be okay. I just needed to clear that up.
That to me, I'm in agreement with that. I think that if we're going to give any mask, let it be the disposable ones. And that those families, if they want to do, because some families have invested in cloth masks and
Right.
on all of, let them, if that's what they want to do, let them do it that way.
You know, someone handed me this morning, and it's called the Enro. You can breathe now. The perfect mask is here, and I guess they know about my sinus issues. And ultralight fabric, superior PM 0.1 filter, machine washable. So I don't know if these are hot off the press. I have no idea what they cost, but this is something that was provided to me, I guess, out of sympathy for my sinus issues. But I have no idea what these would cost. But I feel like I look around this room and almost everyone is wearing or a lot of people are wearing the paper-based mask, and they are disposable, and I like that.
Interrupt. We get advertisements every day of the greatest, best mask possible.
Yeah.
And they range from 50 cents to, $100 a mask. So be leery of advertising.
Yes.
Yeah. This actually came from a friend's wife, and he was wearing it. So, yeah, it wasn't like a company or something. I hope I'm a little smarter than that. Okay. So then the next question is, as far as the systems and the procedures and the processes, I think we've certainly made the case clear that we need to bring our numbers down. So how we're going to go about doing that with this resolution and how it's going to be implemented,
Madam Chair,
when will this begin?
can I ask,
Yeah.
can we hear from our union folk, Mr. Avery, before we start talking about those things? We want to hear.
We still have to talk about employees.
Right, so.
Good afternoon. It's not evening yet, fortunately. I think to answer Mr. Cummings' question, and the speaker earlier today stated it best, that there's going to be people on both sides. But as your employees, they spent the last year having to wear masks the entire time, with the exception, I think, that we had some maybe medical exceptions. And we have to try to protect all the students the best that we can. And so now I'm speaking as me, and I'll probably get 100 phone calls tonight, so you guys just put me on the spot. But I think that we have to do everything we can to keep the students and the staff safe right now. And I think you said it earlier today. So if you say the staff's going to wear masks, the staff will wear masks. I mean, they may or may not like it. I know last year we had masks and shields, so I think maybe you should specify what kind of face covering you want them to wear. And then we can go to that. I think the other thing that's not been mentioned, and I know someone asked me earlier, is I said that you have to keep yourself safe too. So we've said that face-to-face instruction is the most important, but it doesn't say I have to be in the student's face. That I could teach from my room from a distance if that's what I need to do as the individual to make myself feel safe. Because if your staff doesn't feel safe, then they're not going to be able to effectively teach because they're not going to feel comfortable. So if you're saying you must circulate the room, you must be over there, and I understand each position is a little bit different. I know the kindergarten teacher is going to have hard time standing in one section of the room. I believe last year Mr. Corcoran even said that as long as teachers stood in the room, so they were in front of children, that would be better than them being online. And so, and I'm not advocating for all the teachers to do that, because that's, as you said, is going to be an individual situation and individual class and individual health. So, but we need the teachers there. We need them to be healthy and doing the right thing as far as not coming when they're sick and such. And I think we've had some of those instances just as well as the students. So, any other questions? Is that what you meant, Mr. Cummings?
Well, I wanted to make sure that we're hearing from your side as well. as we're deliberating about what we need to do and put into place. We don't ever want to get so far out that we forget to talk to the stakeholders, and the teachers and our staff are stakeholders in this process as well.
They're nervous. I think it would help. I think this will help them. I know they're going to worry about the workload, as you said, as far as who's policing this and stuff, because that makes extra chaos in the classroom and the school level. And I don't have the right answer for that at the moment. But again, it's how are we going to keep people safe? How do they know that they're going to keep their families safe? And those things. So,
thank you.
Thank you.
And how do we keep these quarantines down, and how do we be mindful of all the money that we spend is our money, meaning we as taxpayers, and we have, I believe, have done a pretty darn good job taking care of our employees. Employees that weren't even working, were paid all through the shutdown. We've added the extra on top of what the government was providing for leave time. Every family's situation is different, and there's always going to be those cases where even that's not enough. But we will have a lot less of those issues when we have a lot less of those numbers. So I'm inclined to say that the masks or a face shield, we all saw Principal Manresa today with a face shield on. She, was principal of Hillcrest School. A lot of those kids are nonverbal. They really need the facial cues to understand things. From what I've learned, that a face shield that is properly fitted in the right length and comes around, it doesn't keep it all from floating around, but it helps reduce it. And anything we can do to reduce the viral load, and hopefully will reduce our numbers. So I don't know that I would want to mandate for employees, that they have to wear a paper mask. Because again, if you're a SLP, a speech therapist, how is a kid going to learn to roll their R's and enunciate if they can't even see the therapist's lips move? So there's some real practical concerns here. This is why I wish we weren't in this position in the first place.
Madam Chair, while we're on this topic, if I may seek some clarification, then I hear that if we provide anything, it's going to be paper mask, but to the point of the face coverings and the shields, I know that we had purchased those, so I'm looking to my team to see if we still have those in stock. Is it the pleasure of the board to not distribute the shields if those are the preferred method? May I just see? We still have those.
26,000.
26,000 face shields. So for clarification of the board, that would be helpful for us to know whether we could distribute those.
Oh, I think that face shields or the paper masks is what I'm thinking of, but rest of the board? Ms. Campbell, I see you nodding.
Absolutely. I mean, if we have inventory, and I am definitely of the mindset that especially our youngest children need to see expressions. They need to understand what smiles look like. They need to understand it's okay to have one. And to try to not be fearful of people, they only see their eyes. So I am all for that.
So then the whatever the resolution says, it needs to say that face covering versus face mask to include shields.
I think our last resolution said that too.
Said that,
It was a face covering resolution, not a face mask.
Yeah, and I think the shields kind of give people a little bit more freedom to the face.
Yeah. That's your king. You okay with that?
Yeah, that's fine. Thank you.
Since we were talking about staff, will we have an opt-out for staff?
My reaction is that unless, like last year, they have a documented medical reason, I think for 30 days or whatever we decide on, I felt like Mr. Avery's point was very well taken. We're here to keep students safe. We're here to suppress these numbers because none of us like being in this position. And we're doing all we can to take care of employees, and I know that we've proven that. That's my position.
I'm in agreement that staff should not opt out unless they have a doctor's note as well.
I think they can opt out.
I agree.
Uh-oh.
They should opt out. Have the opportunity to do so. And I'll give you an example, if you don't mind me telling a quick story. I've had a family that's been reaching out to me quite a bit. A husband and wife, both of them reached out to me repeatedly asking for a mask mandate. And one of their children is a teacher in our district. And I happened to walk into that teacher's classroom this week, and that child of theirs that lives at home with them was not wearing a mask. So he had opted out because it was his option to do that, though his parents were adamant that we make sure we have a mask mandate. So I think that our staff needs to have the option. If they feel safe to do so, then I think they should have the option to do so, make those choices themselves.
Who's more susceptible to this? Is the kids or the staff? The staff is more susceptible to this, from my understanding. Kids are spreaders of it, but staff are more susceptible. And we need to have the staff in the classroom or on the bus or wherever we need to have them at on the job. I think if they have a doctor's note or some exclusion, some reason to some exemption, they can do that. But I just think that if we across the board, whatever we do, I just don't want it to be cloudy. Again, I'm gonna state it again. It doesn't need to be cloudy. It needs to be crystal clear.
Well, and if we're trying to do a push here to get our numbers down so that we can get past all this, I think about adults and role modeling and the examples that we're setting with a very keen eye to not being so restrictive. You know, we're already talking about, you know, outdoors, no need, you know, let's take what we've learned and make people feel like that their kids are not being masked. That was the biggest thing that I heard of objections from the Unmask Our Children movement, is that, you know, they may have been right in some respects and maybe not in all respects, but that the kids were being masked, you know, muzzled 8 hours a day. And first of all, school is only in 6 hours a day, so there's that. But I sympathize with that position because, you know, to have a face covering on for that amount of time is a long time, and that's not what we're talking about doing here. But, you know, we are expecting our teachers to keep our kids safe. We are expecting them to have the adult judgment that knows that this is temporary, and we are just trying to get these numbers down. And I will circle it around again, that we have taken very good care of our employees. So is it really asking too much of them to wear a mask for 30 days or whatever it takes? Because we're going to be revisiting this almost every day. You know, we meet with the health department every week. We are monitoring our numbers constantly. We're on the phone with them. And so is it really asking too much with the type of resolution that we're talking about doing now for our staff to model that?
Well, the way I see it is we highly encourage it. We're saying we're having a mask mandate, but they don't. But everyone has a different issue, and I don't have to look any further than right here to understand that there's something, and you're choosing not to wear your mask, and we're talking about adults.
Right, and with a medical out.
Right, but I mean, what if they, you know, then they're gonna have to go to their doctor and get that out, and then what's the time frame? So that's what I'm thinking. And then who's going to enforce it if they have an employee that doesn't come in? I mean, are you going to fire the teacher or put him or her on leave for not wearing their mask? I mean, that's where it gets tricky, because would you rather have a teacher in the classroom without a mask on for whatever the reason is, or are you going to send them home and discipline them? So that's where we're getting in the details, and it's getting tricky.
Yeah. Well, what did we do last year, you know?
Well, last year it was mandatory, but I can also say this. I've walked in several classes where they would see me and all of a sudden they put their mask back on. Like, you know what I mean? It was like they were in trouble. And I don't want any teacher to think they're in trouble for not wearing the mask. So that's where it gets cloudy and detailed. And what comes to my mind is when I think about even the medical community that I spoke to, yes, they're highly encouraging wearing masks. Are they 100%? No. Do they know everybody's not going to wear them correctly or wear them at all? They know that, and we know that at this point. So that's why I chose that my decision, you know, but highly encourage it, most certainly. But enforce an adult to wear a mask, you know, maybe they will and maybe they won't. I just think, I don't know.
And I agree with Ms. King. I was with a principal last week who carried a mask because sometimes the principal wears the mask for all the people who are wearing masks, and sometimes the principal chooses not to for all the people who aren't wearing masks. So that way, modeling for both, because frankly, you don't want any one group to look or feel out of place one way or the other. And so I'm all for an opt-out for an employee, whatever their reason might be. And because we are putting this opt-out option in the hands of adults, which are parents, and all they have to do is sign a form, I think. We haven't gotten to that detail yet, but I think that's what they'll be doing, and all of our employees are adults. And so if we're putting it in the hands of parents who are adults, let's put it in the hands of employees who are adults as well.
The movement was to unmask our children. I didn't hear a movement of unmask our staff. I didn't hear a movement to unmask our teachers. The movement was to unmask the children. That was the issue. I think temporarily, I think our staff can handle it for 30 days. And again, we're not saying that if they have a medical condition that they can't. We're saying let's lead from the front. Let's lead from the front of this. And I'm asking our staff. I think we can ask our staff to lead from the front in this situation. And be the role models. We're trying to get the numbers down. We're at 27.45%. We have to kind of be deliberate. We have to be deliberate in our decision and our actions. And asking them to do this for 30 days, I don't think that's a big sacrifice that we're asking them to do.
And I'll say this, you know, even with my medical issues, all last week when I rode a bus, I wore a paper mask. Every school that I go to, I wear a mask, you know. And you're right, Ms. King, how do you really enforce it? We don't want to run teachers off, I get all that. But at the same time, maybe this will be one of those common sense situations where we'll be able to say, you know what, employees, think about what we're tasked with here. And think about the support that we're trying to provide to you. And use that to guide your decision-making. And I think that's the core of what you're trying to say. And to move this conversation along, I'll shift and say, adults, teachers, please be the role models because we want this to go away. So I'll go with a consensus of 3. And we'll see how this goes because we're going to be continuing to meet about it. So for right now, I guess that means we'll go with staff making their own good brain adult decisions. And let's move on.
So staff is optional? Are they opting out or is it just staff optional?
I don't think I have a strong preference one way or another.
I'm with you. I don't either.
And they all know what we're saying.
We do.
All right.
I got one more argument.
Hit it.
And let it go. Y'all know I just try to think things all the way through. So if it's instructor, teacher, whatever, that already has their own personal beliefs or whatever about masks. So that means when kids come in their class that are not wearing, they're not going to enforce that rule either. We do understand that, right?
Well, and that takes us into that conversation. Will it be enforced or
Will there
highly
be
recommended? And
will there be
this is
discipline associated with it?
with the students. We need to think about that. That makes sense.
Because what's going to happen is I don't have to wear the mask as a teacher. I don't believe in it personally, but because there's no real rule for me, I'm not going to necessarily encourage it, enforce it, or anything. If you say it, the leadership has to do it. Those people, those adults, have to wear that mask. Then they're more likely to handle that situation when it comes to the students.
But the greater conversation is to the enforcement piece. So if we are talking about, again, I mentioned that earlier, we're now putting the onus on the teacher, the staff person, whomever, paraprofessional, whoever gets tasked with now checking these opt-outs and obviously secondary, that's going to be a large volume. Is there going to be some kind of discipline associated with those that choose not to and they don't have the signed paper? That's really the question, because that goes to enforcement, and that's precisely what Reverend Cummings was bringing up.
And when we're done with this conversation, I'm going to ask you guys about guests and visitors, so.
But there's no visitors on campus right now?
Or.
In elementary
right.
only.
Or at events, so.
I think we need to be consistent. Again, I think we need to be consistent, because if you're consistent at the top with the staff, you can be consistent with the policy or resolution or whatever is only as good as what we put into it right now. If we leave too many holes in it, it's just like it's just pouring water in a sieve. So if we keep poking holes in this resolution, then there's no need to do a resolution. If we're gonna be the ones that's gonna poke the holes in it, there's no need to do a resolution. But if we're going to try to do something to mitigate these numbers, we have to quit poking the holes in it. And we're doing it ourselves right now.
Mm-hmm. Well, all I can say is what my initial reaction was, and we're stalemated, because there's only 4 of us. And having been a teacher myself, and having been a paraprofessional myself, and having worked in the schools as long as I have, are there challenges to, being the role model that you should be? Of course there is. Is there extra work that goes along with it? Of course there is, but I'll maintain that we've been doing a ton of extra work for the last 18 months. So whatever extra work we do, it needs to be towards an end that we all want. And if we're going to ask the kids to participate with an opt-out, then I didn't see that it worked that badly last year for teachers to participate with an opt-out. And sure, there's always going to be some, that don't do it. But hopefully that helps minimize it. And again, last year's not this year. We're already having this conversation, 4 days into school. So, and I know I keep coming back to that, but this is the gravity of the situation. So, can we enforce it on teachers and say, oh, we're gonna dock your pay or anything like that? God, I hope it doesn't come to that. I don't think it came to that last year. But I do tend to agree with you, Board Member Cummings, about setting a standard. That's leadership. And again, with the more relaxed nature of this resolution that we're talking about, I think teachers will feel more empowered. Like, hey, there's nobody within 3 to 6 feet of me, or I'm in my classroom by myself and the principal walks in. Why in the world would you feel like you'd have to jump up and put your mask on? There's there's a lot of distance between you and them. So I don't know that we can dictate for every single, well, what about this and what about that? How about just the overarching commitment here to what we're trying to do? I mean, we could sit here all night and tease out millions of details.
Exactly. Can't we say when in the classroom, when they're around students or when they're in a group setting, that they need to have their mask on? Or at least agree to something to that effect.
Day to day, Dr.
I don't want to disrupt, but perhaps it may be helpful. But as a reminder, I'm looking to Attorney Powers. Last year, the language said where social distancing is not possible. So getting to, I think, where you're going with the teachers and on her break during her time in her classroom alone, but that's, if I'm not mistaken. I don't think we changed that. It started with the language being where social distancing is not possible. So it may address what I'm hearing the board discuss.
Yeah. I can go for that. So when it's not possible, yeah, because I just don't want people being, you know.
And if they have a medical issue, I agree. If they have a medical issue, some let it, but I think that language is most appropriate. Because if they're in a classroom by themselves or whatever, if you walked in or I walked in and they got to jump up and put their mask on, if they're in there by themselves,
They weren't by themselves, though.
Well,
I will add that.
Or maybe they were at their desk and kids were away from them.
No.
Okay.
That's why I'm like, we could say these things all day long, but what they're really going to do, and that's my point is, I don't want us to lose an employee because they didn't fit our criteria. And at this point, with some more, what are we looking at? Are we looking at enforcing a mask rule, or are we going to just, you know, that's what I'm getting at.
Yeah. Well, we are acknowledging that there is so many different perspectives on this, but that the fact of the matter remains that we have to get our numbers down. So let's go ahead and
use that wording.
Use that word about when social distancing cannot be achieved, and with the expectation that we're doing the best we can to convey the message. So please get the message, and let's just go from there.
I can agree with that.
All right. So I think we're going to keep that language the same then. That's what I'm hearing? That's what we're doing. Okay.
So employees can opt out for the reasons in the last resolution. Students opt out because parents decide to opt them out. Okay.
So can we tackle that vendors or visitors to the campus piece as well now?
Mhm.
That'd be the next thing we deal with.
Right.
Because if we're consistent, those folk that come onto our campuses should have, it will be the same pretty much as our staff.
Including in our sports games?
There was a different, Jody's not here. It was something different with them because it was based on capacity. if
Because
I'm
they
not
did
mistaken.
50% capacity, which he's already told us in his report that we're not doing that.
That's right.
If it's outside, I don't see why they would need to have it. if
Indoor
they're
volleyball
outside.
games.
Are we having that many people attend volleyball games where it's packed gyms?
Yes.
Yes, sir.
That's pretty popular.
Very.
So volleyball, basketball.
Well, if there's only 30 days, basketball won't be in.
Right. So what are the sports that would be impacted in the next
Right now,
30 days that are
volleyball.
indoors? Volleyball?
Volleyball.
That's it?
I think so.
I know we have a lot of sports. Bowling?
So,
That's at the bowling alley, though. We can't take that.
I know, I was kind of kidding. Trying to lighten the mood a little here.
volleyball's the one that comes to mind.
Okay.
All right. We just reduce capacity then?
That's what I was wondering.
Yeah, I was wondering about the capacities.
Just maybe that. Because we know what happened at those games too. They weren't wearing masks.
And even at reduced capacity, people are not social distancing, guys. I mean, if you went to any of those basketball games I went to, they're all still sitting together. They really are. We can reduce capacity, but that doesn't mean they're socially distanced.
All right.
Man, you ran all the way from your office. I didn't know.
All the way.
In that shape,
All the way.
still in that
Not
good
even
shape.
puffing.
I'm right there. Okay. So indoor volleyball, yes, and bowling for the fall. The biggest thing, I mean, as far as bowling goes, it's outside. We use outside venues, and we sort of have to. But I will share. One of the things that will be helpful with that specific sport this year is we have split up our contest, and, because we're back to being able to use both facilities, which was not the case last year, but this year we are. So we will have about half and half at each facility as we go contest to contest. So
Is that for bowling?
that's bowling, yes.
What about with volleyball? It's still in the gym, correct?
It is, correct.
And do they still, are they sitting on one side or two sides of the gym, or how's it?
Each
Because
school-
I've been to schools where they just kept everybody on one side.
Some that has been the case just from a management perspective, but we can certainly, based on what superintendent or you guys decide, I mean, we can work, the schools would be willing to work on whatever it may be. They don't shut down one side of the gym purposefully.
Right.
In that situation, it's just more of a management issue, a lot of times administratively. But there are cases where both sides are open and both sides, you get a few matchups and there's quite a few people.
And then while I'm thinking about it, do we do any like tournaments, volleyball tournaments where you have multiple schools coming in? Is that a case? That's some type of scenario that we
In the next 30 days, because we're.
Yeah, I don't think, I think we could potentially be participating in some. I don't, off the top of my head, think that we are hosting any in the next 30 days.
In our district?
Not district, no. That would be closer to the end of the season, but there is a chance we would, I feel confident in telling you in the next 30 days, we're going to be participating in some of those, but not hosting.
Outside of our district?
Correct.
So what would be your recommendation, Jody? As far as volleyball, how would we do that with masks or whatever? I mean, we know that while they're playing, we don't want the students to wear them.
Right.
For those people that are attending those games, especially if you're doing wide open, if you got them, everybody's
Full
coming in.
capacity.
What is difficult for me to kind of, I guess, take in is thinking equity. The thing that we ran into last year was there's such an inequity just in sizes of venues and things, and it concerns me when we begin to take away some of that from some of the students just because they have a small gym. They only get two parents, or they get that's very, very hard for me to say. I get where we are, and I've heard all the discussion, but it's very hard for me to tell you that I would recommend us cutting back in those scenarios, because it does impact those kids when their gym is small.
And it was hard to enforce, or it was more of a preference, personal enforcement, as far as those schools that actually enforced those people when they came into the gym putting on masks.
Right, and I think that they did a good job, in my opinion. It wasn't perfect, but I do think that they did a good job, and they will continue to be available. That's one of the things we've been discussing that for weeks. We will continue to make them available at the point of entry. But, and I think we'll see a lot of folks using them. I do, but.
Why don't we just, I'm just making this, why don't we just leave it, it's 30 days. How soon do they start playing?
We start this week.
Okay, so it's 30 days. I would say just do the match for 30 days. It worked. It kind of worked last year.
And it's better than limiting.
Right.
For indoor sports.
Right, for indoor sports. I'd rather not us cut the numbers back in the gym.
Okay.
But if they're willing to come in with the mask, I don't have an issue with that.
I think the question, and I'm sorry, can I ask a question? Okay.
Of course.
Okay. I think the immediate question in my mind would be, then what if they're distanced? That's going to be what is presented to us, I think.
As far as social distancing?
Yes, sir. You get in a situation where there's 100 people and they have both sides of the gym open, and we're all 6 feet apart, or what, our groups are 6 feet apart. They're going to ask, and we say, hey, we need you to have a mask on.
Well, that's kind of part of the resolution, right? And again, this is the common sense piece of people. If you're with your family group and you're social distance from other people, then, to me, that's a time when you probably don't need to be masked. We're trying to be as less restrictive as possible and provide access and equity and just pound this down 30 days from now. It reminds me of those carnival things where the gopher head comes up and we just want to, just get rid of it. So that's
whack-a-mole.
4 people sitting up here is not, whack-a-mole. 4 people sitting up here is not going to cure this problem. Be smart. If you're going to be social distance, then you probably don't need to have a mask on. If you're not, put your mask on. I'm getting frustrated with this conversation.
Well, it wasn't intended for that. I didn't, I just want it to.
I'm not frustrated with you, I'm frustrated with, yes, I'm frustrated with COVID, I'm
Okay.
frustrated with,
I just want to make, we
it's
just,
not you, I like you.
Mad at COVID, not Jody.
That's right. Unless your name has changed to COVID, we still like you.
only Miss Boston Ellis is allowed to eat.
So to move forward,
Yes.
can we just say, wear the mask? Kind of leave it to the ADs as far as the distance. Well, it's been, leave it to the ADs. They know what we're expecting. They know that we're expecting them to put on a mask, so let the ADs handle that.
And you've got the relationship with the coaches and the families and all of that, and a lot of this is relational.
Right, it is.
You listen to
Exactly.
people that you respect.
But tell them we don't want to see no picture in the paper where the crowd is just, nobody got a mask on. Because we're saying in the next 30 days.
And while Mr. Phillips is here, I believe we've already, just for clarity's sake, I believe we've already said that the face coverings are not required outdoors. End of story. So football, this is not even impacting. Coaches, no employees, nothing. Okay, just for clarity.
Right.
Because they're outside.
I understand, but just
There
while
may
we're
be a
talking
little risk
sports.
there, but the risk is very minimal. So.
Understood.
Cross country, swim,
Right.
slow pitch softball, or other fall outdoor activities. Okay,
You don't have to wear a mask while you're swimming.
Please don't.
okay,
Or a coach on the sideline.
okay, right.
Right.
Madam Chair.
Yes.
Two things. So the things that Jody's speaking of there, I think that those are things that go to the superintendent's procedure as opposed to necessarily most of them being in resolution. But I've got, regarding the policy, we had regarding resolution, our former policy 8.90, which the resolution led into, our former resolution became policy, has a number of exclusions already that I believe are consistent with what you're discussing here. So I believe that in drafting the resolution, I would suggest that I place those same exclusions within the current resolution that came from our previous policy. So for example, it defines face mask, shield, or covering, it defines social distancing. It has a section 2, which indicates face coverings are required for every person working, attending, visiting, or doing business with the school board, including but not limited to buses, hallways, classrooms, cafeterias, restrooms, administrative offices, and the school board meeting room when not maintaining social distancing from other persons.
Does that, last year it was 6 feet and then it,
I think the 3 feet is now what we're dealing with, but there
we're
was also supposed to be
50%.
some clarification that is being provided or has recently been provided, and I'll need to look into that.
all right.
But we have a section 3, which is exceptions, which indicated nothing herein shall require the wearing of face coverings by the following persons. Number 1, persons observing social distancing in accordance with CDC guidelines, whatever that may be, 3, 6, it's flexible. Persons for whom a face covering would cause impairment due to an existing health condition, that's essentially the doctor's opt-out that we talked about.
All right. To do no harm.
3, persons exercising while they're maintaining social distancing in accordance with CDC guidelines. Persons eating or drinking while maintaining social distancing. Persons under the age of 18 while participating in youth sports, provided social distancing is observed to the greatest extent practicable. Students with disabilities and specialized programs whose documented disability would preclude their ability to wear a face covering. Persons communicating with someone who is hearing impaired where the wearing a face covering would impede communication. Persons for whom the requirement to wear a face covering would cause conflict with the ADA, provided that social distancing is observed to the greatest extent practicable. Anyone who's unconscious, incapacitated, or otherwise unable to remove the face covering without assistance. So in addition to the things you've talked about today, these factors seem to be the ones that would wish to include within our current resolution, correct?
I would say yes.
I would say yes, that they need to stay this.
In addition, just as a suggestion item, given Ms. King's concern, we talked about enforcement. In our prior policy 8.90, we had a section on enforcement and penalties that indicated that if there were infractions, violations by students would result in a level 1 dress code infraction. Talks about violations by employees, though this, to me, I don't think that if we're doing it in such a way that employees have the right to opt out, it's really not going to result in any disciplinary matter, correct? I mean, if an employee can opt out simply by choosing not to wear a mask. However, I think that I'm hearing from Reverend Cummings that the idea is to be that if they are in a group setting where social distancing can't be maintained, that we are going to require that employee to be masked, correct?
I believe that's where we got to,
Okay.
And that we didn't want to be legislating for the lowest common denominator, that there's always going to be people that make their choices. But we have to be clear. If we're going to put all this effort into this, then we have to be clear on what our expectations are. And hopefully almost everybody will get on the bandwagon, and 30 days from now we can have a party.
And so I understand from Mr. Powers, according to the previous resolution, that students not wearing face coverings, if they don't have signed parents' opt-out form, then they will be dress code violations.
Under the prior policy 8.90, yes, that was the case. And if we wish to maintain that and carry that forward, we certainly could put it within the resolution itself as an enforcement provision.
Well, the dress code violation was a phone call to the parent,
Correct.
correct?
Correct.
But it's also lost instruction time.
We're getting plenty of that right now.
Right, right. I mean,
Well, again, we have the homeschool liaison. I don't know what their job descriptions are. Seems fitting to me so that the classroom teacher can,
Right.
teach and not have more put on their plate. Maybe they could be used to call the parent and say, hey, your student is, not wearing their mask. And because that's a family decision, right?
Correct. And you're right. I think that is where the homeschool liaison should come in. It should not be lost instruction time. It should be the teacher saying, okay, I see this kid just keeps violating this. The homeschool liaison calls the parent. And if this is the thing, it puts it back on the parent, because the parent's going to say, I'm tired of you calling my house about this. I'm going to send you a letter. And it puts it back on the parent and that conversation with the parent and that child.
So back on the letter, since we just brought that up, Dr. Gullett, how quickly do you anticipate that we would be able to distribute said opt-out letter? And how might that go about being, how's that going to, it could have gone out in our packets last week when we received the medical packets with you. I know, coulda, shoulda, woulda, I know, I get it. I'm asking implementation.
Certainly. We could put a message out to all of our families using Skylert and let them know. We would have to have an expectation based on what the board's decision is on when this is enacted. Because whether it's a letter or I even said to the team a form that they can go online and fill out if the board allows, we could put that up there tomorrow and send a message out. But we would need to have a deadline, some parameters.
So when you say a deadline, you mean it's not just going to be rolling?
Correct. We'd have to be specific.
That you need to have this opt-out in by a certain date?
I would think yes, because otherwise, even if the message is received, they'd need to know what the expectation is to have that in. Correct.
Along with the goal that we're trying to get ourselves out of this in 30 days.
Correct.
Right.
I mean, I think we need to keep restating that there isn't anyone sitting here that is thrilled about any of this and is looking forward to infringing on anything. We have to get out of this. We have to get out of this and get back to a more business as usual type of school year. And That's going to take communication from everybody too. For example, if a student has been quarantined, then, that turnaround time, and that's where the homeschool liaison, I think, really needs to be helpful, because it's hard on teachers. They're trying to teach their classrooms of students, and then when you have a bunch of kids being quarantined, now you have to come up with work for them to do at home and make sure it's uploaded to Canvas and all this other stuff. We are asking teachers that are already overloaded to basically teach two different ways without acknowledging it, and that's a lot. That is a lot. So wouldn't it be better to just not have to do this?
And if everything goes the way that it should, maybe in 30 days, we wouldn't have to do this. That's what I'm hoping for.
Yep. Send them up, preacher.
Would 30 days, I mean, we've talked about that number several times. Would we wish for this
Solution.
would we wish for this to go for 30 days, or list it for 60 to be reviewed, or until further action by the board? How do we wish to do that?
I want to say until further action by the board, because that means we could do something sooner. I think that the community is going to want to know, how often definitely are you going to revisit this? And I would say we're going to be revisiting it weekly, because we have our weekly conversations with the health department and how things are going in our hospitals and all of that.
And that does bring me to the next question, which was the same thing we had with our previous resolution. If it says until further action of the board, a further action of the board is actually a vote, which means that if it's going to be 2 weeks prior to us being able to get the next vote, we would have to, at a work session, have consensus and then have the action occur.
Codify it, yeah.
Later.
I wonder, because I think it was mentioned by, what if we just had some numbers, if we could somehow work with Mark Landers or something and say, okay, and it makes me think of like Camp Kiwanis, when the numbers were below 7.9% or whatever, there were some numbers that we were looking at. So if we say, okay, our community spread is 8%, then I don't know if we would necessarily have to wait for the 2 weeks. If we had some numbers that criteria, yeah, does that make sense?
Yes.
Or triggers. Yeah, that's what I'm thinking about.
Chair Throws kind of mentioned that initially about a fade out policy or fade out numbers, some way that we can get there. We just need to say what number it is. I think that needs to be based on not just us saying it, but what the health department recommends.
And there might be times when it comes off that when the numbers go up, those trigger numbers, they come back and just be fluid, and then that way we don't have to
keep revisiting this thing over and over.
Yeah, it's sort of like when you're getting bombed, you go into a shelter, and then when it stops, you come out. Maybe I'm oversimplifying, but.
Well, I think that puts us in a better situation, because the community, my thing is communicating with the community. If the community knows, hey, if we're at 10%, it's a possibility we're going back. If we're below 10, I'm just saying 10%.
Right.
We're below 10%, we're moving to a different direction. I think if people know where you are, it takes away that anxiety and that frustration. We're not trying to restrict the community. We're trying to save things. So
I'm almost thinking in terms of quarantines, because, if we get below 10 quarantines a week, again, arbitrary numbers right now, but I think it needs to be tied to the school setting, because what's happening in the community does impact the school, but not 100%. You see what I mean? And if people that are sending their kids to school have gotten the message, they're going to start doing what they need to do, because none of us like this. And so while the community may still be rather high, we may not be seeing it as much in the school setting, because we're doing our mitigation and things are better. So I'm just thinking out loud here. I hope the message is clear that, we just want to get set criteria that make sense for our schools and our environment. And that may be a little bit different than the communities. Maybe it isn't, but let's see what the medical folks have to say and try to get some consensus from them. Yes, ma'am.
Yes, thank you, Madam Chair. So today at 4 is another one of our calls. We, if you recall to the board members, that we've shared that in addition to our Wednesday calls, we now have Monday calls with them. So we can seek clarification from them for some categories. I know it doesn't help us right now, but we can certainly discuss that and bring that back as well.
And if the board wishes to do so, I can have if Mr. Lander is comfortable with providing us with number guidelines that he believes make sense in communication with the superintendent and her staff, I can incorporate those into a resolution and then submit it to all of the board for review.
Okay, because I think below we were looking at a criteria of 50 cases per 100,000. That's the moderate level of community transmission is a pretty good epidemiological metric. So that might be one to keep in mind. And I think, we might have some unofficial agreement there already. Because that's really important for the community. They need to believe that,
So is there's supposed to be a health call at?
3 minutes.
In 3 minutes.
Yes, sir.
So
You're the board member on it.
Yes, sir.
Whoever's the board member is.
It's me.
It's our Monday call now. We've added the additional
You gonna opt out? Okay.
Monday, Wednesday,
So
and
do we need to do a break?
Well, where are we with this? Because Vice Chair King offered to get on the call, which is great to do. What else do we need to do at this point? Are we looking at a point where we can wrap up or not? What more needs to be answered?
I think I need to do some drafting.
That's what I was
I
thinking.
think that I will encounter some of the questions that I probably needed to ask then during the drafting, but some things that I'm just going to have to, as we start drafting, find out are there any other directions that we had not considered here. If so, I will remain silent on them in the resolution if the board has not spoken on them thus far.
So will we have, what would be, if we wrap up now?
What do we have for tomorrow?
What's the clear message for tomorrow? If we don't have a clear message for tomorrow, we need to have we need to hang in here till we get a clear message, yes. And that's why I'm asking, do we need to hold off and recess or whatever? Let us come out and get the information and do what we need to do? I just want, you guys are getting the same emails I'm getting. You're getting the same phone calls that I'm getting.
We got to be clear.
We need to be crystal clear so that there's no, and we don't need to get the calls. We don't want the principals and the parents or the students to be in limbo. We need to kind of have it as airtight as we can get. It will not be perfect. Let me say that. It's not going to be perfect, but we need to have it where there's not so much confusion. That's just my suggestion.
So if we are working to implement this tomorrow, I'm just curious if we can have that opt-out option available also tonight so that there can be students come tomorrow if their parents have already opted out. I mean, I'm sure you all know there are multiple families that chose our district because we had optional masks. Multiple families that are in our schools right now because of optional masks. Multiple families that were on MCPS online that chose not to go to private school because of optional masks. So I want to ensure that before we say everybody has to show up tomorrow in masks, we need to make sure that those parents can go ahead and opt out tonight.
Hey, let's do this, because we have a Department of Health call right now, and that's very valuable information. Why don't we recess until that call is over with, and then we will come back together, because I don't want to leave here without having a clear plan, just like you guys were saying. Our community deserves that. I see people forming questions to me from the audience right here, and this is a team thing. So let's do that. Let's get that call done. You need to be on it. And then we'll come back when that call is ended. So we will recess at 4:01. We're resuming this marathon board meeting at 4:56 PM. Go ahead and hand it back over to Attorney Powers and Dr. Gullett for some updates. Questions?
Okay. Would you like to proceed first?
Certainly. Thank you, Madam Chair. I certainly can. So in our conversation with the Department of Health today, we asked the question about recommendations for data and guidelines for when we might, if the board moves forward with the facial coverings, might conclude and when that change might occur. So I want to provide you a couple of data points. We are currently in high transmission. When you look at community spread, which is available through the CDC website and is tracked even in Marion County. So we're talking about Marion County. And so we're currently in high. The recommendation that Mark Lander shared with us would be if the board moves with facial covering that we would move to, once we moved out of high for 2 weeks, then we could consider a change. So that would move us from high down to the next category, which is substantial. Now, there's two components to that. One is a positivity rate. So currently high is 10% or higher in that range. That would be when we are at a positivity rate between 8 and 9.9%. So that's category number one. The other component of the community spread is the cases per 100,000. So currently in high, it's over 100, and it would move us to substantial would have to be between 50 and 99. So he says both components are requested to be moving us from one category to the other. So I'll repeat the beginning part. The recommendation would be if we're looking for some framework and some data, you look at community spread, it would be once we're out of the high category in both of those pieces, positivity and cases per 100,000 for 2 weeks, then we would reconsider. I'm happy to answer any questions. I know that's a lot of moving pieces, so.
What was those numbers again? 8.9?
Yes, so the positivity categories, Mr. Christian, are you able to pull that up? It might be helpful if we could pull up the chart while I'm doing this again. Two components to the community spread. The first is positivity. High is 10% or higher. Substantial is between 8 and 9.9%. And then for the cases per 100,000, high is over 100 or over. And substantial range is between 50 and 99 cases per 100,000. So, I think we need the categories of the CDC.
I don't see them on this page.
Okay. So those two components are what we'd be looking at together to take us out of the high range into the substantial range. And his recommendation is 2 weeks after that to allow for those fluctuations in data.
I'm sorry. So
You're fine.
what was the positivity rate for high again?
10% or higher.
10% or higher.
Yes, and we'll,
The colors are the same though. They do color code everything.
yes. I'm just thinking of the showing them that chart that we had on the call.
Look up table. It seems like I recall seeing a table.
It was down here, but that's.
It wasn't, okay.
So for clarity, high, he suggests 2 weeks outside of high. And high is 10% or higher or over 100 cases per 100,000.
That is correct. And once we've moved out of that, so let's say we move down into substantial in both those categories, he said 2 weeks after that point.
2 weeks after.
2 weeks once we've attained substantial. Once we've moved down to substantial, wait 2 weeks and then revisit that.
That makes sense.
And it's meeting both criteria.
I'm sorry?
Meeting both criteria.
That would be correct, because there were examples, and we had examples from this past year where one data point was in one category and one was in the other, and that was the question that was asked is, what about, he said, well, ideally it's both. Ideally it's both, because there are times when one category is in one component is in one category and the other is in another. So his recommendation is that both, that's the CDC guidance, that both are met.
Do we happen to know how often, I'm just curious, probably not, you're not going to have the answer to this. I was just curious how many times throughout the last year that we've met both of those criteria.
I was just saying we'd be able to see it daily.
Yes.
Oh,
Right. I was just curious, out of the last year, how many times we have met both of those criteria.
I know we were way down this summer.
Well, even, I think they made mention, even before school was out, there, it did reach that.
Okay.
So it wasn't high all last year. I don't remember,
not.
I don't think they told us every time, but they did, I think Andrea mentioned it, that we.
She did. And we were actually down to the low, we were in moderate for a while. We were actually dipped down to low at one point and then dipped back up.
Yeah, because we were down below 5%.
Correct.
Yes.
Correct. We were.
I think that was towards
We were.
the graduation, because that's when I looked at it.
Yes.
We were down very low.
Yes.
And I think that's coincides with the time that we moved to, the face covering not having to be worn at recess, and if Caroline, they could be spaced out and things like that. We moved to less restrictive that way right before the end of school, and then went completely optional for the whole summer. Now, granted, it's 7,000 kids versus 37,000 kids, but it was a nice break for sure. Okay. Anything else that we need to be aware of in terms of the resolution, and because we're looking at timing now? I'm already getting questions of, does this start tomorrow? And do I have to, I think it's already being reported in the Gazette that parents have to send in a note, but we're talking about as a form to do in Skyward. So the questions are already rolling in, and so is the media.
Can I touch on a couple of things? One of them, the clinic was brought up. So I think, right. So I think it probably needs to be pointed out, even if a student is mask optional, if they are having symptoms and in the clinic, then it needs to be mandatory. Like if we have a sick student, I think that's a concern for the clinic, if I understood that correctly. So that needs to be added in there.
Right.
And then,
So if they're showing, is that showing symptoms and symptoms?
And go to the nurse, yeah.
so if they're in front of the nurse at the clinic, if you think about it, if they're optional, they might be like, I'm not going to wear it. But if they're sick,
They need to put
they
the
need to
mask.
wear their mask because they're sick, and that's one way to stop the spread. And then it's my understanding, as far as the masks go, I believe they can be delivered tomorrow. So maybe we could implement it on Wednesday. And I think a easy solution for that is at the beginning, everybody's going to opt in unless their parent sends a letter. And then that's easier to track. So, for example, like Wednesday morning, everybody's opting in. Parents have enough, they would know today and tomorrow, I don't want my student to wear the mask, and they can send that letter, tomorrow or Wednesday or after. Unless you guys have a better suggestion.
Is there a way, and I know every parent is not on Skyward, but is there a way that they could click on Skyward, some box on Skyward, and it automatically goes to the school or something?
Well, the only thing with that is we still have a lot of students that don't have access
to
computers. So that's why I was thinking if everybody is opted in until they opt out, that might be an easier solution than parents not knowing or having access to that.
Is there consistent language that we could say this is what the letter needs to say, or so? Just because does it need to be typed? Does it need to be handwritten? I mean, I'm not trying to get into the nitty gritty of the details, but if it doesn't say specifically, how our emails have looked. So, some are like 3 sentences and some are a diatribe. So like is maybe if we had some consistent messaging or something, what that opt-out letter needs to say?
I can speak to that.
Thank you.
The opt-out letter does not need to have anything other than the ability to verify that, in fact, it would not be legally preferable for it to have language of a waiver or anything of that nature. We simply need to be able to verify that a parent has signed it in the same way we accept an excuse note from mom. So we certainly accept that as something that will give us an excused absence. It can be a checkbox on Skyward because a parent has to log in to Skyward in order to be able to check that box. In fact, my initial drafting that I've been doing here on a resolution specifically is regarding a checkbox on Skyward, an opt-out checkbox, a note from a parent or a form which we provide will be sufficient. Now, if we were providing the form or in the section in Skyward, the drafting that I have here is as to, hang on one second, sample language is for if we're providing it for parents for their information so that they then sign, whether it's on Skyward or whether it's in a note that we send home. The superintendent and the school board have deemed the current novel coronavirus disease pandemic to be an ongoing emergency in the school district. In the interests of student and employee safety, the wearing of face coverings is required indoors during the school day and at school-related events, regardless of vaccination status. Should recommendations from Florida Department of Education, Department of Health, or other authoritative or controlling government health agency, or Marion County and/or local government recommendations be revised, the school board may revise their requirements related to the wearing of facial coverings to comply with their updated guidance. Any student not wearing a mask pursuant to this directive must, through his or her parent or guardian, check the box in Skyward or sign a form notifying the district of this choice to opt out of wearing facial coverings. This language will be reviewed by the school board at every upcoming board meeting and will be updated as required. Please understand the CDC recommends universal masking for all teachers, staff, and students and visitors to K-12 schools, regardless of vaccination status. Properly wearing masks and facial coverings, physical distancing, and promoting vaccinations for eligible students and employees are key strategies that will assist our community to mitigate against the spread of COVID. And this is basically taken from some of what we had included in prior resolutions and some that based on our discussions today. That would be the information that we provide to the parents. As far as what they need to provide back to us is just some sort of informed consent that they wish to opt out. That's all. So if the board wishes to have some specific language that parents are acknowledging some degree of responsibility for their opt-out choice or something beyond that, that's certainly within the board's purview to decide to request that the parent have a specific form that they're signing which indicates a specific consent or a specific level of understanding, but otherwise, as far as what would be legally required, essentially the same as we require from a parent who's telling their kid, they're telling us that their student was sick.
Can we, because I can see some parents saying, I don't know what language to put into my note.
This is my point.
Yeah.
This is my
So
point.
can we give them some suggested language or whatever?
Suggested language for one that we would send home, I would want to keep simple.
Right.
And that would simply say,
I want to opt out of the mask mandate.
Yeah, that's,
Period.
that's simple.
Or this child, this child, this child, this child.
Yes. And when we are sending information to the parent, this is the language I would suggest that I just read to you. When we're requesting information back from them, that information need only consist of something which shows that they're consenting.
Yeah. So something
Real
very
simple.
simple. I'm sorry, something very simple that just says, I opt out, my child, whatever, opts out of the mask policy or whatever.
And from an implementation standpoint, again to the team, is it easier for us to just have letters, handwritten letters coming in, or is it easier for us to have some kind of form that goes out that then comes back in? That's a checkbox that, that's from an implementation standpoint. I've never been a classroom teacher or a secretary or, administrative assistant trying to collect all of these. And
So there's two ways to do this. So families can write in a very simple handwritten note and say, I'm opting out. Someone at the school level, though, would then have to input that into Skyward so that the first period teacher or the homeroom teacher can easily look up into Skyward what the family choice is. The other way to do it is to, just similarly to what we did for summer school, When we sent home that access and said, did you want to opt in for summer school or opt out? We can create something like that in Skyward, but the challenge there is that families have to know their username and password to access Family Access, and not all of them do that. They have to then communicate with the school, verify who they are, then to get their username and password.
We don't want to give the impression that we're making this overly burdensome to opt out, but at the same time, technology is what's happening today. So if it incentivizes parents to go ahead and get their username and password, that's only going to help moving forward. And the reason why I say that is, isn't all attendance being taken now electronically? So what I'm visualizing in my mind, especially in high school where it becomes so much more difficult because kids are changing classes, the teachers are taking attendance period by period so that it would populate with the student's name and then maybe an O next to their name, like a column with a code, and O would mean they opted out. So the teachers would know. Just an idea. And I don't know if that's valid, but, and some parents are always going to be more comfortable with a handwritten note, of which we would accept, because it sounds like that's all that's really required. But to have a form that's very easy to do that we could email out to parents too, then that way we would be covering both bases.
We just want to make it as easy as possible from a data entry standpoint, and that's what I didn't know.
Right.
Which is going to be the easiest. Easy's not.
Like when you get field trip forms.
Right.
I do, and I'm just.
Say it.
I do certain things in my church a certain way, and I create the form. I'll tell you what, I create the form because everybody can't write where I can read it. And then I have to try to decipher it and get it put into the system. So if there's a set form where it's clear and typed and we get it and all they got to do is fill in print the child's name and sign it, to me that's an easier input.
And maybe it's yellow.
Yeah.
Maybe it's like the yellow form that's everybody's receiving.
Yeah.
All 40 some.
Because everybody can't read everybody handwriting.
Right.
Okay, so we'll send a form. And still everybody's opted in until it's signed.
Right.
Right. So can we just do a simple form and give it to the kids on tomorrow?
It doesn't have to be a color. I just threw that out there because if we also emailed it out, then the families could print them off, I guess.
Yeah.
They sure could.
If you could put it on the website,
trying to
let
make
them
this
print it,
easy,
or
guys.
give it to them tomorrow and let them take it home by Wednesday, whatever the deadline you set, the superintendent sets for them to have it back in. And as they come in, whoever, our IPCs or whoever, liaisons input into the system, that would probably be.
Well, and for the tech savvy, if you send home a PDF that's fillable, then they can just email it right back, right? Isn't that usually the?
Well, that won't be an original signature.
Electronic signature.
What do you think about that, Attorney Powers?
I don't think whether it's an electronic signature or not, it's going to make a difference. I mean, I think if a parent, from a legal perspective, what you want to do is completely up to the board. So everything's within your purview here. But from a legal perspective, they can check off a box in Skyward. They can have our form from Skyward. A parent could tomorrow morning have their student show up with a note that says, I, the parent of Johnny Smith, do not want, I want to opt out of your mask policy. I want Johnny not to be required to wear a mask. Any of those factors from a legal perspective work. Now, to what degree they work for data entry or whatever, we do field trip forms, we do, as the board has indicated, attendance virtually, all those things. So that's really more a matter of simply we need to not be seen to be attempting to make it more difficult, and I don't think that's been anything that any board member has suggested. So.
And if I may, my concern would be turnaround. So I'm thinking about whether we send a form, and these are all ands, not or. Do a Skylert message, send home an example form, get the message out. I anticipate that some students won't take their papers out of their backpack for a day or so, perhaps. and a parent might miss the message they're working, or somebody hears it. So I would want to give sufficient time for us to do this correctly, so everyone has the opportunity to hear the message. I just worry about that.
Okay, so what's the final idea here?
Well, if the board is comfortable, I mean, I think it's going to take us a few days to get the message out to everyone sufficiently when we have the number of students that we serve. Ideally, I think it would be the beginning of next week. If the board is not comfortable with that, we'll certainly accommodate and do it at the end of the week. But I just worry that Wednesday, we're still sitting here and it's Monday evening, that they won't all get the message. And I don't want to put our families in a defensive posture that they didn't get the message and get frustrated.
And so to clarify, it would be as of starting, say, tomorrow or the following day during this week. If a parent wishes to opt out, would their opt-out be something which we expect to begin immediately or begin at a certain time next week? So is the opt-in, in other words, is the opt-in to be for immediately upon the student turning in such a note or a letter, or is the opt-in to start on another day? Because otherwise we might need to make sure we have mask distribution points in the meantime if it's not immediate, because I don't know that everyone's going to be bringing their masks to school.
Yes.
Well, and I think we've already heard that just getting them from the warehouse is going to take a day, you know.
Tomorrow by noon. Very good.
Tomorrow by noon. Okay. And we want parents to have the chance to get the messaging. And a lot of times it seems like Monday is the natural start to a week. But certainly we could start accepting the notes, right?
Absolutely. Absolutely.
And then it would become in force starting Monday. Is that what we're saying?
I think it's logical to expect that would be in place on Monday.
And in the meantime, you know, if the students aren't willing to, or they don't want them to wear a mask, whatever, that's going to continue through the rest of this week. Whether they're opted in or out. Right?
Yes.
Just want to be clear. What is it?
To me, that means it's another week of people not wearing masks.
Yeah,
It can be.
me too.
That's,
And that's too much grace period.
Okay.
I think if they, let them start sending letters in tomorrow.
Mm-hmm.
I think whatever we're saying needs to be, if we're saying we're having a mask policy, it needs to start tomorrow. And giving them the opportunity to get it into us until we formalize something that we're gonna get out to them. But they could, if they need to send a handwritten note tomorrow so that their kid doesn't get in trouble, we have to take it.
I was going to say, and so if we say it starts tomorrow, then we also say dress code violations start tomorrow. Is that also what we're saying?
Well,
I don't think we could
I don't think you
realistically
can
do
that
it tomorrow. I was like,
It's 5:20.
right. And I just heard Ms. Boston Sallow say that we can't get the mask out until noon tomorrow. So those who don't have them,
I don't think you give them this.
they're not going to have them available yet.
And I don't know that, you know, starting something on a Friday is almost never a good idea.
they could start Thursday. Here's your mask. You know, give them their mask. Look, parents who truly want their students to opt out or whatever, realistically, I'm pretty sure they're probably going to be aware of what's happening. And if they get a note tomorrow saying that on Wednesday you will either opt in or out, or Thursday, you know, the word gets out and they know. And if it wasn't something as urgent as this, when I see these numbers going up, I would feel differently. But this is, I see red on that screen. And
The whole
it could
state.
be, it's the entire state, and that to me could mean more exposure, you know.
And we want it to be workable, yes, sense of urgency. And people have been following this meeting all day. There's probably parents that already have the letter written with a few exclamation points.
Yeah. And some other words too.
And yes, and there's.
That's why I was going to give them language.
I know what you were thinking.
I'm like, can we just give them the.
Let's not leave ourselves open to getting.
We know how our emails have looked, and so I'm like, if we could just say, this is all it needs to say.
Yeah. Okay, so I think what I hear is that we will, parents can start sending their handwritten notes in as early as tomorrow. If we can safely say that there will be a checkbox on Skyward magically by tech people at midnight, after midnight tonight, they can log into Skyward and do the same if you want to open that door. Otherwise, we'll just say handwritten notes, and then the rest of it will be communicated out, and we will start this on Thursday. Because I don't know how quickly technology can do that. And
It is possible to add a field.
Looking.
I'm trying to find out how soon they can do it.
Okay. If there is another means other than handwritten to opt out within the next 2 days, you'll be notified via Skylert message and all the other messaging that we do. Okay. But for now, old school handwritten note is acceptable. Starting.
Neatly.
Neatly.
Oh,
Printed.
boy. No curse words, please.
Right.
Just a simple statement.
Right.
I'm opting my child,
Right.
Tommy Blue, out of the mask policy.
Right, right. Have mercy on the one that has to input it.
Right.
Because
Right.
human nature is you're going to read what you're given.
Not to the decision maker.
Yeah.
And just not to rehash what we had already discussed earlier, but I have gotten a couple of emails while we've been sitting here. The employees are not having the opt-out option, correct? Employees are, unless it's a medical, they don't have that opt-out. Okay, just for clarification.
The items that I expressed earlier on the draft resolution that would say almost all of them are followed by if social distancing is observed.
Right.
So we will allow employees in an outdoor situation, or my understanding was from what you had discussed, that we will allow employees who are socially distanced but are in their classroom alone, or whatever the case may be, so long as that's followed. That's in keeping with everything that I'm putting in the resolution.
Right. And that'll be nice modeling for the kids too, because and it's also using what we now know about the higher potential for transmission is not outside in the fresh air. So, and we know that that's good for people.
And the deadline for opting out would be next week.
Just going to ask for consensus. Is that also August 19th, which is what I heard you say was Thursday? Is it the same for staff as well as students?
A deadline for the opting out? So if on August, I need to make sure I have that in there then. So if a parent chooses, say on August 25th, to opt their child out on that date, we allow them to opt out for the remainder of the time, or no?
Because we also have kids that are going to be registering. We know that we've got kids, migrant children and stuff that'll be coming down from up north. So we have to,
So they can opt in or out, they can opt out at the time of registration,
right,
correct?
I would think so.
I mean, do we need a deadline, correct, Superintendent?
We need an effective date so that we can communicate when this is effective, and everyone should be adhering to what the language is.
Okay, I'm sorry, I
Is what I'm-
misunderstood.
That's what I think we need to
Unless you're
do.
new to the district, or unless you can document some kind of new medical condition, maybe someone just broke their nose, comes to mind, playing football. It might be kind of hard to breathe behind a mask. Things like that, extenuating circumstances. I don't know how specifically we'd have to get legally, but the fact of the matter is we want everybody playing the same game, with us, except for very few and infrequent outliers.
So if we make the effective date, I think if we make the effective date on Thursday, then our intention is that all of these letters and forms will all be in the next 48 hours. Is that? Or is it still a rolling, I think that was the question.
Yes.
Is it still a rolling, someone can send it in next week and then opt out at that point? Or are we wanting to have a deadline on how long they have to opt out?
I think we kind of need to have a deadline. We don't want staff to just keep dealing with 100 every day or whatever. I think if you go ahead and say you have from this date from now till next Thursday to opt out, and once that is closed, you had to opt out, you had to opt in for summer school, correct? And they had to get it in by certain deadlines. We work on deadlines.
How long of a window was that? Was it several weeks or?
We wanted them in, so we kept taking
It was
them.
rolling.
We changed
It
their mind
rolled.
after the first week we took them.
Yeah.
Okay.
What I was hearing was that the expectation would be that by Thursday, all staff and students would be wearing a facial covering.
Yes.
Correct? Until and unless they provide a note saying to the contrary. So I think that's what Vice Chair King was going to. It's an I'm looking for the expectation of compliance to say it is expected that by Thursday, everyone is wearing a face covering unless you provide a note, fill out the form. That's the expectation is by Thursday. So that would allow the time for the communication to get out. That's what I was looking for, if that's what the board supports.
It'll be a flurry of activity, and then hopefully it'll settle down.
And are you also asking for a deadline, though? Or are you okay with that information continuing to roll?
I'm satisfied with that as long as we're clear around what those parameters are, and they can provide it later. If they wear a face covering, decide to change their mind, then they can provide a note. That's fine. What I would like to hear from the board in terms of, get too much into the procedures, but I don't want our staff, and I know that you all agree, to be managing and burdened with who's wearing one and who's not. I think we have a lot more important work to do when educating our students. And so I heard the conversation about liaisons, and I agree. That's one of the reasons we've added them to our staffing plan, and they can make contact with parents, but I do not want us to become burdened with, the team to become burdened with tracking down and having this become a debate and a disciplinary matter. If the board is comfortable with that, I just think that's important.
Oh, agreed. I mean, we're trying to get people educated, and we need to be able to focus on that, and having them in school is how we do that. That's the only reason why we're doing this.
Thank you. Thank you.
All right.
Very good.
What else?
Mr. Christian, can you roll that screen back up? Sorry, sir. I just wanted you to draw attention to, this is the chart I was referring to that Mr. Lander shared with us at the bottom from our call, just so you could see those numbers. Those are the two components from the indicators.
Yep. And low is blue, moderate, substantial, high. Okay.
Yes.
Allison, I have an answer to your question that you asked earlier. Dr. Kuhn sent a text, and what he said was Marion County met both criteria for the substantial community transmission for approximately 1/3 of the length of the pandemic. It happened September through November 2020, and again March through July 2021. So here's your answer to your question. Yeah, so thank you, Dr. Kuhn. And he has a really nice chart that he sent that kind of shows the thresholds and stuff. Maybe
Ms. King, can you send it to the attorney?
to send out, yes.
Yeah, that'd be great.
So we covered sports, we covered visitors. Did we cover an extended day? I'm like, we took notes in the session. I just want to make sure we covered all the things I had written down. Extended day, obviously, when they're outside, it's going to be the outside policy, and indoors is the same. Okay. Like, I was trying to, an extended day because it's a different group, and it's a different, they're not the teachers, and they're not actually affiliated with a school. Will there need to be a separate note for extended day?
I don't think that's necessary.
Okay.
I do not. I do not think that's necessary.
Skyward, they pull out of Skyward too?
Yes.
Okay.
And they're an extended day as part of an extension of their school day with us. I don't think that's necessary.
Okay, just asking. I know it's two different
Thank you.
leadership streams.
Right. You.
Sometimes that matters.
We'll make sure to communicate that internally. Thank you.
The reality of the bus. Yes. How are we going to do this? Because I can see that maybe the driver, with their seating chart and their attendance sheet will say, it'll be on there whether a student has opted out or not, but is that going to impact where that driver may tend to seat them on the bus? We already have all these regulations. I don't think that girls and boys are sitting next to each other most of the time anymore. We've got a mix of students on the bus. What is the true workability in the real world of opting out on a bus and having the driver, especially if they don't have an aide?
Right. If they don't have an aide, and the time they're trying to get those kids to school, I just don't see that there would be too much enforcement. You're trying to get kids on the bus and get them to school as quick as they can.
And not holding up traffic. A bus got rear-ended today.
Exactly.
Everybody was fine. So I really need people's input on this one, because the last thing transportation needs is any more burden. And if we're gonna, whatever we're saying we're gonna do right. So in my mind, it's either a mandate for the bus or you don't ride, or it's optional of the bus due to the fact that a driver simply cannot be asked to keep track of who opted out and be looking in the rearview mirror every 5 seconds. Oh, Johnny, you didn't opt out. Put your mask on, and then trying to figure out after the fact who had one on and who didn't to do a discipline referral. I welcome your thoughts.
What did we have last year for that?
It was mandatory.
Keep it, and with the same exclusions as far as there's some kids that can't wear masks. I would say that would probably be the safest.
At least there's choice there. Some parents, chose not to put their students on the bus because they knew on a bus that it's really difficult to monitor kids wearing their masks properly, and they just weren't comfortable with that safety risk, so they drove their kids to school. Also because buses have been running late and so on, parents have chosen to drive their kids to school. I've been seeing a lot of parent collaboration where they're making suggestions like, let's get together and do some carpooling. That was suggested at the beginning of last year, so that's not a new idea, but it is a great idea. Anything anyone can do to help reduce the burden on transportation while we're working our way, to making it be able to be more smooth and reliable is helpful. But I just don't think that saying optional is going to have any worth. So it's either going to be, or
if I may just interject, when it comes to saying optional as opposed to the opt-out.
That's what I meant. I'm sorry.
Okay, all right.
I'm getting tired.
Because the one thing I would like to remind the board is that everything we've discussed stays very much on the clear side of Governor DeSantis's order and also State Surgeon General's recommendations. If we get into any situation in which, whether by setting a deadline or by saying we're going to do it differently on the bus, any situation in which a parent's letter does not permit us to, or does not permit that child to be opted out, we're at a sort of yellow light,
Mm-hmm.
We're not maybe at the red light yet, but we might be at the yellow light. We brought up like if a student is obviously sick in the clinic, and I think that's a good point that Reverend Cummings brought up, because that's something we can very specifically say this is directly related to a specific individual case. Legally, no one's made any determinations on this yet. But whenever we are having any discussion around limiting the powers that a parent's opt-out provides, we just need to be cautious, and I know this board is. So I just want to make that a little bit of a reminder there that when we talk about optional versus opt-out, we're talking opt-out, right?
Right, and I was confusing the two issues. Again, it's just in recognition of the challenges of transportation really being able to enforce or implement. So and point taken, and a good reminder that we're trying to stay on we're trying to walk all these fine lines. And so then to me, that circles us around at just having it continue to remain optional on the bus, because even if someone opts out, again, how is the driver going to be able to tell in real time driving, who's opted out, who hasn't, monitor all that, follow up on all that, and do a dress code on all that. Does anyone think that that's workable?
For the purposes, Board, of this resolution, shall we leave the language the same for the bus, that it is still opt-out provision and whatever, as opposed to optional? Or are we going to make it say optional? Because if we leave it as the opt-out provision, of course, we intend for that enforcement to be there, however, and it certainly, if it could be in the case of where we have paras on board or something like that. But in the event that we don't have the ability to enforce it, it simply isn't going to be enforced. But that's, I just want to know what to put in the resolution regarding that.
It should be consistent, in my opinion. What's happening in the school should be on the bus. Now, every bus driver is different, you know, and how they,
Yeah, I think the bus is an extension of the school.
yeah.
It is.
The disciplinary matters are what comes to mind for me on that. And I hear you loud and clear on that, Chair, that having them try to monitor who needs to get a discipline referral for a dress code, that becomes cumbersome. So I don't know, especially whenever they don't necessarily have access to Skyward, like we're talking extended day and teachers and all. I mean, they're not going to have access to that to see if that student has opted out. So navigating what that looks like, they have enough challenges right now.
Yeah, but the student knows. So it kind of puts it on them, you know, like, I know, even when you think about a classroom or a school, I mean, let's be realistic. It's not going to be uniform, right? It's not, because what is important to me may not be important to you, because I'm going to envision if we're in a school teaching and you saw a student without mask, you may turn a blind eye, right? I may not. So even with the buses, I think it should be important that we're consistent across the board. Leave that to the bus drivers, you know, and they'll enforce probably what they can or not. Because if there's a bus driver and it's extremely important to them that their students are wearing a mask unless they're opt out, then they'll do that. Am I making sense or no? I don't know. I may not be making sense at all, but if
That the enforcement is in the hands of the bus driver?
that the enforcement would, I mean, if they're the bus driver, it would be in their hands, and then it's consistent. Because what's the argument? You're going to make mask optional on a school bus where everybody's packed in it, but then in a school where you can be spaced out, we're going to opt in? Like, to me, that doesn't make sense.
Yeah, that's why I was, except we're kind of hampered. That's why I was ready to just say, just make it mandatory, and then parents can choose whether or not to put their kids on a bus. That would have been the simplest route.
But that's the yellow light.
But that's the yellow light.
line.
That's the yellow light. Well, you know, it's good to push the envelope.
Well, yellow don't mean stop.
We think it's yellow. I don't know that we think it's yellow because
Yep.
nobody's actually ruled yet.
Yeah, yellow doesn't mean stop. It just means proceed with caution. So I think we could try that.
It means your attorney's heart rate is going up. That's what it means.
Well, and I'm just, as you know, I'm a huge advocate for transportation because of all of their challenges with rolling kids around this county and trying to do it safely and on time. So that's my only dog in this fight. And I am hearing a little bit about how complex it would be with the opt-out. So.
And Chair, or we have some serious situations with transportation, trying to get the number of kids, 21,000 kids to school every day, as safe as we can. As safe as we
And
can, with the shortage of drivers, so. I'm in for it. If you say we're gonna do mandatory, I'm in for that. I know that gives our attorney heartburn, but.
Just joking. Fine.
I mean, we do have some schools that don't have bus transportation at all, but, so, I mean, but just help me on statute there. Statute says that we're required to provide transportation.
Right, the thing that I would make sure that we don't do is if we tie the choice to wear a mask or not to, I'm not saying this is what the board has said, but if we tied that to their decision to mask up on the bus or not. In other words, if we said we're going to make masks required on the bus, period, and if you don't like it, you've got the option not to ride the bus. The challenge that we could face is that someone could say, not everyone is equally situated to make the decision of whether or not they can put their kids on a bus or get their kids to school otherwise. And so we could face some equity concerns, some diversity concerns, some other concerns regarding who can effectively do that and not, which would be, I'm sure, part of any challenge, and it may end up being the only part of the challenge that wins if it went to court. So, there may be other things that don't, but I just would want to make sure we shape that carefully.
Does the governor's order say anything specific about buses, or just?
I don't believe so. I can try to review while you guys are talking, but I don't believe that it specifically makes any distinction.
And we were mandatory on the bus last year. So as far as the accessibility, but again, there's always, we have special needs kids that, due to the nature of their disability.
And they were excluded.
They were, yes. Well, they still got to ride the bus.
Yeah, I mean, we weren't forcing them to wear a mask.
Correct.
They opted out.
We opted them out.
Some of them are pretty good at opting out themselves out. Hard as we try. So that's an interesting conundrum. We have had it mandatory in the past. We know that buses are overcrowded. They're vectors in that sense. If anybody, it's the air conditioning is on. I believe that's recirculated air. Maybe there's some fresh air coming in too, but not that much. We know the buses are very overcrowded. But what kind of legal ground are we really on when it comes to the governor's mandate? Because we've agonized all day over this to try to walk that line to make things better without making things worse.
Or would we be in compliance? I'm not going to say would we. I think we would be in compliance because we can't right now social distance on the bus. We can't social distance because of the sheer number of kids. I think we would be okay going with the mandatory policy on the bus because we have a number of kids on that bus. The space isn't there, the social distance.
And a great point, Board Member Cummings. And what about the case where there are only a few students on the bus that they could socially distance? I think we need to be clear about that.
If that was the case, then
Maybe a few routes.
Yeah, the bus driver have that
Probably a few.
discretion to say no.
Because that's what we're saying on campus, is that if social distancing can be achieved, then you don't have to wear a mask. And there are some buses where
Staff. I'm sorry, I didn't understand that. So you're saying that if students are able in a classroom even to socially distance, then they can have their masks off? I don't think that's what we had said.
Just staff.
Just staff had that option. So this is where we're getting into the details.
Well, right, and we're still fleshing that out because when they're outside, we said absolutely.
Right.
They don't have to wear, but if there's 3 kids in a classroom because the other 20 are quarantined, and they're able to sit 6 feet apart, I mean, that's a teacher discretion thing, and I hope that.
And I think even last year, there were some classrooms, like they would have mask breaks, right? Because
They would go outside usually.
after a while, or they could be in the back, and they had probably tape on the floor, like Miss Sandy said. But if they had that space, they could just take it off and get a breather, because sometimes the masks get to people, or students, and they need that. So maybe if they're socially distanced, I mean, we can nitpick this all day long, and I see you shaking your head, but realistically, if I need a break from my mask, I'm okay stepping away and pulling it off. I don't have to follow rules to tell me that I can't, if that makes sense. And that's when, to me, common sense and a little bit of logic comes in. And we don't want to put so many boundaries on here that it's unrealistic. you know,
I agree.
and again, with the goal, we know masks are not 100% anyways, we're just trying to alleviate what we can.
So I think what I'm hearing, a direction is that on the bus, face coverings will be worn unless social distancing can be achieved, which, how often is that really going to happen on today's buses? Not that often.
Unless you're the last one getting dropped off.
Yeah, if you're the last one getting dropped off, there's your mask break.
Yeah, if you're the last one getting off, or you're the first one getting on.
Yeah.
So, I'm good with that.
Are you good with that, Attorney Powers?
I would have to do further research to give a firm answer, but at this point, nothing I can see would inform me that we would run afoul of any. It would be a matter of potentially running afoul of interpretations of what's there, not any clarity of things that are there. So I can check and see whether there are other guidance that has been provided. A starting point might be to look at what some other districts are doing, not that they might be doing it any differently or that any way that they do is better than ours, but they may have gone through some case law review in order to determine that particular issue, and I'll see if I've seen anything valuable or useful regarding that.
So where are we for?
As of now, I see nothing that tells me that we would plainly be in any sort of violation, unless we chose to interpret it in a particular way as opposed to another way which is equally susceptible of interpretation. So I think we're okay.
Okay. So the starting time for mandatory face coverings for teachers is when?
Teachers and staff. I mean, teachers and students on the same day, right?
Or well, let's just say employees and
Right,
students.
staff and students.
Thursday? Is that what we settled on? Okay, I see some nodding. Okay.
Is that what we're saying, Thursday? Okay, I thought it was tomorrow, I don't know.
Tomorrow's gonna be, I mean, it's 15 till 6. Like, I don't know how we're getting information out. And we don't have masks on campuses in order to hand them out.
That's right, so we didn't say tomorrow.
Oh,
I thought
Wednesday?
it was Wednesday, but we could have said, oh, at this point,
Either or is fine with me. I'm not gonna argue that point.
if there's,
Wednesday or Thursday is fine.
Thursday morning.
there we go.
August 3rd, 19th, August 19th. Thank you. I hate to ask, Madam Chair, but could we revisit the language? Could you provide a recap of the language of those provisions for facial coverings? Social distancing, what is the language for employees, for opting out, and for students?
Well, I
Or
think that we've
Attorney
got,
Powers.
yes, we've got a good framework for that in our resolution. So let's start with that, and then we'll fill in any blanks that we need to, because we want to know our own policy.
Well, would you like for me to recite where we are as of now? Okay, as of now, pull up the, sorry, I've got a few different things open here. I'm sorry, this is going to take me just a minute here because I've got
Or take your time, or,
got the
anything we
governor's
haven't
stuff,
covered?
the Surgeon General stuff, and also the draft resolutions, so.
Like area superintendents, anything we haven't covered that you guys, any emails you're getting, any texts you're getting. We don't want another orientation scenario. Please let us know. Is there anything we haven't covered?
well, there's always going to be questions. And I'm hearing from an elementary school teacher that they love the idea of having the notes because it's hard to monitor skyward while they're teaching for any changes.
Okay. Here's what I have. The text of the resolution as of now, I can go through all of it, just this draft or a portion. What I'm starting out with is, I'll break it down by sections. It's a resolution of the School Board of Marion County, Florida, mandating face coverings with student opt-out provision, requiring that all persons that work, attend, visit, or enter upon school district property to wear face coverings on all school board property to stop or slow the spread of pandemic or epidemic events. Then it goes into a recitation of the applicable statutes and governor's executive order and Florida Administrative Code. From there, it has a number of whereas provisions, which are similar to our prior policy. We go into definitions of face mask, face shield, or face covering based on what we'd talked about earlier today.
Which does not include the gators.
Right.
We had that conversation last year. Okay.
Face coverings required, the definitions I had, face mask, face shield, or covering shall mean a uniform piece of material that securely covers a person's nose and mouth and remains affixed in place without the use of one's hands, whether store-bought or homemade, consistent with CDC guidelines. So is that the definition we want to maintain? So that would include what you're calling a gator, or no? The things that pull up over the face?
We were told last year that the CDC felt like they just weren't effective, so.
And if I may, my recollection is we anchored it to the CDC guidelines so that if it changed, we didn't have to come back and revisit the language.
Okay.
Right.
All right, so because it's anchored to CDC guidelines, that's fine. Then Section 3, this is the operative section, face coverings required. Every person working, attending, visiting, or doing business with the School Board of Marion County, Florida shall wear a face covering consistent with CDC guidelines while on school board property, including but not limited to, and I had put this, buses, hallways, classrooms, cafeterias, restrooms, administrative offices, the school board meeting room, etc., when not maintaining social distancing from other persons.
Okay.
Good so far?
Yes, and then. Yep.
Then the exceptions. The exceptions were A, a student whose parent, guardian has elected to opt out of the face covering mandate. B, persons observing social distancing in accordance with CDC guidelines.
And are we saying 3 feet or 6 feet is this current CDC guidelines?
It's 3.
So right now, you and I are far enough apart that this is socially distanced.
No.
That's not 3 feet?
No. The CDC is 3 feet. That's where we are.
That's a yardstick.
They dropped it from
6 to 3.
3.
Yeah, so you guys are far enough apart.
Yes.
No, we're not. Isn't that 3
Your
feet?
foot's not. My face and your face are at least a yardstick apart.
My foot is, I wear a size 12 shoes, so I know.
Oh my goodness.
Oh, boy.
So I know we're not 3 feet. So,
Okay, but I think you had it
I know
that
what you're
way
saying
in
now.
case the guidance changes.
Right. That way, we don't have to revise our
Right.
resolution every time that there is a modification in the CDC
Right.
guideline as to that.
Right.
Now, that being the case, we're tying this to the CDC guidelines as opposed to the Surgeon General of the state of Florida's advice, which may differ on particular issues.
But we're going to be consistent with CDC guidelines throughout this. I mean, we have to try to be consistent with something.
I think we should try to be as consistent with.
Now, that does mean then that as the CDC makes its determinations as it goes, even if that may be in conflict with our state law or governor, that would mean that our guidance would have to follow that with this resolution. As to the definition of a mask, for example, or as to what social distancing entails.
So is this premised on our local health department? Or, which entity are we following that we can be consistently?
Well, when we started all this last year, we started with being consistent with CDC guidelines. Am I right, Superintendent?
Correct.
everything. So I think we need to stay with the CDC. As it drops, we drop. If it goes up, then we have to be flexible enough.
The only two things that I see that it's directly tied to are definition of masks and what definition of social distancing is within our resolution. And, you know, if the definition of masks changed radically, we may wish to revisit that. Or if the, you know, but the definition of social distancing probably isn't going, it's going to be, you know, whether it's 3 feet today or 6 feet tomorrow or something else. I don't know. Again, C is, oops, one moment. Persons for whom a face covering would cause impairment due to existing health condition. This exception requires physician's note that said individual has a condition that would be impaired and or exacerbated. Persons exercising while maintaining social distancing in accordance with CDC guidelines. Persons eating or drinking while maintaining social distancing. Persons under the age of 18 while participating in youth sports, provided that social distancing is observed to the greatest extent practicable.
Oh, I'm sorry, Attorney Powers, may you go back to the section about the exercising?
Yes.
So that would mean indoor PE, socially distanced 3 feet. Students can take their masks off?
Yes. That would be what this would indicate. Persons exercising
Right.
while maintaining social distancing in accordance with CDC guidelines.
So if students are outside, we know what that looks like. But if they are indoor PE, which we've been talking about indoor PE a lot lately, so if they're indoor in a gymnasium, in a multipurpose room, whatever that might look like, if they are in PE, indoors, at least 3 feet, then they can be without masks.
Yes, so long as that remains consistent with the CDC guidelines. If CDC guidelines change in such a way that says that indoor exercise requires a greater social distancing of 9 feet because of increased exhalation or whatever it may be, then that would obviously change.
Right.
Okay, but we're good for right now.
Right.
And for staff, if they have a medical condition, they would need a doctor's note, correct?
Correct.
Okay,
Same applies to visitors to campus.
right.
Because this starts with no person shall. Then persons under the age of 18 years old while participating in youth sports, provided social distancing is observed to the greatest extent practicable. Students with disabilities and specialized programs whose documented disability would preclude their ability to wear a face covering. Public safety, fire, and other life safety and healthcare personnel, as their protective equipment requirements will be governed by their respective agencies. Persons communicating with someone who is hearing impaired, where the wearing of a face covering would impede communication, provided that social distancing is observed to the greatest extent practicable. And persons for whom the requirement to wear a face covering would cause a conflict with the Americans with Disabilities Act, provided that social distancing is observed to the greatest extent practicable. Children younger than 2 years old, which probably isn't going to be much of an issue in ours. We do have
3-year-olds.
young mom programs and things like that as well. Anyone who is unconscious, incapacitated, or otherwise unable to remove the face covering without assistance. So it could be an individual with physical disabilities as well. Section 5 goes into enforcement and penalties. The way I just took it exactly from the prior policy, which is for students whose parents have not opted out, which language I added, it's a level 1 dress code infraction. For violations by employees, which would seem that the only way that an employee can get in a violation is if they're not following social distancing guidelines and they're unmasked, because otherwise they have the, they wouldn't be in violation. What it said in 8.90 that we did before was violations by employees may result in an infraction for insubordination, willful refusal to comply with a direct order, may lead to disciplinary action in accordance with employee discipline outlined in school board policy, and with the collective bargaining agreements between unions and school board. So again, unless that language needs to be revisited, that's something we've already been through to create that language, so nothing new there. Violations by visitors, public and individuals doing business with the district. will result in the person being asked to wear a face covering. Failure to comply will result in the person's removal from school board property. And then a final provision, again, this is from one of our prior resolutions, applicability. Any provision of this resolution that conflicts with any state or federal law or constitutional provision, or conflicts with or is superseded by a current or subsequently issued executive order of the governor or other authority, will be deemed inapplicable and deemed severable from this resolution, with the remainder of the resolution remaining in full force and effect. Resolution applies within the jurisdictional limits of the School Board of Marion County, Florida.
Okay. What about singing? We'll just do what we were doing last year?
I don't have a specific thing that we've put in there, but provided that they were social distance, I don't believe that would make any, that would be,
Okay, because I'm thinking about fine arts and you know,
Playing
theater. Yes, theater and things like that, and when you're, you know, doing
and I'll have
pantomime.
to search it, but I know that we had, it was either part of a proposed policy or one of our early versions of a resolution in which we did have something specific to musical instruments, and I can look that up and add that language so that it's clear and specific and no one has a question about it.
Okay. Because, yes, go ahead.
I'm sorry,
no,
Madam
no.
Chair. My question is clarification on the outdoor nature. I wrote, and I heard at the beginning, Attorney Powers, face coverings on all board property. Thought I heard the board talk about except for outdoors based on guidance. Is that correct? I just wanted to see that we have language on being outside, i.e.
Right.
PE, recess, activities outside.
Yes, and I'll make sure that that's.
I didn't hear
Clarified.
it, so I just
Nope,
wanted to.
You're correct.
Okay. Is that
It's really
that was
important.
the decision of the board? Thank you.
Because we want to encourage teachers. I think Principal Manresa said it best. You know, teachers are really empowered with choice of where to have their lunch and, you know, to be outside and separate and use their good brains.
Thank you.
So outdoors, musical instruments, and making sure those things are in there,
Singing.
singing.
Mm-hmm.
And at one point, when we were first talking about this, we were putting a day limit, like a 30 days, 60 days, something like that. But from what I understand, we're going with the 10-day, or excuse me, the 2 weeks of the 10% and the 10, or
9.9.
100 to 100, 100 per 100,000 cases.
Right.
And just for clarification, I'm not sure whether you want that in the resolution, because the resolution can be modified at any time by action of the board, and that can include at a work session, or it can include the work session would be, you can give consensus for it, and then at the next school board meeting, you can modify or eliminate the resolution if need be. That is something that the board would be updated regularly, more regularly than every school board meeting. The board would be updated regularly with this information and can make its decision at any time to modify or eliminate the resolution. My suggestion would be that we put the resolution in effect. The resolution can be in effect for a maximum of 90 days. That we set the resolution for any time frame that the board wishes, and then as part of its expiration, it expire within whatever period that is, or upon action of the board. Tying it to an automatic trigger within the text of the resolution may make it more difficult, actually, than if you consider that information and make a decision together to end it at any time.
I see. So
The question is automatic trigger versus a trigger that is controlled by you.
Well, we asked for the medical provider's advice and the substantial, getting into substantial, there's very definite parameters there. And so, and that's what we said. So I feel like that's what should be in it, because then we're saying to the community, we're going with what we said, and we're putting that in writing.
Understood.
And Madam Chair, we are going to include tracking this data point on our website.
Good.
So we're going to include this along with our other data points, the charts that we've shared. We're going to have this in there with the link so they can track and monitor that as well.
That's great. I think that that'll be very motivating for people. I pray that it will be, to keep doing everything that they can do within their power to help us get these numbers down.
Is there a duration, Madam Chair, and board members, under which this needs to occur? It falls to a certain percentage for a certain number of days?
2 weeks.
2 weeks.
For a 2-week period? Okay, so that,
Be consistent at that level for 2 weeks.
Yes, it was 2 weeks.
okay.
And it was the percentage and then also the per 100,000. And that would have to be 50 consistently for 2 weeks, between 50 and 99 per 100,000. Or at least, what is it? High to substantial is 8% to 9.9%.
You have to be at substantial for.
Or less, or lower.
Substantial or less for 2 weeks. At least 2 weeks.
I mean, if it's lower, great, but it has to be lower than substantial. It has to be.
Now, if after the 14th day, this policy would expire on the 14th day then of that occurring. If on day 15 it starts to creep back up, then we'd have to revisit anyway, correct?
Oh, you're such an attorney.
Well, yeah, sorry.
But it's true.
Okay.
Yeah.
Thus, then, it sounds like the proper thing to do would be for the resolution to be set for a longer duration instead of a shorter one, if the trigger is going to be linked to this. Because otherwise, in 30 days, we'd have to go through what we're doing again now for a new resolution, and we may never have hit that 14-day mark yet. So the maximum period of time for resolution is 90 days. If you did it for 30, it's going to be difficult to reach that target. We may do it for 45 or 60 or whatever day range you collectively decide. Up to 90 days, maximum.
Well, it probably doesn't look like it's going anywhere. I wonder if we should just have a resolution and then make it policy again like we did last year with these different guidelines. So that way we're not, can we just keep renewing a resolution, I guess? Or is there laws of one resolution and not?
We can renew it at least one time, right? Before we have to take it to fall.
Right. We would have to have a new one. We'd have to go through it again. But yes, it doesn't have to go. We've learned a lot, I think, today in how we're doing things. So answered some questions. I'm sure by the time 90 days was up, we'd have a different set. I can be ready to prepare either a resolution or a policy which is tied to whatever medical advice I'm given by DOH for that to expand beyond 90 days or after. If we need it to be a policy, it can be a policy. If it needs to be a procedure, it can be a procedure. Either way, we can write it in such a way that it maintains flexibility with times. I'm going to have to be careful in my drafting to make sure that it's, well worded and tries to anticipate all the possible problems.
Maybe we should just make it a resolution now that I think about it. So if we learn anything in these next 90 days, then we could change it up because it's always changing, So rather than put something set in stone, it gives us a little buy-in time to see if what we're actually putting into place is working or not.
So I'm hearing that perhaps 90 days with the triggers in advance that could terminate it earlier than that.
Right.
And then at that point, we would revisit what to do, whether it's we resuscitate the resolution or make it into policy. Either way, perhaps incorporating those triggers that we talked about.
So those triggers give us like an opt-out, an early out, basically.
Right. If we hit those guidelines, then the resolution would no longer be in effect.
Okay. I'm fine with that.
Are you fine with that?
Yes, I'm comfortable with that.
Okay.
And as we've increased, we always communicate with the Department of Health. We'll provide those updates, absolutely.
Okay. And Attorney Powers, are you comfortable?
I believe so. I still have to do some research on the bus issue. That's the only one that I may need to revisit to the degree that I can. So what I would like is the board's sort of direction that allows me to render an opinion to you on that is more definitive over the period of the next day or so. That way, because I can write it for either way as to that issue, but I don't want it to be something that causes the rest of the document to either A, be delayed, or B, be flawed.
We have a work session on Thursday, correct?
We do. We have a work session Thursday.
So
That'll be here before you know it.
that'll be enough time to give you.
Well, let me see if I can pencil it in on the next, the next 48 hours that all say nothing but school board resolution work, So that's what I've got. This is the absolute main thing on my calendar, so.
Thank you.
Yep. Appreciate it. Okay.
Where we at?
Okay, that's all that I have at this point.
All righty.
Anybody have any clarification questions for me that I might need to seek your input on? Anything I haven't asked that you might need me to advise?
We know if we think of anywhere to find you.
That's true.
And there's the intrepids here in the audience. I've been trying to monitor your facial expressions and body language. And is there anything that you're thinking of? Please don't wait. We're here late. So if there's something that you want to bring forward for the good of the cause, please feel free.
Sorry. Mr. Powers, you were reading about, you said athletes under the age of 18 that compete in youth sports, but we have some seniors that are 18 as they compete in youth sports. So I didn't know if that eliminated them or if that was...
No, the only reason that I had that was that according to the CDC, their list of guidance for schools, it had listed that persons under the age of 18 years old while participating in youth sports, provided that social distancing is observed to the greatest extent practicable. Of course, I don't think that's intended to exclude, but at that point, at age 19, I think even though they're a student, the opt-out provision may be a little different as well. So I can just indicate students while participating in youth sports as opposed to persons under the age of 18.
That's what I thought.
Because I don't think we have intramurals through MTC or anything like that are really going to be applicable here. So.
That was my question. Thank you.
Good question.
Mm-hmm. See, great ideas come from everywhere.
Absolutely.
And questions. Anyone else?
So are we about clear with the message that we're going to put out for tonight?
Yes. What is the message?
Kevin?
Yes.
What-
He wrote it. I knew he's been sitting there writing.
He's been,
the whole time.
oh yes.
All afternoon.
I've had my eye on
I
you.
sounded like the lady from Home Alone. Kevin?
I feel home alone.
You have us.
I'm on page 5 of notes.
Oh.
My biggest question is, I'm a parent who opts my child out who has to ride the bus to get to school. So does my child have to does my child have to wear a mask to ride the bus? Because I didn't hear that answer.
I believe that's what we were saying.
We said yes.
So I'm opting out, but my child can't ride the bus to school.
That doesn't,
They
that's
can
not
ride the bus to
consistent.
school. They can ride to school, right?
They can.
With the mask, right?
Oh.
But I've opted my child out.
What he's saying is that unless they put on a mask, then they can't ride the bus, whether they've opted out or not for in school.
Even with medical opt-outs.
Medical opt-outs are different.
They're not, but they're not.
But they're-
I mean, they are, but they're not.
But we weren't classifying them as being different in this particular.
Kids with
resolution.
disabilities have a documented medical condition.
I understand, but
But the bus driver
but
would
the
have
parents
to
can
monitor
opt them
that.
out.
Well, they do, then chances are they're typically on a special bus. This is a conundrum.
I know, that's why I think it should just be consistent with, because the messages are going to get confused.
Okay, and my only problem with that is that, okay, we're going to be consistent, but we're going to enforce it inconsistently. That I may have to just accept that. But I hate rules that don't have enforcers. Otherwise, why have it as a rule? you know, and our transportation is struggling. We're trying to support them. What, Mr. Vianella, what do you think? We need help.
I think it's a very good question. I think we almost have to be on the honor system in the bus. And if the parent does opt out, then we expect the student to not be able to wear the mask and everybody else to wear the mask. And we're going to have the same type of situation in the cafeterias. And we're going to have students that have opted out, and everybody else who is therefore supposed to wear a mask. And it's going to be very challenging for our staff to know in that setting, in the hallways, in between classes, who is opted out and who is not opted out. So I think there's going to have to be some trust but verify that our students are doing the right thing. And I think we can get the list to bus drivers so that they have an idea of who is supposed to opt in or who should be wearing a mask and who's not, and ask the bus driver to try to enforce that the best they can without necessarily having to write referral after referral after referral. A reminder when the students are on the bus. I don't have a note from you. Please put on your mask. Here is a mask for you to wear.
Mm-hmm. Okay. And
Legally, I would be more comfortable with Mr. Vianella's suggestion, and as a matter of enforceability and everything else, I really don't know. But as I said before, I am comfortable with the fact that we can make it work either way. That is at least a path of lesser resistance, though that may not be the choice that the board wants to make.
and that's what we were hoping for from the beginning, was a sense of honorability where people were going to do the right thing. And we're still sitting here at, after 6 p.m., making it very clear to the community that we are in serious trouble. And so if there was ever a time for honor, this is it. All right. Thank you. So we'll go with it. We'll go with if someone has opted out for the bus, then it extends, or opted out for school, then that extends to the bus. We'll pray that there's honorability.
So for clarification, it extends to the bus, any transportation, extended day, anything school-related.
Yep.
Correct? Thank you.
I love the idea of having a link to be able to monitor where we are. I really pray that is going to be very motivating. I'm looking forward to monitoring it. It'll probably become my new obsession. They coming down yet? All right.
There are still those cases where I had a teacher tell me 2 weeks ago that they wanted to ensure they had masks on their campus because maybe their parents don't want them to wear them, but they want to wear them at school. So, I mean, we still have that. Even if the parent opts you out, you still, as a student, I mean, the enforceability of that falls again to the teacher. The teacher's not going to tell you to take off the mask if you've had an opt-out in your. I mean, are we gonna say that? Probably not. I mean, I'm wanting to make sure that's one thing we didn't cover. So say that the parent has opted the student out, but the student is choosing to wear a mask. We're not gonna have that teacher tell the student that they have an opt-out, right? I'm just, again, so one thing we didn't talk about.
You're going to have that. We're going to have that because, at some age, kids think that all their parents are crazy anyway.
And they're going to.
I just want to make sure we're putting
do the opposite of what we tell them to do anyway.
We're putting a lot on the teacher, so I just want to make sure that the teacher, if they're dress coding for one, they're not going to dress code for the other. That's the only thing.
As a superintendent, I am concerned about putting additional burden on our team and our staff. So I would say, all the commitment of this board today and every other day, that I think the message should be well received and understood, and that we don't put additional burden on our team.
And we're grateful for the homeschool liaisons.
Yes.
Yeah, we are.
They're going to be a big
They're going to make their money now.
conduit. Yeah. Okay. All right. Anything?
Tell us the message.
Sorry to come back. I just need some clarification. Is it your expectation that a message goes out tonight? Because we will have additional information tomorrow, that once we have information posted to the website, and perhaps even an opt-out form that a parent could go to the school website and download, that would be another message tomorrow night. So I just,
Are we saying Thursday is our day that we're starting? I think a
Yes.
message on Tuesday and a message on Wednesday. So we have back-to-back 48 hours, and maybe the messaging is a little different depending on what it is. But I personally think that that would give 48 hours, not tonight. People who want to know about it, know about it. They've been watching YouTube all day long. And so our message, that's my recommendation. Our message from Skylar would be starting tomorrow, whenever we do hopefully have some of these things already in place. And they can even, if they want to send a note in tomorrow, go for it. If you're listening to the sound of my voice, go ahead and send your note if you want to. Otherwise, they can send them on Wednesday and then Thursday, if that's.
We could
pleasure.
post something on the website even tonight to say that we'll be sending out a message with further information.
we can, yes, ma'am.
Yes.
And it's already on Ocala.com.
Oh, yes,
Certainly
sir.
it is.
So
I've spoken with 4 different reporters today.
so they're gonna be looking for something, so.
Yes. Yeah, and I think it would be great to put out a little message to them, say, thank you everyone for your commitment and your passion and your participation, and together, we're gonna get through this, and more information to come the next 2 days.
Thank you.
Okay.
That's it, Kevin?
That's it?
I have 5 pages of notes.
He hasn't written his Skylark message just yet, me.
Okay. Anybody else in the audience? You're just waiting for us to adjourn.
Motion to adjourn?
May I clarify, you did say, this is an easy one. You did say you wanted me to go ahead and write not the policy, but the resolution for 90 days with automatic triggers, right?
Yes.
Okay,
Yes,
that's fine. Thank you.
all right.
Triggers being those data points.
Yes. And I'll need to get copies of this because I don't have that currently, so, but,
So that would be attached to that resolution.
yes.
Great. All right.
Thank you,
Ms.
board, for
Martinez,
being
look-
patient with your attorney.
Oh, thank you for everything you're doing.
So,
Martinez Lopez, anything from you? No. Okay.
so are we clear, is going forward, are we clear where we are for tonight? Or are we still muddy? Let me restate what I think. Let me say what I think, what I heard. There will be a mask policy or resolution coming forward for 90 days based on those data points that we received from the Department of Health. Correct? Parents have the right to opt out of this mandatory mask policy by simply a note, which they can start sending tomorrow, or by some form that we're going to give them. The district will provide some type of way, whether it be through Skyward or through a paper form. Am I right so far?
Mm-hmm.
The same policy would be in effect also for our buses, transportation, or to any extension of the school, which includes extended day and those types of activities. Sports, where we at with sports? Because those questions come in. I can't remember.
They're
what we
all
said.
operating at 100, or at the capacity. We're not limiting capacity. Indoor sports are going to still have the same opt-out option. We'll have masks available for visitors when they come in if they don't have them on.
Social distancing will be
Social
encouraged.
distancing will be encouraged.
And the effective date of this is Thursday, the 19th.
Correct.
Yes.
In addition to that was the outdoors. They don't need to wear them
Right.
outdoors when you were asking about
Yes.
athletics.
And that staff does not have an opt-out,
Except for,
except for medical,
right,
but they do not have a signature opt-out.
not a signature opt-out.
Correct. So I just want those things to kind of be restated so that at least what we're saying here is clear tonight going forward.
Outdoors and with social
Social
distancing,
distancing.
staff may be have
Unmasked.
no face cover.
Yeah, social distancing is important to,
Yep.
so that's clear.
What about, I'm going to throw this out there because we've already heard about, what about the staff members that have already had COVID, right? I mean, they're saying, I got my shot and I've had COVID and I'm still having to wear a mask. I can tell you that's coming.
Well, because of this variant, that people have breakthroughs with it, I think we still need to.
Yeah, but if they had it recently, like they had, I mean, not that they would know, but I'm just, it's coming.
Vice Chair King, you raise a great point, and I would have to refer back to Mark Lander, because once you've had it, you have the 90-day window where apparently then you are not as likely to transmit. But I am not the health expert, but that is something that has come up during our calls.
Right. So
The 90-day following.
They can give us documentation?
If they had that, then, because it just gets muddy and tricky, but I see their point, if.
Yes, I myself.
Well, but again, let's not lose sight of what we're trying to do here. And, I would think that if you just recently had COVID, that you would have proof of that. And if you have gotten the vaccine, is that what you said?
Yes.
Too? So if you've just recently had COVID, usually you're not really eligible for the vaccine though for about 90 days. They want you to wait, right? Or not?
I'm seeing my doctor tomorrow to find out.
It's 90 days.
But I think I have wild wait.
Yeah, with my husband, it was 90 days back in the winter. So they're not going to be vaccinated. They will have just been recovering from COVID. So in my mind, and I'm not being a health expert, but you probably might be still feeling weak, whatever.
But they could have had the vaccine and got COVID.
Oh, I
The
see what you're
reverse.
saying. Yeah, well, yeah, I guess. Yeah, they could have had the vaccine and gotten Delta. Right.
We have exhibit A there.
Yes.
In which case, you're still kind of a petri dish.
every
I don't know.
Yeah, that is something as a board that you may wish to revisit, because it also, I can tell you that legally that is a moving target because of the fact that the requirements of whether or not an employer may ask for proof of vaccination or proof of COVID or anything else gets very,
Yeah, we're not going
Goes
to.
into
very
Slides
in
into
depth.
HIPAA real fast.
Yes.
Yeah.
And those kinds of situations might have to be handled on a case-by-case basis, where if the employee felt comfortable going to, because they really didn't want to have to wear a mask, here's what my rationale, here's my documentation, that's not for the whole world to know.
Right.
We're getting emails left and right. Why are we as staff not getting the option to opt out? It's going to be coming.
Okay.
Yeah, I received an email also that teachers are upset because they feel like a lot is on their shoulders and they don't think students should be able to opt out. But to stay in compliance with our executive order, that's why we have that clause for the opt out also. So, they're just thinking we're here making that decision, but we're trying to put all of our pieces together.
And while you're mentioning that, and I do want to ask Ms. Boston-Ellis this, sorry to ask it to you publicly, but there's been a lot of information out there that says that the federal government will pick up the tab if we happen to, but isn't that the ESSER funds that we've already sent our grant application in to say this is how we're planning to spend the ESSER funds? Like, it's not additional pockets of money, right?
No, the letter that you are referring to, I think it was sent to superintendents and basically said there was a way to balance the salaries out of board members or superintendents by using the ESSER and the ARP, which we don't even have yet.
Right.
So that was a way to offset the notion that you would get your salaries cut.
Right.
So, yeah.
So just for clarification in the community, we've already sent our application how those ESSER funds are going to be spent, and that was not included in that. So people are saying, oh, they can use the federal dollars if, in case they do get cut from the state dollars or what have you, and we have.
Well, there's still another pot that we're eligible for.
The American Rescue Plan?
Mm-hmm.
Okay.
So that was from the letter, but I mean.
Okay.
We still have to get our funding from the Department of Education. Just keep that in mind.
Yes, and I think what I'm hearing you say is that it wouldn't be new additional funding. Like, you already got this much money, but now if your salary is being threatened or whatever, then we're going to give you additional money to cover that. That's not what that meant, right?
Correct. They're saying that we do have federal dollars that could be used.
Used for that. Okay.
Right, but we had, those dollars are federal through state. So they're in the hands of the state, and they come to us. We have to apply through the state to get those funds. So I'll just leave it like that.
And I would like to hope that no one sitting here is making decisions on behalf of our salaries as the primary driver, and I would say that that's been made very, very clear, considering that we're still sitting here.
Right, not at all. That was not my intention. I just wanted to clear up some misconceptions that I have seen and
Right.
read in the community.
Right, and you know, some of those things you just have to let it stay up there. Let's do what we need to do. All right. I'll say it again. Anything else?
Executive Order Number 21-175 is entitled Insurance, is what Ms. King was referring to, is entitled Ensuring Parents' Freedom to Choose Masks in Schools. And that does not say ensuring staff's right to choose masks or not. That's what we're responding to, not only the medical frameworks that we're being given, but also the legal frameworks that we're being given. And that's specific. We're required under 21-175 to give that opt-out provision. So.
For students, okay. All right, and I circle back to people's memories get short, but we've done a ton to try to accommodate our employees, throughout all of this. And now we are asking for them to work with us through this hopefully very short period of time till we can get these numbers down and then have our celebration of some sort. Okay, well, great work today, everybody. Thank you so much for your dedication, for your passion for trying to get it right. We had a lot to broker here today. I think that we took wildly different perspectives and passions and hammered out the hopefully what's going to be a decently workable plan for the short term, something that has deliverables, something that has criteria, and something that we can all monitor. And let's do this. Let's do this. So with nothing else to be said at this point, we will say.
Yeah, I already made the motion.
Okay, there is a motion by Board Member Campbell, second by Board Member Cummings. All those in favor say aye.
Aye.
This meeting is adjourned at 6:33 p.m. Thank you.